हेलो हेलो हेलो। ले रहा है इनपुट। हेलो हेलो हेलो। क्या है ये? हेलो 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 हेलो। हेलो 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 हेलो। Can we start? Good morning, everyone. Vaccines kill. So today we have all gathered at the Press Club of India. Today is 19th November, and we have gathered here to record the testimonials of various vaccine victims. So their families have gathered here. Plus, we will have some keynote speeches from Dr. Amita Banerjee, Professor Bhaskaran, and then Professor Dr. Deepak Natarajan, and Prashant Bhushanji, who's an advocate of Supreme Court. He'll be here later in the day for his keynote speech as well. And then we will also have uh, uh, Advocate Gonzalez as well here, Colin Gonzalez. The press interaction will start after 4. And until then, we will record the various testimonials of the families who are present here. So with that, I'll hand over the mic to Shri Venugopalan Govindan.
Yes, sir. Can I keep it there because I need to run some slides also. If possible. Or is there another mic there? This can be used. Okay. Good morning, all. Firstly, thanks for making time to come, especially for those who are not impacted and who are still here. And this is a very solemn gathering. And as Dilipji said in the morning, it's a very useful and important gathering, but not a very happy gathering. But we are here to ensure that this sadness should not befall on other families ever again. And those who have already suffering, they should get justice. These are the two objectives. So I would like to just start. Today, me and Pavanji, we are going to, the first half an hour, we are going to talk about on the subject from blind faith to awareness. That is, as parents, like we were in, I'm sorry, I am not able to talk in Hindi or other regional language where we can really reach more people. It's my limitation. So here, basically what we are trying to say is, like we started in a blind trust, like when government came in TV and said vaccines are going to save, COVID is killing people in thousands and lakhs, and the vaccines are going to save everybody, and it is very safe. And you rang up any phone, the caller tone said like vaccines made in India are completely safe. We trusted each of them. So that really landed us in deep trouble, as we saw after we vaccinated our children, after we saw them falling seriously ill. It's not like something which any of us can imagine in our lives, not the kind of diseases what we have seen in life. It's something kind of out of control. And then that is when the truth struck us, like this is not what we were told, propaganda, this what we saw was propaganda. So we realized that, and then we lost our children, and after that, the journey to find the truth and to stop this from happening to others both happened parallelly. Within a week of my daughter's death on 16th July, I wrote to PMO portal an impassionate plea requesting him, the PMO, to investigate this and stop. Little did I know that I was kind of placing my hope in institutions that don't even listen to these things, because later I came to know Dilip Lunavat sir had a very bad experience in the month of February 2021 itself. Long back, my daughter took the vaccine on June 8th, and he had already pleaded with government, he had already pleaded with Serum Institute to stop this, and nothing had happened, even though his daughter died on 1st March. It was a very painful learning along the way, and as I was trying to reach to more people, like to the government, health ministry, to DG, Director General, ICMR, I wrote mail to literally so many people, collector of Coimbatore. Nobody, not a single person replied. And as all that happened, more shockingly, I came to know of more and more vaccine deaths. In August, I have most of the people here in that side, like they died in August, and then some more, and it was heart-wrenching, and it was something. It was a very emotional thing, basically, because on one side I lost my daughter, and on the other side I'm not able to convey this to the world so that other people will not die. So it was extremely heartbreaking. So then I was wondering, how come the government, okay, they started vaccination perhaps in a good faith that it saves life, but after knowing people die, why are they not stopping it? So this was the query, and I started digging more and more, and what I found was extremely shocking, and I would like to share with you all. Now, I am not talking as an emotional father. Please understand that I am talking purely based on data and facts, and what I am going to see is of relevance to each of you as well. Let me walk you through some data. Sorry, power is connected. Yeah, but can I talk now and it will not go there, right? Okay, I can understand. I have to use the microphone. Okay, understood. Okay. So first thing is, I would like to start with the necessity to start vaccination. Was there a need to start vaccination in this country? That is the first thing we need to look at. So when the vaccination started, that is January 16, 2021, India's COVID death rate was drastically falling. India's death was literally nearing the x-axis, actually. Left to itself, it would have stopped. Maybe that is the reason why they didn't even wait for Republic Day and they rushed it on January 16th itself, because there would be no case for vaccination to start. I don't know about that, but so it was very badly I mean, badly in the sense, in a good sense, like it was falling. There was no need to start vaccination, number one. And then the same graph, it is zoomed out. You please see that. See, the death graph is totally falling, actually. Jan 17th, it's falling. And February 24th, February 1st, 15 days, 16 days of vaccination, it falls. And then after we have vaccinated about 2 crore people, that is when it climbs again. And most of the deaths that happened in this peak are actually vaccine deaths masquerading as COVID deaths. Because what happened is, when elderly people went to the hospital for anything, they go for, let's say, dialysis, they will immediately do a COVID swab to check if it is RT-PCR positive. And the RT-PCR test is very unreliable. As you would have heard from Tanzania, what happened when the president swabbed papaya and goat, it came as positive. So unreliable is the RT-PCR test. And so with that, and that person dies for any reason, that is classified as vaccine death. I mean, sorry, COVID death. And if the person is vaccinated, there was a high probability that he could die from the complications of it. So and that is one thing. And the other thing I want to say is, they say COVID vaccines were done to save lives. Now, this graph, kind of, we are seeing 3 areas. One is Europe, other one is Africa and India. we see that this is the graph we just saw, the green one just a little above, the first small peak and then the big peak. And the bottommost one is the Europe. I'm sorry, bottommost one is the Africa one, where you have absolutely no serious peak. And Europe is, Africa is one of the least vaccinated places, and Europe was the most vaccinated, and you see how badly the death count is going there actually. So, the next one also brings in United States here. United States was the most vaccinated thing, and you see how these things are happening here. So there was no justification to say that you vaccinate and you save people. In fact, unvaccinated people were thriving much, much better actually. There was no justification for vaccination. And that's not just the only reason. Actually, I'm just continuing on that line a little more. See here, this is the share of people who completed the initial COVID-19 vaccination protocol. You have US, Europe, and this is Africa. So less actually, very little. And you look at the deaths. How many confirmed cumulative COVID-19 deaths are there in US? And this is all per million, relative population. So I'm comparing apples to apples here. So this is relative to population, it's per million people. So Europe and United States have such a high death count per million people, which were heavily vaccinated, whereas Africa, which was very sparsely vaccinated, hardly touched by vaccination, and you have very little COVID deaths. So actually, Africa was and is the control group, which shows that COVID vaccines actually killed people. You had more COVID deaths from COVID places where there were vaccination. In India, you had let's not forget, the big peak in India happened after we started the vaccination here, and it was driven by the vaccination. So another important thing. So what happened is, okay, I'm going into zero surveys. Now, there is zero surveys were conducted in India by ICMR in 4 different zero surveys. And the last zero survey in May, it said in Mumbai you had 41% zero prevalence, and Delhi 28%, the Vijayanagar, and different places. In every place, the point is you had a significant number of people already infected with COVID, and they had antibodies, and they were completely normal. There was no problem with them. So there was no reason to introduce vaccination when you had a high amount of zero prevalence in the country. And the next thing is, okay, now I'm going into why prior infection status was not considered in COVID vaccination. Like normally you vaccinate when you need to create, according to epidemiology, to create antibodies, you vaccinate. And you have antibodies, you don't vaccinate again. So when the country had high zero prevalence, why would you vaccinate again? So the zero positivity was increasing, and you again went ahead and vaccinated, which is a criminal thing. And also one other very important thing is, on December 10th, 2020, NTAGI, the body authorized to make immunization recommendations, National Technical Advisory Group on Immunization, they had a video conference, and in that conference only, it was recommended to do COVID vaccination. And in that, they made very clear conditionalities. What they said, see, let me read this. Concern was raised in handling of vaccine candidates that are later on found to be ineffective or significantly less effective or have safety concerns, as they might give rise to challenges for health system as well as at regulatory level. Concern over public trust on vaccines and immunization in general were shared. Therefore, it is important that all regulatory guidelines are followed of EUA candidate of COVID-19 vaccine. So there were a lot of conditions when placed when the recommendation was done. And it said it was shared that DCGI, Director General of, I forget the expansion, expects sufficiency of data from sufficient number of subjects. The phase 3 or bridging trial, which didn't come for a long time. So they kind of said that we are going to get that data. Then finally, they endorsed the recommendation based on 3 conditions. That is, the NTAGI endorsed the STSC recommendations on development of bioassay assessment capacity, suggestions on the prioritization of vaccine recipients, with the following points. A report on emergency use authorization of COVID vaccine, including informed consent component. Very important point. They said you can release this only with informed consent. But today in court, the government is saying we don't need informed consent for vaccines. And then literature review findings on conducting a serology testing prior to vaccination. Second point. And product specific contraindications of COVID-19 vaccines may be shared with the chairperson. And so they expected product specific contraindications, and they asked for actually a 4 week, 4 to 6 week monitoring actually. I hope I have that somewhere here. Yeah, actually, yeah. So that was so the NTAGI group specifically said that we need to kind of monitor for 4 to 6 weeks actively for the initial vaccine recipients. This was a very important point they said. So before going into this NTAGI recommendation, one other grave thing what we find is COVID, as the COVID vaccine trials were happening, in the trial itself, we had a serious problem. Let me introduce, I just mentioned about one trial participant called Asif Riaz, who was actually a well-educated and well-earning member of the public, actually. He was a computer graduate who did his post-graduation abroad. He came back, he was working in India. He really believed he wanted to contribute to the nation by taking part in the trial. He was told that 50 people had already completed trial, 500 people had already completed trial in UK. It is safe. Now we want one more detailed trial. And the participation list was given, and he kind of signed up for it. He believed he's doing a benefit to the country, and he signed up. And let us listen in his own words what happened to him during the trial and after that. And this gentleman actually, after he had these impacts, was really hounded by the public because because of his name, he was thought as somebody who's stopping the vaccination from proceeding with ulterior motives. So he was hounded by the public, hounded by media, and they kind of suffered a lot. Let me now play out his audio clip, which he said.
Good morning, good afternoon, namaste, welcome to you all. My name is Ansar. I was the first person to be admitted to a hospital ICU on account of a side effect of the Covishield vaccine. I was patient zero, so to speak. I was a part of the clinical trial for Covishield, a volunteer in the cohort or group which was meant to assess the safety of the vaccine. I was 40 that time and married with 2 kids. I took the first dose on the 1st of October 2020. After getting the shot, I was under observation for some time. Then the trial investigator told me to take Dolo 650 every 6 hours for the next few days and then allowed me to leave. I was fine, just went to a pharmacy for a strip of Dolo and went back home, completely oblivious that my life was about to turn upside down in a few days. My symptoms began early morning on the 11th of October. I wasn't waking up from bed, and I was just groaning with my hand on my head. My situation got progressively worse, and I was taken to the trial site hospital in an ambulance in the evening. I was admitted to the emergency room with altered sensorium, high sensitivity to light and sound, and unresponsive to command. I was just moaning, indicating pain in the head, and was completely abnormal. I was soon shifted to the ICU where I remained for the next 10 days. Eventually, when I gained consciousness and began to respond, I was shifted to a ward and then finally discharged at my insistence after 16 days. The diagnosis was acute neuroencephalopathy, an inflammation of the brain, the cause of which could not be determined, or rather, it was better left undetermined. 2 days after my discharge, two doctors at the hospital signed a serious adverse event expert opinion report, which, without giving any reasons or any explanations as to how the conclusions were arrived at, declared that my illness was not related to the vaccine. Later, I also learned through a newspaper report that an expert committee constituted by the Drugs Controller General of India also ruled that the vaccine was not the cause of my illness. It was a bitter pill to swallow because even though I was back home and out of danger, I was far from normal as I continued to slip in and out of extreme mood swings, depression, and infection for several weeks. The irony in all of this is that I was a part of the safety cohort, the only objective of which is to determine the incidence of serious adverse events causally related to the vaccine. Mine was the only case out of 1,600 volunteers where an SAE occurred, and yet the case was brushed under the carpet without any investigation. and without giving any scientific explanation on how or why it was deemed to be unrelated to the vaccine. As per the guidelines and the framework put out by the Ministry of Health and Family Welfare of the Government of India, the first question to be asked during causality assessment of an adverse case is there strong evidence of non-clinical consequences or cause other than the vaccine? In my case, despite all possible blood and urine tests and two lumbar punctures for CSF analysis, no alternative cause could be found for the insecurity. Forget about strong evidence. No evidence could be found. And they were left spreading theories about possible diseases that may or may not manifest in the future, but which somehow managed to affect my brain in the present. It was a desperate and laughable attempt to say something in order to wriggle out of the situation. I filed a writ petition in the Madras High Court in January 2021 with supporting declarations from some highly regarded doctors with explanations on how the causality could be attributed. I asked for compensation for my appeal, for the vaccine rollout to be paused pending disposal of my petition, and for the vaccine to be declared unsafe based on my experience during the trial. After more than 3.5 years, I received an order 3 months ago saying that the vaccine could not have been the cause of my illness, since that was the opinion of the expert committee in the first place. Apart from its completely erroneous conclusion, the judgment contains several factual errors as well, and we are now in the process of appealing against it. My fight is not against vaccine. After all, I was a trial volunteer who believed that a vaccine could stem the spread of COVID, and hence volunteered to help bring it to the people at the earliest. Having experienced all that I did, and with my family having gone through all that they did, my fight is for justice. It is a fight against the lies and the deceit of the compromised trial, devoid of integrity, which formed the basis of the emergency approval for what turned out to be a half-baked product administered to millions of people, your affected family members included. I'm aware that among you are many who have experienced loss of dearly loved ones, of children, pain that is far, far greater than mine. I can only salute your courage and your willingness to keep fighting for the justice of your dear ones. May God bless you all. May God bless our nation. Jai Hind.
Actually, I'm getting goosebumps listening to this gentleman who was actually so, what shall I say, caring for his countrymen. He believed in the initial lies that this is coming up and it's going to save. So he volunteered for the trial and he found that it harmed. He actually tried to his petition very clearly says that Covishield should be declared unfit for human use. That is the criteria. And also he asked for 5 crore compensation. He is actually somebody, see, let's not kind of look at the amount. I feel that amount is extremely reasonable for what he went through, but that's not the point. But the point is the press, what it made out. I remember reading that and I feel ashamed for thinking what I thought. But that's what press did successfully. The press which didn't come at all today. May I ask anybody from the press in this group now? Not a single person has come. Actually, I have sent invite to 70 email addresses representing about 40 organizations, detailing clearly this is going to be about COVID vaccination, and so many victim families are going to come. They don't turn up. I hope they will turn up later in the day, and I hope some of the press will prove me wrong. But the way they presented this particular news in those days was a trial volunteer tries to extract 5 crore from Serum Institute. This is the way they presented it. And Serum Institute kind of effectively shut them down by giving a counter defamation suit for 200 crore and they shut him down. This is the way it was presented, more or less. I mean, that's the substance of their reporting. I bought into it, kind of thing, like a fool. I remember reading that. I didn't know the precise name, another thing, but as a footnote I read. The point I'm raising is, in the 4 pillars of democracy, we have executive, the press, and we have the legislative and the judiciary. We need to get each of them functioning properly for citizens to live a normal life, free and fearless life. So many are lacking today, and I request everybody to rise up to the occasion, each of these arms to rise up to the occasion to do their part so that the citizens of this country can live properly. Now let me go to the next point. So we see that the trial has been compromised. Basically, we were released, we were given a product that was flawed actually. We proved in trial itself just in 1,600 people. And in 1,600 people, this person suffered serious adverse event, and Asif feels that he was only one. I say that he may not be the only one. Maybe there are many more, and he happened to be an educated person who happened to volunteer, and maybe of the 1,600, maybe 1,000 have volunteered for money, basically poor people whom they've signed up, and in case they suffered, they would have quietly kind of, I don't know, today I'm suggesting a possibility. So, I mean, there may be more things that might have happened. And we trust our regulators to take care of these things, but regulators, DCGI, set up a committee which gave a clean sheet to the vaccine company, which is very sad. Now, talking about regulators, we see this. I want you to read this mail. I mean, I'll quickly go through, I'm running short of time. See, the thing is, this mail is from Dr. Balram Bhargava to all the vaccine participating hospitals, written on 2nd July, asking everybody to finish enrollment for vaccination by 7th July because he wants to roll out the vaccines on 15th August. And this, he's supposed to be a scientist and a person with scientific bent of mind, and he's supposed to kind of protect all our health. And we are going to ICMR for any whatever, like, and he's saying a trial enrollment should complete in 5 days, and then the the vaccine should be rolled out on August 15th. Means what? He's kind of prejudging the trial. He's prejudging the, he's saying, you give a positive thing, let me go ahead with the rolling out. And he's warning, kindly note, non-compliance will be viewed very serious. Science is not done this way. Science is done with facts and data. Whatever the results come, they have to be spoken as they are, and then you decide. But here what we see is not science. This is some prejudged thing just thrust on people. That's what happened. And we all paid a heavy price because we trusted. So now we have two choices. Either the other arms of the democracy restore the trust by functioning, or we stop trusting, basically. We take our own things into our hands, like we start suspecting every single thing. There is no other way, because they are not taking care of our interest. Okay, I'll just quickly go to a few other points. And this is the Balram Bhargava to whom I sent a mail in November 10th, 2021, again with my daughter's case. Let me zoom it a little bit. So I sent this mail to him, asking him that this is very serious, you have to immediately stop it. And they never replied, actually. They never replied to this also. There was no replies to any of these mails. Sorry, yeah. Okay, let me go to the next thing. Okay, so we saw two things. A, it was not required, because without vaccination, things were good. Number two, when approving, NTAGI gave strict recommendations on active monitoring, that serosurvey should be considered, and other thing which was not followed. And then the thing is, the vaccination started, and okay. And the next thing is the government, all political, bureaucratic, and medical arms, they certified and advertised a medical intervention which was an EUA intervention, emergency usage authorization intervention, as completely safe and effective. They pushed and pushed and pushed. They gave incentives. They said, if you do this, I'm going to give you that extra things. And they gave disincentives. If you don't vaccinate, you won't get ration. You won't be able to travel. So how did they do it for an EUA product that carries risk by their own admission? EUA means it's emergency usage. So it's up to you to decide whether you want to take a risk or not. So I will, for want of time, I'm just skipping this and going to the other one. Next point I want to raise is, why wasn't vaccination stopped in India when many deaths happened in the early months with 6 of the vaccinated on the first day, like 6th, can you imagine this? 16th January 2021 vaccination starts. And the people who took vaccine on that day, 6 people have died, and it is in the AFI system. When they died, we don't know, because they're not giving. But it is like most of our children, within days, within months, within weeks, like something like that. It's not like a long thing. If it's a long thing, it won't even make it in the AFI. And so they've died almost immediately. And 6 deaths. And 41 deaths have happened in January, 43 in February, and 271 deaths in March. So many deaths are there in the AFI system. And still they went ahead and started jabbing 45 plus and then 18 plus and so on, which is completely defying all logic, unless people are kind of blind or murderous. So here, actually, one more thing is the worldwide countries stopped giving AstraZeneca in the period March itself, 13th March 2021. Germany limits the 31st March. And March 7th, Austria announced they would suspend a high bab. Maybe they learned from Snehal Lunawat's death, I'm telling you. Like Dr. Snehal Lunawat's death, they were observing and they stopped basically. We don't know. Our government was sleeping. So they kind of studied their own people. They studied what's happening worldwide and they acted on it. On March 11th, Denmark, Norway, and Iceland announced they suspended the vaccine entirely. And the following days, number of countries took the action. And more than a dozen, this is a 15th March news. More than a dozen countries, mostly in Europe, have suspended the use of AstraZeneca. Again, I question India's press. How many of the Indian media highlighted this news to us? Like, so that it reaches everybody's home. They didn't. They purposely, they didn't. I accused them actually. So they didn't do it in a way, they might have carried it in some column somewhere or maybe in an online edition, I don't know. But not in a way that merits the serious discussion because a nationwide vaccination campaign was going on. It needed discourse, it needed discussion. They didn't do it. Then why does it take so much time for AFI committee to adjudicate on AFI cases? For example, Dr. Snehal's case, 1st March, she died. The adjudication comes months after because she was throughout in hospital, all hospital records were there and including postmortem report, everything they have. And this is a matter of national importance because you find something negative, you need to stop vaccination. And then they take so much time because the decision is taken in advance. They don't want to stop vaccination. It may be a political decision already taken. They want to discuss like 100 crore, 200 crore, whatever number, and project it as a big success story. So it was just brushed aside. So why are the AFI committee taking as much time as it pleases? Sometimes they have taken 18 months for death to analyze. And finally, they say unclassifiable. They don't have data. Why? Because they don't have. If you don't have data, why don't you say that early? So the thing is, the system, AFI system just exists to protect vaccination industry, the vaccine manufacturers. It doesn't exist to find the truth about vaccination. That is the reality. See, in AFI system, there are 1,110 deaths. Each of them have taken months for approval. And this is not the total deaths in AF system. So far, adjudicated deaths. How many cases are there in AF system? We don't know because there is no database for us to check. We know only where they have finished the assessment and published the results. Only that we know. That's the reality. Okay. Now the last point, and then I'll give it over to Pawanji for discussing two other important areas. That is why there is a drastic decrease in AFI deaths and cases as months progress. See, we started, let me show you this graph, which will explain better. So this is actually to scale I have done that. For example, this is the first month. This is January 21. If we had 11 as the count of the AFI deaths certified as basically, AFI deaths, total deaths actually, AFI deaths. And then in February, we have only 4. In March, when they increased it for 60 plus, we had like 5. And then again in next month, April, it falls. Magic. In April, we have now 45 plus crores of more people getting vaccinated. But number of deaths in AFI system totally dropped. How? There is only 3 possibilities. Where is that text? 1 second. Sorry, I couldn't make proper slides for want of time. See, there are only 3 possibilities. One is they changed the formulation. Like, for example, whatever was injected earlier, they changed and they made maybe distilled water for injection or whatever was sent, or a milder dose or whatever. Or they stopped taking cases into AFI system. Or they have taken huge number of cases, but they have not adjudicated anything. They are just still piling up. Except these 3, you cannot explain how when you expand the vaccination for a same population, you will have lesser number of deaths. There is no justification. So the only possibility, and I don't know whether they did making the formulation as distilled water. Even though it is illegal, I'll be happy if they did that. They saved lives. But that is illegal, surely. They shouldn't have done that because that's not the one trial passed one and all that stuff. And the second one is AFI system was thoroughly throttled. That is a definite possibility. They are no more taking data in AFI system. So that is the next point I wanted to make. So I think I've taken more than my share of time. I request Pavanji to discuss the other two major areas.
Yeah, I wanted to start because this is a keynote address. I just wanted to start with a few keywords. So one of the keywords I wanted to talk about is emergency use authorization, right? So when they say emergency use authorization, they should have been extremely careful on passing on that message to the people. They should have told, okay, we desperately authorized this and it has so many dangers associated with it. And that was not conveyed purposefully. Uh, because- okay. So that's one thing that was missed out. Being an emergency use authorization, it was not conveyed properly to the public. That it is there are dangers associated with it, and there are two sides of the coin. They say, okay, EU is given because of the benefit. Yeah, benefit is fine, but there is also a dangers associated with it, which should have been conveyed properly, and that way, people also are aware of that, and they will be behaving accordingly. The reason I'm highlighting this is because we as a victim family, we faced so much, what do you call, like backlash. Like, I cannot go and talk openly about it. Even my own relatives, my family, my friends would go against me. It's all fear and taboo created within the system due to the propaganda created by government or what, whoever did that. So that should not have been done with the premise that when you say it is an emergency use authentication, right? Authorization. Sorry. And then the other thing that they did is they kept on saying safe and effective. Safe and effective. When you say safe and effective, then you should not be forcing it, and you should not be like advertising it. But what they did is only one thing, one and only thing, indirectly forcing it, coercing it on the people. So they should not have been, linking it to many things like, you want to travel, you want to work, you want to like, go to college, whatever. There are so many things we have seen in the media that, how the coercion happened. And I want to share one incident of coercion that happened right in front of my eyes. And luckily, because I'm aware of all of this, I was able to stop it. Like in my apartment complex, like, uh, my neighbors were like putting messages in the group saying that, oh, we need to have every maid vaccinated in order to enter the community. This they did knowing that Ritaika has died with vaccine, and they know it, and they're still putting such messages. I took the poster that Awaken India movement shared with us, like how this is a voluntary and this is not a required thing. I shared that in the group and said, okay, you cannot do this. If you do this, you are legally liable. When I said the term legally liable, everybody shut up, and it was not enforced. So that kind of awareness was not there in the people to you know uh, uh, go against it. That was the problem, and for future at least, people should be what do you say, like empowered to talk on both sides of the, like advantages and disadvantages, and it should be fair game, not like one sided. So that's something that I wanted to bring up, and then openness in accepting the other side of the vaccine. So that's what I was coming to, and then the taboo and the fear that was overall created in the society. Even today, I'm coming to this conference. I had to hide from some people that I'm coming for this conference because they would laugh at me. That's how the situation is, and it should not be like that. So these are some of the demands that we are going to add to our demands to the government. And towards the end, what I wanted to end with is like it should be my body, my choice, whatever may be the case. That's how it should be. And other things is AAFI. AAFI, if it works, it does work. But the thing is, it's being stopped from working. That's the problem. We have seen some cases like it did work properly in some cases, but like majority, 99% of the cases, it did not, and it is still pending. And it needs to be made much, much, much better. Uh, with that, I will pass on to the next person.
So next we have testimonials of vaccine victims. So we'll call on stage Shri Dilip Lunawat ji.
Hello. Good afternoon, friends. We are in the same boat, almost all people. Now I am Dilip Lunawat, father of Dr. Snehal Lunawat. I think it was my first case in the vaccine death. This, my daughter, she was a doctor, and because of the frontline worker, she has to take the vaccine in the first group. मैं हिंदी भी बोलूंगा और इंग्लिश भी बोलूंगा, मतलब इट विल बी बेटर फॉर ऑल ऑफ अस. ओके ओके ओके. वो डॉक्टर थी, एमडी डेंटल किया था, ओरल कैंसर में उसकी ये पीएचडी भी कर रही थी वो, और शी वाज अ लेक्चरर, मतलब सीनियर लेक्चरर थी कॉलेज में. तो उसमें प्रेफरेंशियल लेने के वैक्सीनेशन के लिए उसको वैक्सीन प्रेफरेंशियल लेना पड़ा, और उसने जो 16 जनवरी को चालू हुआ था, शी हैज टेकन ऑन 28 जनवरी. उसको 5 फरवरी को कुछ ब्रेन में कुछ ऐसा लगा कि कुछ ब्रेन सर में दर्द हो रहा है. उसके बाद में उसने वहां पर कॉलेज में, वो तो मेडिकल कॉलेज है जहां पर ये, जहां नासिक में इज अ मेडिकल कॉलेज, एसएमबीटी कॉलेज ये नासिक में है. वहां वो लेक्चरर थी, तो वहीं पर सब ट्रीटमेंट तो हो ही जाती थी, क्योंकि वहां पर उन्होंने काफी डॉक्टर को बताया. उसने 5 तारीख को 5 फरवरी, और वहां पर बोला कि नहीं कुछ ये छोटा मोटा कुछ होगा, तो दवाई ले लिया. और उसका 7th को यहाँ दिल्ली में ही उसका एम्स में कॉन्फ्रेंस था, 7th ऑफ फरवरी. तो वो 5 तारीख को वहां पर कुछ प्राइमरी ट्रीटमेंट लेके, वो और उसकी एक सीनियर जूनियर कलीग थी, दोनों नासिक से औरंगाबाद आए. वी आर स्टेइंग इन औरंगाबाद. औरंगाबाद में आने के बाद में 5 तारीख शी वाज ओके, रात को पहुंचे. 6 तारीख को वो 2 बजे की फ्लाइट से निकली, 4 बजे यहाँ पहुंची, दोनों वो फ्रेंड्स. और उन्होंने नेक्स्ट डे का प्रेजेंटेशन जो 7th को देना था, 6th को वो यहाँ दिल्ली पहुंचे, और 7th को जो प्रेजेंटेशन देना था उसमें उसकी तैयारी, मतलब जो प्रेजेंटेशन देना है उसका पूरा प्रिपरेशन किया उसने. और रात को 8 बजे उसके मम्मी के साथ उसने बात किया कि उसने, मम्मी ने उसको खाने का पूरा टिफिन वगैरह दे दिया था, तो बाहर खाने का कोई सवाल नहीं था. और उसकी इतनी परफेक्ट थी वो खाने पीने में कि बाहर का तो उसको चलता ही नहीं था. कॉलेज में इवन कैंटीन का भी नहीं खाती थी वो अकेली नासिक में रहती थी, और 5 बजे खुद का बना के टिफिन लेके जाती थी, मतलब बाहर का नहीं खाना. और उसका बहुत डिसिप्लिन लाइफ था उसका. उसके बाद 7 तारीख को, जब 6 तारीख को रात 10 साढ़े 10 तक काम किया, और 1:30 बजे, रात में 1:30 बजे उसको सीवियर वोमिटिंग चालू हो गए, और वोमिटिंग के बाद में ब्लड उसके ब्रेन में चला गया. और उसकी जो जूनियर थी, तो रात में तो वो 1-2-3 टाइम वोमिटिंग किया. फिर सुबह 7 साढ़े 7 बजे उसके जूनियर ने फोन किया कि आंटी ये मैम को कुछ हो रहा है. तो मैम को मतलब वोमिटिंग वगैरह हुआ है. हम लोगों ने उसको बोला कि उसको बात करवा दे, तो शी कुड नॉट स्पीक. उसने सिर्फ किया, बस आवाज आया. आवाज आने के बाद में उसका कोई भी आवाज सुनने में नहीं आया. हम लोगों ने सेम सेकेंड इमीडिएट जो फ्लाइट से वो आई थी, वही फ्लाइट से मैं और मेरी छोटी बेटी, हम दोनों वही फ्लाइट से आए. 4 बजे यहाँ पहुंचे. मीन टाइम में उसमें यहाँ आर्यन हॉस्पिटल में उसका ट्रीटमेंट के लिए लेके गई, लेकिन वहाँ कुछ ये नहीं था, एक्सरे या ऐसा कुछ वो नहीं था. तो उसके लिए उसको यहाँ सर पारस हॉस्पिटल में उन्होंने रिकमेंड किया, यहाँ पर गुड़गांव में पारस हॉस्पिटल में उसको लेके गए। वहां पर देखा तो मतलब शी वॉज अनकॉन्शियस और मतलब डॉक्टर ने बोल दिया कि इसका तो ब्रेन का ऑपरेशन करना पड़ेगा। तो हमने तो फोन पे ही बोल दिया था कि आप आगे बढ़ो, जो भी करना है आप करिए। हम लोग पहुंच रहे वहां पर। हम लोग 4 बजे यहाँ पहुंचे और 5:30 बजे करीब गुड़गांव पारस हॉस्पिटल में पहुंचे। अब ये इसके बाद में मतलब उन्होंने एक ऑपरेशन भी कर लिया 7th मॉर्निंग को। और तो उसके बाद में मैं एक दिन उन्होंने देखा, तो उसके बाद में भी कोई ट्रीटमेंट में कोई फर्क नहीं हुआ। उसके बाद में उन्होंने 9th को सेकंड ऑपरेशन किया ब्रेन का। लेकिन डॉक्टर को हमने पूछा कि हुआ क्या है, तो एक्चुअली दे कुड नॉट से एनीथिंग। वो यही बोलते थे कि प्लेटलेट कम हो रहा है और ब्लड पतला हो रहा है, ये दोनों अपोजिट सिस्टम है। वो मतलब उनके लिए तो बहुत नई चीज थी ये। उन्होंने सब कुछ ट्राई किया, बोले उन्होंने कंक्लूजन कुछ भी नहीं दिया कि क्या हुआ है। बट वो ऑपरेशन सेकंड ऑपरेशन भी किया, उसके बाद में भी कुछ नहीं हुआ। इमीडिएटली हम 9th को, मतलब ये 7th का फर्स्ट ऑपरेशन, 9th का सेकंड ऑपरेशन, 9th को ही हमने सीरम इंस्टीट्यूट को मैंने मेल किया कि इसको कुछ ब्लड क्लॉट हुआ है, डॉक्टर बोल रहे हैं। तो आप ये, और डॉक्टर तो बोल नहीं रहे, लेकिन इसके मतलब बॉडी में कुछ भी नहीं गया है दूसरा। तो आप थोड़ा देखिए, अगर आपने कुछ आपका इंटरनल कुछ रिसर्च किया होगा तो आपको आपका कोई भी रिसर्च टीम होगा, यहाँ दिल्ली में एडमिट है, आप भेजिए यहाँ पर। 9 तारीख को, मतलब इट वाज इमीडिएटली विद इन 48 आवर्स हमने मेल किया और उनका जवाब आया 2 दिन के बाद में कि नहीं ये तो कोइंसिडेंटल है, कुछ नहीं है ये तो। उसके बाद में हम लोगों ने रिपीटेड मेल किए, कुछ फायदा नहीं हुआ। अब ये जो ब्लड क्लॉट वाला है, ये ब्लड क्लॉट हमारे से हो ही नहीं सकता, ये सीरम इंस्टीट्यूट ने लिख के दिया हुआ है। अब ये उसके बाद में जो अभी लेटेस्ट भी आया है, अभी यूके में कहीं सीरम इंस्टीट्यूट ने बोला कि दिस इज हैपनिंग ड्यू टू आवर वैक्सीन ओनली। इसके बाद में मतलब देखिए, अगर मुझे ये कहना है कि अगर ये फरवरी में दैट वाज, मतलब मुझे लगता है कि वहां तो 10-20 करोड़ हुए होंगे कोई वैक्सीनेशन बाय दैट टाइम मैक्सिमम। अगर ये टाइम ही अगर वो करेक्टिव एक्शन ले लेते या उनको ख्याल में आ जाता, एटलीस्ट वो रिसर्च कर लेते कि भाई क्या हुआ है, देख लेते अपन, तो मुझे लगता है कि काफी कुछ लाइफ बच जाती। आज जो हम लोग देख रहे हैं, जो ये कभी सुना नहीं। आई एम 70 years old, मैंने ये कभी नहीं सुना। एक्सरसाइज करते करते मर रहा है, नाचते नाचते मर रहा है, मतलब ये इतना ऐसा सुनने में कभी आया ही नहीं है पहले। और हम लोग देख रहे हैं कि कितनी डेथ हो रही है। हो सकता है लोगों को अभी भी अवेयर नहीं है कि ये वैक्सीन की वजह से हो रहा है, और न तो डॉक्टर बोल रहे हैं इसमें कि वैक्सीन की वजह से हो रहा है, लेकिन हम लोग तो खुले आंख से देख सकते हैं कि क्या हो क्या रहा है ये। अब ये अगर अभी भी ये डेथ कंटिन्यू है, ये कोई डेथ बंद नहीं हुई है, अभी भी डेथ चल रही है लोगों की, कई लोग मर रहे हैं। हम लोग देखते देखते ये कोई एंकर जो टीवी का एंकर है, ये भी डेथ कुछ नहीं है, एकदम बढ़िया चल रहा फिर रहा है और गिर जाता है। मतलब और अभी इसको मतलब अभी कहाँ लेके जाए इसको, कौन लेके जाएगा। जैसे वेणुगोपाल सर ने बोला कि 4 पिलर्स, आई डोंट थिंक दिस 2 पिलर्स आर वर्किंग ऑन इट। एटलीस्ट 2 पिलर, जो जुडिशियरी और मीडिया तो चुप बैठी हुई है, एकदम ही शांत है। जैसे आज भी मीडिया को बुलाया है, आई डोंट थिंक एनीबॉडी हैज कम फ्रॉम मीडिया। ये उन्होंने सुनना चाहिए, ये पब्लिक की आवाज है और डेथ हो रही है। यू आर मर्डरिंग द पीपल। मतलब क्या बोले, कि हम लोग किसको बोले? अगर ये 2 मेन पिलर ही काम नहीं करेंगे तो फिर कौन करेगा काम? किसने काम करना है ये? अब मीडिया नहीं है, नहीं तो अदरवाइज आई वुड हैव टेकन टू विद देम आल्सो। लेकिन ये बहुत ही खराब चीज हुआ है। और मतलब इतना वैक्सीनेशन, और हमारा ये डेथ होने के बाद, स्नेहल का डेथ होने के बाद में इमीडिएटली आई थिंक दिस यूके का 21 कंट्रीज दे हैव बैंड दिस वैक्सीनेशन, दिस एस्ट्राजेनेका। और हम लोगों ने इंडिया में कुछ भी नहीं किया है। आई डोंट नो किसका वेस्टेड इंटरेस्ट था, क्या था? Nobody knows. We can only say there was a vested interest. किसका था ये भगवान ही जाने, क्योंकि जो vested interest वाले हैं वो तो कोई आज आए भी नहीं है और आएंगे भी नहीं, और they are not going to support also. बस इतना ही कहता हूं मैं, और बहुत कुछ है मेरे पास तो कहने के लिए, but it's okay. The main thing is nobody is listening to us. Now how these people should listen, that we have to decide. Thank you.
Next, I'd like to call on stage Shri Pawan Omitri.
Hello, my name is Pavan. I am father of Ritaika Omtri, who passed away with Covishield vaccination. So I'll start my testimony with all the events that happened, sequentially, and what all we went through to get her case to be heard, and in general, during that, what experiences we faced, everything. My daughter Ritaika, she was a 12th grader when she took the shot. She was a wonderful, healthy student, and she graduated just then before vaccination. And she was applying for colleges, and she got selected in a couple of colleges, and she wanted to travel for her undergrad education. And that's when the vaccination happened, and we found small some like headache and symptoms like that, and we visited family doctor, and family doctor checked, and he couldn't find anything. He said like just take like Advil or whatever that, and then we did some blood tests, and in that blood test same thing happened, like low platelets, very low platelets, and the person in the laboratory called us privately without giving the report and saying, I need you to come back and do the retest. I said, like, what is that? Did you not do the test properly? He said, no, there's something wrong. Please come. We did not listen to him at that time. We are not like, why would the platelets will be so low? So then he said, there is something seriously wrong. Talk to your doctor. And that's when, we started becoming a little bit serious. And, we went to the family doctor again. He says like, oh, even fever can bring the platelets down to like 20K, 30K, it's fine. And he spoke to my daughter, and my daughter was answering everything fine. And he says like, see, everything is good. So that is where I want to stress that, the medical system was not trained to identify such things. Even, the doctor who is like famous from Apollo Hospital, and he's not able to even get a clue what it was. And that's how the system was then. And by the time, a lot of things like Dr. Lunawat's case, a lot of things had happened, but still it did not trickle down into the system. And finally, that night, when the family doctor said she is fine, she started getting severe vomitings, headaches, and she started limping. And that's when we got scared and we went to emergency. And in the emergency, the guy who is doing the scanning, he was telling us like, sir, there is a big blood clot. There is a serious issue. You need to admit her. Even though he's not a doctor, he's able to tell. Then the main doctors who are like, they're not able to. Then we admitted her, and they said it's going to be small surgery, but they ended up doing craniotomy and all that. And, she went into coma and she never came back. And then after like 10 days, she was declared brain dead. We were in shock and grief and disbelief. We didn't know what to do. We were just doing what we were told to do. And then, we finally came out of hospital, donating her organs. That's one thing we did. And donating of the organs is what forced them to follow all these protocols. Otherwise, they would not have followed. Doing the autopsy, checking, filing AEFI and all that. We didn't even know about all those filing AEFI and all those things those days. And that happened without our knowledge. Fortunate or unfortunate, that's what brought Ritika's case to the limelight later on in our journey here. And then after this, that's when, after going home, in a couple of days later on, we, through some of our friends who were suspicious about this could be the case, the vaccine side effect could be the case. And that's when we started realizing this could be one angle and started our investigation in that direction. And we started digging and we asked for the reports from the hospital, which took very long time. We had to fight with the hospital. And finally, hospital, after so many turns, they gave the reports. And after seeing the reports, we were surprised. From the hour she was admitted, they had put VITT, AITT, vaccine-induced thrombocytic thrombocytopenia, that condition that she had. They had that suspicion, which they never discussed with us. But they had that on the reports, written in pen, suspecting that, but they never took, that as a serious condition. I don't know whether they treated for it. I don't understand the treatments and everything, but they did know and they never told us. And the reasons they gave is, this can happen for something random, very rare case. And sometimes, kids of this age take different drugs and stuff, because of that could happen. All silly reasons. Then after that, we came to know about AEFI, and then we started following up on that AEFI data and the autopsy data. That it took months for us to chase them. And then with the help of few other victims who were ahead of us, with their guidance, we filed several, I think 4 RTAs, 2 RTAs to the central government and 2 RTAs to immunization office in Telangana. There again, I had to do escalations. People wouldn't even take the request for the report. We had to stay there and, communications, office communications, we had to force it to happen. I sent several emails to immunization office. I even spoke to state immunization officer of Telangana. And the funny thing she asks is, why are you doing all this? What do you want from this? Do you want money? Are you going to put case against government? Things like that. Very, disrespectful cross-questioning when you ask for our own kids' data. That was the conditions those days. And then after that, I explained my intention. My intention was to stop these things, such things in future. And so I'm going to, of course, raise awareness and put a case. And that's why I need this data. And what eventually you want, that's what she argues with me. I said, I want a full disclosure with all kinds of adverse side effects, including death and everything, published in a big poster at the site of the vaccination. That is what I want. I said, do you think if I put that, people will come and get vaccinated? What should I do with my number targets? They were given number targets, and they want to meet that by hook or crook. That's what their intention is, and they're directly talking to me, with that intention, and said, people are uneducated here. If you put such warnings, such what do you call that, posters and stuff, they will not vaccinate. And our aim is to just vaccinate. Doesn't matter. So it was terrible. And even the staff in the government offices, they were so scared of helping me because of the fear and taboo that was created with all this propaganda. We've faced a lot of problems and no transparency. And why all this happened? This is because of the government's promotion and government's policy towards the vaccination, not being two-sided, it's being only one-sided. They did roll out COVID Shield. We know that, even though you already discussed, with all known side effects and countries banning them, still they rolled out. And it was given to 18-year-olds, which is what affected my daughter. by first week of May, right? By first week of May, government knows exactly, TTS was happening, and still it was given. And May 29th is when Ritika took vaccination, and everything happened after 20 days. And we eventually got the autopsy report. Another story I have to tell, how I got the autopsy report. We made the organ donation, right? So because of that, they need to do autopsy. They did it, and they were hiding it from me, and I was fighting with RTS and everything. And then Venugopalanji forwarded me a Twitter post which shared a technical paper published by organ transplant doctors, celebrating their success of transplanting a vaccine victim's organ to another person. But they do all that using my data, and they won't share the data to me. And I sent that technical paper to them, and you are doing this and you don't want me to give the autopsy report. Next day they gave me the autopsy report. That is how it was, our experience, pretty bad. And then, after getting the autopsy report, we were able to substantiate our PIL that we started already. And then after, all this happened in May, right? Until next year, November or so, we got the AFA report, and then we filed the case. And our case goals was mostly, to prevent such mishaps from happening in future, and transparency in adverse reports filing, and making it available to everybody, like you said, and also, training the staff, because the people who are supposed to handle AFI themselves, sometimes they are not aware of what the procedures are and how serious it's supposed to be, but they don't care. I don't know, go there, go here, you have to run around to. We have actually contacted some of the victims, and we are trying to help them to file the AFI, and they could not file. Some of them gave up with the difficulties in there. And again, coming to the coercion part, like I discussed before, it should not be enforced for anything, employment, education, travel, anything like that. And it should be, free. And additional points I wanted to cover is another thing in AFI, no autopsy, no result. And autopsy is a kind of a taboo in the society now, nobody likes to do it. But I think the awareness about that, especially in such cases, should be enforced through the society as well as through the medical faculty. Otherwise, it's hard to prove these things, and then the weightage on this side of the coin becomes less if we cannot prove these things. And and also, more and more lives anyway was, again, we could not save. Even after filing the PIL and after the first response from the government, we could not save, and it keeps continuing. We need to stop that. And also, when the accident like this happens, adverse effects, because of the lack of protocols, some hospitals may have, but not every hospital in every corner of the country doesn't have the proper protocol, because of which a lot of medical negligence cases happened, and people are still suffering because of that. And all those things I wanted to highlight. And then justice needs to be done, and cannot be delayed anymore. It's already too late. It's 3 years, and people should be given choice and protected. If the recipient wanted to know the donor, legally it's allowed, but even there, they should approach. Not the donor. So, but they approached, and even there was a friction. Because we respect the recipient's privacy, I don't want to share, but we were contacted by, finally, with great difficulty, one of the recipients who really wanted to meet us, did meet us and talk to us. Yeah, yeah. But see, organ transplant again has other complications. Other than that, see, that is another thing. See, everything. If you are able to transplant if you're able to transplant an organ to a recipient and they're good, that means what? You don't have any conditions. Your death just happened because of vaccine, and every part of the body is still perfectly good, and it was able to be reused in other persons. And in Ritaika's case, it was only the brain that was affected, brain stroke, and brain was dead, and rest of the body from here was perfect. And even doctors knew that. And I was in discussions with them about this donation thing. So they medically kept running these things so that they know that everything else in the body is perfect. And that's the only reason is like the brain clot because of vaccine.
I'm asking because body की ना एक memory होती है, जो भी आपने वैक्सीन दिया उसको भी बॉडी के each and every cell आपका करेगा. और ऑलरेडी स्टडीज आ चुकी हैं कि जो वैक्सीन से जिनको जो डोनर्स हैं उनमें मतलब TTS जो है उनमें भी काफी और हुआ है और रिजेक्शन हो गया है ग्राफ्ट का 1/3 ऑलमोस्ट.
तो मैं नहीं सुना
चारों के चारों में
सब सक्सेसफुल अकॉर्डिंग
नहीं अभी एट प्रेजेंट आई एम टॉकिंग ऑफ प्रेजेंट. जैसे 2 साल हो गए मान लीजिए तो अभी तक, क्योंकि इट्स नॉट इमीडिएट इवेंट, इट कैन अकर लेटर ऑन आल्सो.
वी ओनली नो वन रेसिपिएंट एंड दे आर ओके. थैंक यू.
Thank you, Pawanji. Now I would like to call on stage Shri Venuji again. Venuji will talk about our daughter's vaccine injury, and then he will also cover on behalf of Dr. Preeti Sood.
Actually, as we are running a little short on time, I will just skip my daughter's vaccine injury thing just with one line that she got vaccinated on 8th June. Serious adverse event started on 18th June, and she was hospitalized for nearly a month, and we lost her on 10th July. And the doctors were clueless for the most part, nearly 3 weeks. A lot of diagnostic tests were done. They didn't really diagnose that it was MIS, which is actually an adverse event of special interest as per the classification for this vaccination follow-up actually. So it's basically a vaccine side effect by the WHO documentation itself. It's called Bretton Wood classification or something. I forget the name now. So Bretton Wood, I think, yeah. So that's the thing. Now let me go straight to the other two things, which is basically Dr. Rishi Sood's wife and his brother-in-law had contacted me ago in May. Actually, Dr. Rishi Sood got vaccinated on 16th March, and he kind of 27th March, he passed away. He just dropped dead. I will show that video in a minute. So what happened was the family, I mean, one can visualize, like if something happens like that in our family, do you think about post-mortem or this or that? We kind of, we are in a shock, we go cremate, and then, I mean, the events take over, kind of. Your relatives will do that. You will be in a shock, literally. That's what happens in every family. Actually, I mean, that's what happened in my family when my daughter died. We didn't think of post-mortem, and the hospitals never told us or anything. That just happens. So in this case, I will just show you the scenario, like...
ਸੂਦੀ ਆਪਣੇ ਸਾਥੀਆਂ ਨਾਲ ਬੈਡਮਿੰਟਨ ਖੇਡਦੇ ਦੀ ਸੀਸੀਟੀਵੀ ਫੁਟੇਜ ਵੀ ਸਾਹਮਣੇ ਆਈ ਹੈ, ਜਿਸ ਵਿੱਚ ਤੁਸੀਂ ਖੁਦ ਦੇਖ ਸਕਦੇ ਹੋ ਕਿ ਕਿਸ ਤਰ੍ਹਾਂ ਡਾਕਟਰ ਰਿਸ਼ੀ ਸੂਦ ਖੇਡਣ ਤੋਂ ਬਾਅਦ ਇੱਕ ਦੋ ਬੈਡਮਿੰਟਨ ਖੇਡਦੇ ਦੀ ਸੀਸੀਟੀਵੀ ਫੁਟੇਜ ਵੀ ਸਾਹਮਣੇ ਆਈ ਹੈ, ਜਿਸ ਵਿੱਚ ਤੁਸੀਂ ਖੁਦ ਦੇਖ ਸਕਦੇ ਹੋ ਕਿ ਕਿਸ ਤਰ੍ਹਾਂ ਡਾਕਟਰ ਰਿਸ਼ੀ ਸੂਦ ਖੇਡਣ ਤੋਂ ਬਾਅਦ ਇੱਕ ਸਾਈਡ ਤੇ ਕੁਰਸੀ ਤੇ ਬੈਠੇ ਹੀ ਡਿੱਗ ਪਏ। ਆਓ ਦੇਖਦੇ ਹਾਂ ਪਹਿਲਾਂ ਇਹ ਸੀਸੀਟੀਵੀ ਫੁਟੇਜ।
Yeah, now I want to ask, how many of us have seen so many videos of people falling dead? I mean, even now we are seeing that. So many videos are coming out. And now in this case, what happened is their family kind of didn't have a post-mortem report because they just cremated and all that. So it never came to light. But she feels her family is completely shattered now, because what happened right after that, within 4 months, her father died because he was in complete mental trauma and other things. So her father died. She's kind of... a major catastrophe happened in a matter of months. She was supposed to come here today, but she got serious laryngitis, and so she kind of excused herself. She asked me to speak this on her behalf. And on this same note, I want to also show a small video, like where another person, one Pranav Hari, is currently fighting for his mom, and we will hear in his own words. Okay, he gave in a clip. We'll try it.
You are 52-year-old, and she passed away on 24th February 2023. She had taken her first dose of Covishield vaccine on 23rd of April, and the second dose was taken on July 2021. 19 months after the administration of her second dose of Covishield vaccine, on 24th, she was seen falling unconscious on the floor. We had taken her to nearby hospital and she was declared dead. The reason for the death was unknown. So since she didn't have any other comorbidities or any other existing disease, we had conducted an autopsy to know the reason, and it was reported that the reason for the death was due to an intracranial hemorrhage or bleeding, a massive bleeding that happened in the brain, and that was the reason for that. We were really
basically intracranial bleeding, basically hemorrhage and bleeding. Okay, let me stop at this because again we don't have much time. So basically the point is this gentleman, the drop down deaths, we don't do postmortem, so we don't come to know what's happening. People just declare they had a heart attack. That's the thing that commonly people just assume or declare in the press, and that's done with it. In this particular case, they did a postmortem because minutes back he had spoken to his mom from Pune. Then his dad comes out and he rings the calling bell. Mom is not answering. Then dad calls him back to Pune and say, "Hey, what happened?" Normally this is the time you talk to your mom. He says, "I just spoke and kept the phone. She hasn't answered." And then he knocks, and then neighbors come. They break open the door and they see her fallen down, and they do this postmortem, and they say that it is intracranial hemorrhage. The point I'm making is the drop-down deaths that we saw of Rishi Sood, Dr. Rishi Sood, and this particular lady, we know is intracranial hemorrhage. And the number of deaths, there is one handle, Anand Panna in Twitter. He kind of put so many such drop-down deaths. Actually, if you go to his handle, you can see that. So they are so similar. And Mr. Pranav has done detailed analysis on. Now the next question is, okay, I didn't take vaccine last week or last month. I took it months back. How can you attribute to vaccine? He has done a detailed research. He has that particular slides also here, next 5 minutes. But I won't take it now. I'll take it sometime during the second part of the day. But the fact is, this time window is something arbitrarily declared by doctors. They first said, if you leave the vaccination center and you are able to walk out, you're fine. And then they said, if nothing happens in a week, you're fine. Then May 21, they said 20 days is the risk period. All arbitrary numbers. I don't know how they come up with these numbers. And then very recently, they are saying 6 weeks is the time window. If 6 weeks nothing has happened, then you can be happy that you have nothing will happen to you from vaccine. So these numbers are completely arbitrary, and there are studies to prove that these PF4 antibodies stay up to 21 months. So he's going to show that. Actually, he has done that work and he has sent me. But unfortunately, I don't have time now. We have to go to Dr. Amitav Banerjee. So I'm cutting short my speech. I'll request Amitav Banerjee sir to join. Thank you. Okay.
Yeah, yeah. Namaste, good morning. Namaste, good afternoon, everyone. For joining us. And we have the no. Here and some press people also have come. Thanks to each of them for joining. And over to you, sir. Okay. Good afternoon, everyone. I'm really it's watching, and it is quite a humbling experience to listen to people who have suffered. And as I was hearing about the vaccine which I'm giving trials, Covishield trial, I think so this similar occurrence was observed during the trials of AstraZeneca in USA. The young woman had the convulsions. She was a trial participant, and then the vaccine was not licensed in the US. In the European countries also, after some time, it was banned. Firstly, it was banned for young people because these spokes and this VITT was found particularly more in young females. And of course, myocarditis in males, so it was banned. And unfortunately, in all countries, we have majority of us are young people. 97 of the population of age, and they whether they were at risk or not. I will just try to present some data. I will just share this slide. I try to present some data to. So I will just present some data to just complement what others have spoken. So this is the futility and what are the possible harms. And now we know with accumulating evidence, the harms are almost real harms. It's not possible any longer. So first question in epidemiology is whether vaccine was indicated, mass vaccination that is. So it depends on the infection fatality rate. We will go through it and the risk stratification, whether the younger people, healthy young people, we'll try to answer that with data. And also the natural immunity, which was downplayed throughout the pandemic. So this is another, I would say, almost indicate no indication was not there in the people. They were given the vaccine or other forced by poison. And the efficacy of the vaccine, some real world data. I will be rapidly going through some graphs. And the safety issues which are gradually coming up, vaccine induced thrombotic, which has been even admitted by the manufacturer, AstraZeneca, blood clots. It is too little, too late. So many white subjects also, young adults, Guillain-Barré syndrome. I think the Covishield trial in India, the young male had Guillain-Barré syndrome. Spike protein in different organs. I heard someone say about the different organs. So there are some concerns that this sometimes the vaccine is injected in the muscle, but if it goes to the other sides, dissemination in other organs, the spike proteins can harm. Long term, we are yet to know. So this is this data. This is about the infection fatality rate. If you see up to 19 years, the infection fatality rate was 0.0003%. That is almost negligible. More people are dying from traffic accidents, young people. Then up to the age of 69 years, the infection fatality was 0.05%. Actually, I have 0.1 or 0.05%. Overall, up to the age of 69 years, overall the infection fatality was 0.03 to 0.07%. So this is actual after infection, as we know from our experience also in India, majority of people got infected before the vaccination was rolled out, and the deaths were inflated also. As Venugopalan also brought out, anyone with a positive RT-PCR was labeled as a COVID death. So up to 69 years of age, overall mortality was 0.03%. So definitely there were to roll out mass vaccination, and this is available 4 months or 5 months into the pandemic. Early 2020, this data was available, and
they could have moderated the response based on this data. So the low infection rate was based on serosurveillance few months into the pandemic, and it was published in a WHO journal, given the reference. And the rationale that other rationale they gave was okay, children are not risk, young people are not risk. But if to break the chain of transmission, we have to vaccinate the young people. So this also the study showed that this rationale was also not on firm evidence. Paper studies as early as August 20 show that children got the virus from adults and not vice versa. Sweden is a good example. It kept its school open throughout, and there was no higher morbidity or mortality in children. Out of 1 lakh children, more than 1 lakh children were followed in Sweden. Only 10 or 12 required hospitalization, and all survived. And that much dreaded and hyped that the multi-inflammatory syndrome, only 3 or 4 child got it and they all recovered. This multi-inflammatory syndrome is found in any viral infection. It is not specific for COVID. Now we hear the propaganda of long COVID, long this, long that. Any viral infection can give some sequel in some people. So they made COVID as if it is a larger than life disease infection. So then again, a question of naturally acquired infection. They downplayed it throughout, and the studies from Cleveland Clinic in USA and studies from Israel had confirmed that naturally acquired infection was 13 to 26 times more robust than vaccine-induced immunity. And by the time vaccine was rolled out in India, most had already acquired natural infection. Particularly the young people, in Delhi and other Gujarat, so 80% of young people had antibodies, and even after the second wave, 70% of Indians had overall antibodies, which indicate that 80% might have already got an actual infection because the antibodies come down after some time, but the T cell memory, T cell driven immunity persists. So this almost everybody had a natural infection, and this was not only no logic, no science, it is defied even health economics. I mean, crores of rupees, I think around 350 crores rupees was spent in this vaccine, right? Which could have been used for other. And with mass vaccination, 33,000. 35,000 crores rupees. You can imagine the futile waste, and it caused harm. The published reports have found about the incidence of serious adverse effects. That is 1 in 800 in COVID mRNA vaccines, and Covishield is a higher rate. So even if you go by conservative estimate of 1 in 800, if you have given vaccine to 100 crore people, as you have got the whole lot of people praise India for 100 crore. So if you vaccinate 100 crore people, the estimated serious adverse events will be 1 in 800. That comes to almost 12 to 13 lakh people might have had serious adverse events. This is the published papers. So, and 1 in 800 is a large figure at the population level. What happens? The clinician, a single clinician does not see 800 patients. He may see 100 patients, 200 patients given vaccine, and he does not see any adverse effect. So he thinks there is no adverse effect. So a clinician's point of view is entirely different. Whereas if you see the population level data, this should have been monitored. The pattern shows that many people, 100 crore, if suppose 13 lakh people have serious effects and 3-4 lakhs deaths must have occurred out of the serious. So that is a huge figure, as Mr. Venugopalan brought out. The AI system is rudimentary, or it is rather to support the vaccine drive rather than to identify the hazards. It is just like running a super fast train throughout the country without in old rickety tracks. We don't have, forget about AI, we don't have health systems in place in the rural area, remote areas. We don't have adequate public health infrastructure, and the health care workers are not trained to identify adverse effects. So these are some of the, and in spite of all this, so many crores spent, so many rolled out, but did the mass vaccination bring down cases and deaths? So a published paper early in the year after the mass rollout from 68 countries, they compiled data from 68 countries. This is a good journal, European Journal of Epidemiology. 68 countries and 2847 American counties did not show any correlation with the level of vaccination and the incidence of COVID. And this is even granular level papers are showing, and Mr. Venugopalan got Africa had the lowest vaccination rate, more less than 5%, and they had the least cases and deaths, and the European countries are having the highest in fact. So country as a country, there were peaks in cases, and then some data which I have been trying to present for the past 2 years. I have published also that just data compiled from the public domain, that is world data, the vaccination coverage and the worldometer, COVID incidence and deaths compiled from that. I have just plotted 1 year before the vaccination and 1 year after the vaccination. I had published it 2 years ago, and this year in March I presented this data on invitation from AIMS New Delhi and National Academy of Medical Sciences India. And I presented it, and I asked everyone there, the most leading doctors in the country, AIMS New Delhi platform, that I would be very interested if anybody can explain this paradox and or reverse this. To date, I have not received any. I will rapidly go through the slide. So then, as you are aware, there is a mathematical models which are inflating the panic of COVID and the benefits of vaccination. So there, the paper came according to models. Vaccine saved 20 million lives. This is a paper in Lancet which has been funded. The paper funding has authors got the funding from Bill and Melinda Gates Foundation. So, and the models, we know the Neil Ferguson's model also. That also predicted doomsday. So we are still going, the policymakers are still taking cover under model. So I just plotted the real world trends, and country after country. We start with Japan because Japan is very interesting. This is the red circle, red semicircle is the rollout of the vaccine. 1 year before the rollout, there are no cases, no deaths, Japan, almost. And it did not have a very strict lockdown also. And if you see after the rollout of the vaccine, the cases started peaking. You see 1 year afterwards. So this vaccine, left side is the before vaccination, right side, this is the population level number of cases. Then the other claim is okay, it will prevent deaths and hospitalization. So this is the death from COVID in Japan. Before vaccination, there were of course one peak before vaccination, but if you see after vaccination in Japan, there are 1 peak, 2 peaks, 3 peaks, 4 peaks. So this is up to, I have just started 2022. Early the mass vaccination did not have any effect on the population level in Japan. So these are the many countries. Any country, this is Israel. Israel was given the Abasi because they said Israel was the first one country to have the largest vaccination cover. So you see Israel where before vaccine you see the cases, and after vaccine all the cases are coming. I mean I am really surprised for the 2 years I am presenting this data, and no country, the country should have claimed the refund from the manufacturer. This vaccine has not worked at the population level. At least what is the data showing? These are the deaths in Israel. There's hardly before vaccine 1 year and after vaccine there are peaks in deaths. And naturally it comes down on its own because all the vulnerable deaths, those who survive, they develop natural immunity. Australia is again a very good example because Australia had no cases before the hardly 1,000 or very in 1,000 because they had a very strict island. They had a very strict barrier. Anyone unvaccinated cannot come. Even the tennis player could not come. So you see, nothing happened. Cases because of the strict, almost draconian measures. There is no cases. But after the vaccination, the Australia having the cases. This is the cases, and then you see the death. Majority of the deaths in Australia are after the vaccine. Here, 1 year before, 1 year after. So this is Australia. And these countries are having second booster, third booster. And in Australia, data only shows that the AstraZeneca was more harmful than the mRNA vaccine. They had some data monitoring. Singapore, again a good example. It was a small country. Before vaccine, hardly any cases. After vaccine, right side of the red, all the cases after that. So the immunity doesn't last. So it's all waste of money. These are the deaths in Singapore. All the deaths are, why the countries are keeping quiet, I don't understand. This data is available in the public domain. This data is not fabricated. This data is not cooked up. These are from the worldometer data and the world in data. This is the vaccination coverage, and this is Malaysia. See, Malaysia also having same left, right. Whatever country I compile, this is the deaths in malaria or Malaysia. All the deaths after vaccination. Similarly, South Korea. It was also lauded for its strict control, and after vaccination, they had cases. This is deaths in South Korea. Taiwan was also lauded for its strict control, and after they rolled out the vaccination, the cases occurred in Taiwan on the right side, and all the deaths in Taiwan are after the vaccination. Before the vaccination, not a single death. So these are the some patterns which are really paradoxical. Sri Lanka, I was very carefully following because Sri Lanka was a neighboring country. If you see the cases before 1 year, before hardly any cases, and the cases flared up after the vaccination in Sri Lanka. Similarly, the deaths, all the deaths after the vaccine. And who is doing this? Who is doing any AFI? It's not only in India. All over the world, adverse events monitoring is suppressed. They say even in the developed countries, less than 1% of adverse events are investigated or reported. But the population level data shows peaks after the vaccine. We don't know why. So these are that is the population level. As far as the data is showing, it did not have any impact on the population level. Then concerns about the safety, as you know, we have pericarditis, Guillain-Barré, and the viral AstraZeneca is a protein disorder, stroke, which is well known, myocarditis, pericarditis. They also we have published myself and Professor Bhaskaran Raman, who is also related there. So this is actually, I just took it out from the National Herald. We had published this somewhere in December 2022, I think, almost 2 years ago. We had just given the patterns in column in National Herald, and this is the data all compiled by Bhaskaran Raman. He will be presenting more data also. This is the global data. This is the data from England and Wales, I think, because they had initially some good data. They had put it across almost access that. So there were a lot of restrictions, lockdowns, and other things on death in nursing home. But after 2020, also you see above the prior to this, this is the baseline. So that's continuing. Excess deaths are continuing beyond up to 2022. We had published this column in 2022. It's continuing, and he will be presenting the data from Mumbai also. This is more concerning. This is the young people. 15 to 44 years old. This is the deaths in 15 to 44 years old. If you see the deaths in young people are higher than the earlier years. After the vaccine rollout, these are the deaths are higher. So these are the last two bars. So this is again the pattern as the population level is showing, as we have been discussing also, and young footballers falling down, anchors falling down, young people falling down. So these are the individual cases, and people can always write them off as coincidental. But when the pattern is at the large data, population level data, there is something which have to put all these things together. And so all access cause a matter of concern access to young adults among 40 years in many highly vaccinated countries. There is data from USA which shows that after the vaccine rollout, there is almost a 40% increase in deaths in the working population. So these require thorough investigations, including autopsy study. As someone said, the autopsy is not done. And I would say even if it is done, it is not done properly. Most of the we require very qualified pathologists to identify the actual pathology post vaccine. So I think that's all. These are some of the references. All the data I have given references. So these are the references. If anybody wants to verify, these are here, because anything you present, they say it is all conspiracy theory or people are anti-vaccine. We are not anti-vaccine, but we want to see the proper evidence. So these are the here. I think this is all. Thank you. Any questions I can?
Thanks a lot, sir. Just a second, I'll ask the questions.
Yeah.
Question. So, in this presentation, we saw. So, yeah. So in this presentation, we saw several of your graphs from different countries. I was wondering if you superimpose or if you look at the overall, all the countries, overall picture, you know, do we see a similar pattern worldwide?
I think the question is reached properly. You can talk, you can just.
Sir, in your presentation, you showed graphs on patterns of deaths happening after vaccination in different countries. So do you have overall picture throughout the world? Like, superimposing all together, altogether.
No, we can do it. We can do it. This is at the population level data. This is the pattern which gives the unusual, and this is very. I mean, that data is so stark. I mean, it's so obvious, and we can do it also. I mean, I had data for UK also, USA also, and more or less the same pattern we are seeing. And more or less it is same. So we can do it. I can request Professor Raman or computer scientist, he can.
So we are seeing a very clear.
Because they say that it is different demography, different. Yeah. Because if you see, they say that there is ethnic difference in demographics. So I the Southeast Asian countries I presented today because India, it is more akin to India, Sri Lanka, Asian countries. The Western countries also actually they have the problem. Western countries are they are very old people. Actually, average age of death was 80 years from COVID. So they people are having deaths as a routine thing in the village. So all countries, Asian countries, Africa, they are young population. So this type of thing, spiking deaths in all countries, populations are more concerned. These younger people are dying. There the elderly have to die. I mean, we have to reconcile more mortality. But here we are having younger population up to 70 years of age. The infection fatality rate is 0.05%. Up to 70 years, now 97% people did not have any risk of dying. In fact, malaria kills more, dengue kills more, typhoid treatment kills 3%. Of infant mortality rate is 3% in India. 30 infants die before they reach their first birthday. So 3% infants are dying. Here we have got the infection fatality rate of 0.03 to 0.05% up to 70 years of age. We are not bothered about the infants dying. We are not bothered about the 5,000 children in India dying daily from preventable diseases. 1,400 daily from tuberculosis. 700 people die daily from road traffic accidents. These numbers are much higher than the COVID deaths in the peak also in our country. So we are just seeing how things are diverted. So we did not have tuberculosis drugs for 6 months last year. Stock out. Where tuberculosis killing 1,400 every day. COVID, we locked down the whole world. And now we are going to lock down for monkeypox also. What is monkeypox? On what basis they have declared monkeypox as a public health emergency? How many people have died in India that we have started having meetings and health minister is presiding over monkeypox and other things. So 4 cases, not a single death. Same with Nipah and all that. Here daily we are having people. Daily, every year, 18,000 people die to rabies in India. Nobody, no media is 18,000 estimated WHO figure. 18,000 लोग rabies से मरते हैं India. 18 to 20,000. So nobody is. I mean, you won't step out of your house if the media tries to cover all this. But COVID was it's a psychological experiment which is very fascinating. The way the world has given the fear of COVID without any data, without any
No, mic, please.
Hi, good morning. Sir, I'm Monica Rathor. I have this question that being from the healthcare fraternity, or I understand and assume that when this all were happening, it's not that we were not aware of it, that it is a scam. This thing is not as it been shown and been narrated to us. Now, as a layman, I have a strong urge to ask you that when the damage has already done to the country, to the people, where were we, all of us, when this were happening? Why didn't we raise this voice back then when it was much needed? Every day we, as I again will reiterate that from a medical fraternity, doctors knew it, what they are doing. Doctor knew it very well that a vaccine cannot be invented in a 10 months time. Back then, nobody has raised a voice. People have lost their. Yes. So my question is this, sir. Are we going to repeat this again and again? The India has become a country of tolerance. We have been tolerating it. We need an answer from you that what is the way forward to handle these things, as you have rightly mentioned that it is not just a pandemic. On a day-to-day basis, people are losing their lives, right? Back, right, and center. What is the solution to it? We have heard, we have seen the problem. We all aware. Even the layman could also understand that there is a problem. But we want when a eminent leaders like you come forward, we want you to direct us a solution so that we can follow that and ensure that in future this does not happen. We are not being brought by our parents to get played by the certain people. You understand? And yeah, so this is my request. Thanks.
Yeah, right. Actually, you are perfectly right. Mr. Govindan said the press has failed us. The medical community also failed us. Medical doctors, there are two factors to it. Most of the medical doctors are now fragmented because they are subspecialization and super specialization. So they only see one part of the problem. They don't see the whole jigsaw puzzle. There is a virologist now, there is a virologist who is doing the genetic studies, who is finding new mutants. And they keep on going to the media and the fear psychology. Most doctors are only concerned with their own work. So they don't see across the big picture what is happening. And as I said, most of the clinicians came on the TV. Those who are cardiologists, those who are super specialists, they are, I call them celebrity doctors. They don't see 800 vaccinated people. There is one death in 800. They see 100 cases, बोलता कुछ नहीं होता मेरे घर वाले ने वैक्सीन लिया मैंने वैक्सीन लिया. That is not the answer. The answer is at the population level, 1 in 800 is one too many, particularly if a young person dies. So their person and the people who see big data, epidemiology or public health people, they are not very. The data becomes abstract. It doesn't convey. So it is good that there are people who have really suffered, who have lost their kin and kids. They are the ones who are telling a story, and that also adds, and that is also complementing the big data. But this is not a country, one country or Indian government or Indian. It's a phenomena which started from the. It started from China. We got the worst of authoritarianism from China, the lockdowns and other things. Then it went to the West, the market forces took over. So in this pandemic, we got the worst of authoritarianism, communism from China, and the worst of market forces, capitalism from. So both the worst of both aggravated, and then various conflicts of interest. You are talking of doctors. Doctors, don't have autonomy nowadays. Those who are in corporate hospitals, they have to meet targets. As someone said also, they have to meet targets or they lose their job. They have lost the autonomy. Academicians also don't have autonomy. They have to get research grants for the vaccine studies, clinical trials, vaccine trials. They get paid for that. They get tenure for that. They get published papers. They rise in the academic hierarchy. If they ask serious questions, then they do not get the grant and they lose their job. So academics, so it is has got the conflict of interest, may not be financial conflict of interest, career conflict of interest. Career conflict of interest and and that's such irresponsible statement. As I would say, when the vaccine was launched, the questions were raised about the safety. The Drug Controller General of India, I can name him Dr. Somani, he said the vaccine is 110%. The Drug Controller General of India, Dr. Somani, He said 110% safe. Is he talking like a scientist or is he talking like a person who is selling snake oil? This is the person who is supposed to protect the health of the citizen. So shouldn't he be asked question in court? 110% safe कैसे बोला आप? One death is too many, particularly for a young person who did not need the vaccine. Vaccine is given to healthy people. It is different from medication. If you have to be extra cautious. Healthy person may not have got the disease. Even the person getting the disease may not have died. You are giving a vaccine, even 1 in 800 is too many. So 110% safe. So it was something, and they, what, if we were saying anything, we were said that we were spreading misinformation. Or YouTube's were blocked. Even 2 weeks back also, one of my YouTube, I got a strike. Just discussing the vaccine side effect. So this is how things went.
In the mic, please.
Good afternoon, doctor. Myself, Vikas Gupta. I'm a freelance journalist. I just need to know. It's very scary listening all this conversation and vaccine side effects. Just need to know: is there any way we can overcome the side effect of the vaccines we already taken? Can you just throw some light on this?
Very difficult to really commit either way because the side effects. See, 1 in 800 will have serious side effects. 799 will have no serious side effects. So it's very difficult. So this is something because I am just an epidemiologist, I can just count up to 100. So these are things where that requires more research. That requires more research because at the cellular level, at the molecular level, there are some. If you ask Dr. Peter McCullough, he recommends this nattokinase, a Japanese herb, which is for the clots and other things. So the killing, so it's I mean, it's difficult, but by and large, I mean, you just have to keep your fingers crossed, and of course, overall health, if it is good, and if you doctors are aware, and doctors do not brush anything under the carpet, any signals, like they said it is coincidental, or it may be due to platelet count falling, maybe due to any other fever. So high index of suspicion and the courage to face the problem. And now they are doing research on long COVID. Actually, they should do research on ill effects of the vaccine in the long term. So again, still the medical community is not focused in the correct direction.
A very brief question once again. I just need to know that you just said that there is one doctor in Japan who has introduced some herbs. Can we source here in India, or could you share some contact details of the doctor so I can write a story on this?
No, we are talking of Japan. What in Japan?
Japan, you just said that there is one doctor who.
That doctor, it's a Japanese herb, nattokinase. It is supposed to take care of the clots and other things. So
it is not going to work.
It's a American doctor, that cardiologist Peter McCullough. But as I said, it's very difficult to know what is working, what is not working. You require very large sample size and some biological level investigations because you will have a success rate of 799 out of 800 will not have any, will survive, will not have any adverse effect. So with such a low incidence of outcome.
So we all at God mercy now.
It's similarly with the COVID virus also. No? So even the COVID virus, majority 99.9% people survive. So even if you give Baba Ramdev ka ye, or even if you give any other drug, 99.9% will survive. So that is very difficult when the outcome is so less in number. It is difficult to assess anything, assess the.
Yeah, namaskar, Dr.
Yeah.
Bita Banerjee. You've been you've been one of the leading lights to let us know about the reality of what truly looking back after 5 years is a most treacherous and a very large scale bio warfare. Now, my humble submission to you, and since you mentioned Dr. Peter McCullough, and I happen to closely follow him. He has very clearly said that by military definitions, it's a bioweapon. Now, common sense tells us that either it can be a bioweapon or it can be a vaccine. It cannot be both. I think it is criminal negligence. And I'm repeating, this criminal negligence for all the journalists out here to call it a vaccine, and anybody who's been making this mistake, or even if it's a slip of tongue, we must correct ourselves. If it's a bioweapon, if it's a biowarfare, it can never be a vaccine. It never had the permissions of a vaccine. It was an emergency use drug. So even by that yardstick, number one. Number two, Mr. Venugopalan showed a slide that earlier the AEFI registered a spike, but then there was a slump. Now, most likely the authorities in charge, the medical fraternity and the governments and the United Nations, they probably got scared that if there is a flood of deaths, if carcasses get piled up, then there will be a huge hue and cry, and they could not sustain the backlash. So probably they started putting in more placebos in the later batches. That is one likelihood. But probably if they just diluted it, then maybe the side effects would appear outside the range of 6 weeks, which makes it untraceable. So it is it's a most dreaded psycho thriller that is being played out on us. Yeah. So my question, number one, and since Mr. Venugopalan wants me to get straight into the question, is that if it's a biowarfare, then it is a matter of a breach of national security. Then Mr. Ajit Dobhal is the go-to person because he is our national security advisor. Yeah, no, let me just answer. And please don't take prompts from behind because I'm just asking a fair question. My question is that if it's a national security breach and if it's a crime against humanity because the number of deaths from a bioweapon are running into millions, then I think your point, Dr. Banerjee, of specialists and super specialists, having a fragmented view of the reality and not being able to see the bigger picture, even when there are no financial incentives involved, doesn't hold the test of truth. I think you, as the leading light in the country, and I would be very stupid to ask it to anybody in the country except for Dr. Amitabh Banerjee, because I'm a researcher and I know in and out of where we stand. So can we take the matter? Mr. Venugopalan is here from Coimbatore. Mr. Omtri is here from Hyderabad. I think Delhi does gross injustice that it is happening in our city, and we are not able to, hold the hands of the victim families who, I saw Mr. Dr. Lunawat, and, really, even my heart cried. I'm also a father of 2 daughters, and I stopped my daughters from taking the vaccination. I stopped my mother. I didn't take a single RT-PCR. I paid fines at Metro Rail. So my humble submission once again, since I'm being hooted from behind by I know who, my question, please shut up. Please shut up.
So we are running out of time.
I know you, and get out of the room. So Dr. Banerjee, my humble submission to you is that please, let's form a delegation. Let's involve people like Dr. Jacob Pulial, Dr. Sanjay Rai, who are already in our core team. And let us take the matter to Mr. Ajit Dobhal because it's a breach of national security and it's a crime against humanity, number one. The second part of my question is that, COVID is part of a much larger agenda, as we know 5 years later. It is part of the depopulation agenda. And the reason why we had collusion right from the United Nations to the sovereign nation states to the medical fraternity is because there has been a justification to cull the vermins, to reduce the excess human population, because it has been conditioned, it has been drilled into us that there is a human overpopulation and no, please let me complete the question.
See, we have 4 to 6 is the press conference hour. That's for reserved for questions. We are running out of time and we have to stick to schedule as well. Please come to your question.
Conclude the question.
Please come to your question.
The question. 1 minute, yeah. So, sir, my question is that if the depopulation agenda is in
चंद्र
place,
विकास जी मेरे को जवाब देने दीजिए.
हाँ, तो
चंद्र विकास जी आपने बिल्कुल सही बोला है.
ठीक है, मैं अपना सवाल समाप्त कर.
चंद्र विकास जी सुनिए, मैं सहमत हूँ आपसे. अभी मैं तो आई एम सिंपल एम्प्लॉय, मैं डेटा मैं दे रहा हूँ. इसको लेके आप कहीं भी प्लेटफॉर्म में जाइए और आज दोपहर को तो आएंगे लीगल लुमिनरीज आएंगे, उनके सामने ये पेश कर सकते हैं. तो मेरा डेटा है, जो एविडेंस है, मैं ये पेश करता हूँ. बाकी जो है आई एग्री, इट इज नॉट ओनली इंडिया, ऑल गवर्नमेंट्स आर इन्वॉल्व. तो अब इट्स अ बिग थिंग, आई एग्री विथ यू.
Thank you so much for sharing your valuable time and insight.
Thank you.
And it has been extremely insightful.
Personally, but I have to go to Nashik.
Okay, sir. It's our
I
misfortune.
would have loved to come, but I had another commitment to go to Nashik today.
But still, you made it happen, sir. Thank you so much. Thank you. Thank you so much. Please. Thanks. Yeah. Thank you, sir. Yeah, sure. Thank you. So, lunch. उनका टाइम का उनका टेस्टिमोनी का टाइम प्ले करेगा.
ठीक है. So now we'll break for lunch. We have 30 minutes and we'll try to get back in 30 minutes and we'll continue. So after lunch we'll have the remaining testimonials and then 4 to 6 we have the press, 2 hours for press, and we'll have other judges or other people here on the stage at that time. Thank you. Let's get back in 30 minutes.
Who else? So you
With
are
both of us. See,
Good afternoon, all. We'll start the second session now, and we are actually running late by half an hour. And Naren sir, we are running late by half an hour, so I request the victim families to somewhat cut down on their thing to the extent possible, not fully. I mean, whatever extent possible, little reduce it a little bit. So because our slot was 1:30 to 2:10 was the next batch testimonial. So now we'll try to, now we are already at 2:10. So what we'll do is we'll from 2:10 to 2:30, let us try to cover 4 testimonials. Narayan sir, Ganesh sir, and Venkata Subramaniam sir, and Sabu Thomas sir. Okay, thank you. Thank you. Narayan sir, please come.
Good afternoon, everybody. May I introduce myself that I am Narayan Nambi. I am from a remote district of Kannur from Kerala state. And my daughter Malavika, third photo from the left hand end, who was 18 years as on 15th October 2021 and was doing +2 at the Government Higher Secondary School, Srikantapuram in Kannur district with an online entrance coaching for NEET 2022. She was excelled not only academic side, but also very active in extracurricular activities. She passed her secondary examination with the mark full A+, and she secured 99.2% marks in +1 public examination. She won numerous prizes in extracurricular activities from the various sectors of the society. And also, she had never suffered any type of disease in her study period except some fever and headache. I was a retired employee from KWA under public sector Kerala government, and I had never reimbursed a single payment for the treatment of my daughter during her living period. She received first dose of COVID vaccination on 26th October 2021 from a community health center in Srikantapuram municipality in Kannur district of Kerala state. As the same was mandatory for the school-going students and the institution regarding this had been issued by the government in time. Hence, we were compelled to accept this vaccine. 2 days after, she felt a small fever and headache, and hence we had given tablets which issued from the CHC of this vaccine received. After 2 days, she felt a small fever and this increasing, and we admitted a nursing home in our hometown. There, she fell in unconscious, and we shifted to a multi-specialty hospital based at Kannur. And after 4 days, she was in ICU. And there, on 6th November 2021, she passed away 10 days after vaccination. The doctor who treated her had approved that it was a clear case of blood clotting issue, which was the side effect of vaccination, that is, vaccine-induced immune thrombotic thrombocytopenia. But at the same time, we got a total negative approaches from the CHC and the state health department. Following this, petition had been submitted to the state health department, state health minister, and district collector. But the result was totally disappointing. And after that, we had approached the State Human Rights Commission, and finally, a case has been filed on Honorable High Court, Kerala. But unfortunately, our daughter has not received justice till this time. Subsequently, but then we found that, like what happened to our daughter, hundreds of children, especially girls, have faced more deaths due to this vaccine. Subsequently, we identified their parents and relatives through the media and other sources. And for the past few years, we have been filing complaints and cases together as much as we can against this disaster caused by this vaccine. The vaccine manufacturers have also admitted that this vaccine has many side effects, and they withdrawn this vaccine, which they provided. But we regret to inform you that we have not received justice from either the side of central or the side of state governments till date. For the past 3 years, our family has been an immense suffering. Our life, which was once heavenly, turned into a hell by this vaccine. She was our only daughter, our dream, and like an angel. Since we are 50 years old, we can no longer have a daughter. Moreover, the law is against it. The pain we felt when we suddenly lost our healthy daughter is something we cannot bear. For the last 3 years, my wife was under depression and is under treatment. My daughter, she was the only girl in a large family. We got her after a long wait. The pain we experience cannot be fully expressed in words. Our suffering is unimaginable. Many times we thought to ending our lives. As such, day passes, memories and thoughts of our daughter keeping piling up. We are living now carrying the guilt and sense of loss for having given our daughter the vaccine that led her to death. Despite many innocent children losing their dreams and lives due to vaccine like Covishield and Covaxin, neither the state nor the central government has provided any justice for our unlucky children. Some of the media insulted our children, claiming they suffered other disease. Now, even though the vaccine manufacturers themselves have admitted the side effects and the vaccine itself has been withdrawn, why are our children still being denied justice? Can you return the joyful lives we have lost? Why should we continue living with this pain and suffering? Death would be better than living with this agony. Our suffering should never be endured by anyone else. This is a catastrophe the parents should ever have to bear. And moreover, I have also one child, my son. He also very brilliant in academic side. Now he is doing house surgery after successful completion of MBBS. Now he is very bad in study, very backward in study. And in the last week, I had discussed him about the post-graduation. But he told me that I am not ready to go to post-graduation I can't this. I don't know what I do. And my wife, he's also a school teacher. He's totally depressed for the last 3 years, and she is under treatment. I don't know how we can go to our life. I don't know. I'm sorry and thank you.
Yeah, sure. My name is Ganesh. Hello. Yeah. My name is Ganesh. I'm an IT professional coming from Bangalore. So I should say I'm quite lucky here to be in front of you. I'm very unfortunate to see that many of the parents here who lost their dear ones. So I would like to explain my story. I've made a few slides here. What happened after the vaccination? So before the vaccination, my health condition was listed out here. Totally hale and healthy. My physical activity was very good. Normal dietary lifestyle. So even my platelet count was around 2.81, which was quite normal there. So there was no chronic diseases or no medication at the point in time. So I took the first dose of Covishield vaccination. That was on the 2nd April in a hospital in Bangalore called Cura Hospital. The post-vaccination, that's on the 3rd day itself, I experienced a bit of, I took the vaccination on the left arm and I see the reaction on the right arm. So I see rashes and sort of discoloration. And I just left it for 1 or 2 days more to see what will it transpire to. But on the fifth day, started seeing more discoloration happening as you see on the pictures which I posted. So it was aggravated and also was leading to pain, swelling, and things like that. And there was also an inside pull in my nerves, which was unbearable. So then I'd been to the hospital. Then they performed the Doppler test. So the Doppler was also showing the brachial artery partial thrombosis, and they also suggested me to contact the surgeon there. The surgeon was not available, so then through my network I have to contact the another surgeon. So I just reached out to the endovascular surgeon called Rahul at the BGS hospital on the same day in the evening, because it was a bit alarming seeing the Doppler report. And he advised me for immediate admission to the hospital. So that was in the late night hours, and I was not prepared for it. And then they start inducing the Clexane 40 mg and on that day. And then they said the further investigation has to be done. And they also have to perform the CT angio the next day. And they were doing all sort of tests in that 3 days of period. So they wanted to rule out if there are any issue reported other than what has been shown on my right arm. Luckily, it has shown up on my right arm because they were able to, or myself was able to identify if something is wrong. Otherwise, it would have happened on my brain or somewhere else. Probably I would have lost my life in the same day itself. So these are some of the medications which suggested me go for ecosprin of 150 mg and so on. And then they discharged me. Again, meantime, I also asked the doctor whether this kind of issue is being already getting reported. Because I took the vaccination moment the government opened up for the people who are above 45 years of age. So the doctor response was no, so far he has not seen much cases, but I also asked him whether it can be registered in the central government portal about the issue, because in the discharge summary they said it is already a thrombosis because of the vaccine it has occurred. But that time also the feedback was no, there is in India as such there is no central repository where we can register it. If more and more cases get reported, maybe 2,000, 3,000 get reported, then there could be a sort of research or an inquiry at the central level to go deeper into the issue. But they didn't log any of my findings or any of the issues, any of the portal.
And meantime, I also reached out to Serum Institute. I explained all the situation, what happened after the vaccine. I reached out directly to the research wing of the Serum Institute, and immediately they sent out me a questionnaire which I had to fill it up. I filled up the questionnaire. I also submitted my medical reports to them. But after that, there was no further conversation from their side. This was in 2021, and even after the discharge, I could see many times the clot was resurfacing at a different time interval at different places. You can also see my right hand getting swollen there. So it was keep happening. So I was always worried why it is happening again and again, even after taking the medication and things like that. So when I went back to the doctor, so they advised me to meet the hematologist. Okay, I think things like is going a bit haywire. So he told me to reach out to the hematologist. And hematologist, what he said is he asked me to do the procoagulant workup or vasculitis workup, and then he noticed that a high level of homocysteine is there, which is about 15.46 readings there. And it also pointed out there is an heterozygous mutation. So then he advised me to meet the cardiologist and the cycle of how my overall body condition and so on. So I met the cardiologist. Cardiologist said, "You are perfectly fine. You don't have any issue." But again, the issue was resurfacing. The hematologist said, "Continue with the egosprin, that 150 mg what he has given." And at some point in time, he also noticed that there is no further bleeding manifestation. So he also advised me to go for the second dose of the vaccination. So this is about 8 months from the time which I took the first vaccination. So it was very risky. I don't know why I took the bold decision, but he was trying to give me a confidence. No, it's okay. I think you're taking the ecosprin. The ecosprin will is a blood thinner. Still, you can go for the second dose. With a half-hearted mind, because that time the COVID, the wave 2 was picking up in a rapid phase. It was a trade-off between whether to get into the COVID or take the vaccine with the side effects. It could be a potential side effects again. But somehow I took the bold decision to take the second dose of the vaccine after the 8 months. So, but I didn't get any further side effects what I saw in the first time because I was already under the medication. But on and off, I have to keep visiting the doctor because the homocysteine level was continuously varying. So every 3 months, 4 months, 6 months, whenever he used to give me the review, I have to go there, I have to perform all these lab tests, and I have to explain about the homocysteine level. So he was also changing the dosage level also to see what best fits to me. So he started adding sometimes more medication, sometimes he has started reducing the medication to get a balance there. And so my submission here is because of this vaccine, I have to visit multiple times to the hospital, and risk of clot in the first year was very high. Then physical activity was reduced because this was also suggested by the doctor that I should not get into any intense activities because that can lead to more pressure on my blood cells, which can cause more clots and things like that. So then on, I just limited myself to just only for walking, nothing more than that. No gymnasium or any other things which I could do. Until today, I'm just having the same situation. Because of the ecosprin which I'm taking, so any bleed things comes in. I mean, it could be minor or a major, and there's a bit of a trauma there. So the healing process will be very slow. I have to stop taking the ecosprin. But I stop taking the ecosprin, then can lead to the clot or any other severe issue. So it's always a trade-off between stopping the ecosprin to get the wound healed. And I also have the gastritis, so ecosprin can also lead to internal bleeding, which we also experienced and which was also reported to the doctor times. And there are associated symptoms like the chest tightness, palpitations, and things like that. Sometimes I was worrying what is happening in my body. So as I said, I started doubting myself whether I can drive my car on my own or should I need to depend on somebody, because so much of variation happening in my body in the last 2.5 years. And it also had a lot of impact on my work as well, because I was not able to take more work on me when it was required. Then my managers, everybody started saying, okay, I understand your health condition. I think you need to go slow. You need to go slow. So that has cascaded so many other in terms of the financial losses and things like that. Yeah, and also sometimes I used to experience the calf stiffness, very stiffness. I was not able to walk uphill. So then I have to bank on some other alternate medicines where they can help me on getting the soothening of my calf muscles. But it took a lot of time. I have to keep visiting the doctor. It was a continuous process for me to keep visiting the doctor, performing all sort of lab tests and getting the reviews. And the people like the hematologist are very rare in the city like Bangalore itself. Hardly you see like 4 or 5 very super specialty doctors available. Getting the appointment was so challenging. So we have to really spend time. Bit of mental trauma there in the last 2.5 years. That's what I experienced with this vaccination. So my humble submission is, or demand is, we need to fix this accountability, because it could have been done with less testing. The vaccine might have been released, and because of which, yeah, many people have suffered. And the full disclosure, that including the EUA status, which Venugopalji was saying, so it's not been done, and it has to be, consent should be there while administering the vaccination. I don't want anybody to suffer anymore the vaccine like this, like how we have seen this. So I think there's enough guidance should be there from the government to ensure that the consent is taken, and then the side effects is disclosed first before anybody takes the vaccination. Some of my colleagues who are studying or who are also with me when I was doing the MBA course, they were using the Siddha medicines and kind of things, alternate medicines. And till today, they challenges us. Yeah, without taking any COVID vaccine, we have survived. So we don't need to have take the COVID vaccine. And likewise, there are alternate medicines people also have challenged. So if you might have heard in Tamil, mostly in the Tamil Nadu, there is a medicine called Kapasura Kudini or something. I don't know how many of you have heard. It was so much rampant everywhere. Everybody started believing that will avoid getting the COVID. So it was so much of scarcity suddenly in the Tamil Nadu that was spread all over India, I said. I think these are all the alternate medicines which we have come across.
Thank you, Ganeshji, for coming and sharing your story with us. Actually, one very important noteworthy point in his story is like he had very serious adverse events on the third day after taking the first dose, and still the COVID hysteria was so bad in the country at the time. I mean, the patients and the doctors themselves recommended a second dose, and he could be convinced to take a second dose, and that shows the kind of brainwashing that was in the level. And I appreciate Ganeshji for coming openly and sharing this with us, because it shows, I mean, it's a case study in itself, I would say, that part, the way the human brain can be made to do these things. Like who would do, given an irrational person, like having gone through that, that's the kind of brainwashing that was in that time. Like the scare of COVID was so high. Okay, now I request next Mr. Venkata Subramaniam to kind of. And what we do is in the next 10 minutes, we finish both two testimonies, and then we move on to Ms. Bhaskar and thing.
Yes. Yeah. We can pay that. Hello. My son is just 25 years old. He is working with Zoho Corporation in Chennai. He went for second dose of Covishield injection. Within 10 days, he got his hands not moving. Then slowly from right hand to left hand also it is affected. Now both legs are also affected. When we went to doctor, we went to CMC Vellore, Trivandrum Hospital, they told it's affected by MND, vaccine, because of vaccine. I have his photograph taken before vaccination, immediately after vaccination, and after vaccination slowly coming down. You can see that step by step. See. This is a video, yes.
Yeah, it's quite less for last time. Like last time.
It's okay, Vicky. I can tell.
Either spike.
Hello.
Hello.
This was his convocation just 1 year before it was taken. He got placement with Zoho and so many other IT companies in the college. He was playing table tennis in the office. So enthusiastic, energetic fellow.
Zoho office. Table tennis playing in Zoho office. KRCT Trichy. Pillayar Puja at house on 22/8/2000.
All these things before vaccination. 3 days before vaccination.
Vaccination 31/8 held immediately after vaccination. Sports activity at Adventure Sports Trichy.
3 days after vaccination.
Paintball, body zorbing. Weakness of bilateral upper limbs. Could not hold any object in both hands. Gradual deterioration of health after COVID vaccination and physiotherapy. Body physiotherapy. Fingers grip physiotherapy. Difficulty from getting up from squatting position. Legs
22.
physiotherapy.
After 2 or 3 months from the vaccination.
Walk decline.
Slowly walking decline.
Twitching of
All
nerves
nerves inside the body were twitching.
Completely bedridden.
Now he is not able to
The
get up.
disease
Only his mother
has
is helping.
progressed from 10% to 70% now.
Now this is his position now. His position is, this is the position now.
After 1 year of vaccination, on 9th October 2022, he has written gate examination with utmost difficulty and passed gate examination. He was selected for master degree course MTech at IIT. For this problem, he has checked with CMC Hospital, Kerala, of income as rupees 20 crores. Disease curing cost as rupees 35 crores. Who is going to take care of him after his parents lives as they are senior citizens? How he is going to live his rest of life? Who is answerable for disability? Government, Covishield vaccine manufacturer.
This is my question. He is my only son. I'm the senior citizen. After our, maybe next 5 years, I'll be able to help him. Afterwards, who is going to take care of him? How is going to live the rest of the life? Is my question. This is purely government is answerable. Commercial manufacturers is answerable for this, for his population. Let us see what's going to happen.
Mr. Sabu Thomas.
I am immensely grateful to you for all giving me an opportunity to speak before this August gathering. My name is Sabu C. Thomas. I'm here to speak about the loss of my only daughter, Nova Sabu. She is the first from that first on 25th January 2002. She was our only child and she soon became the center of our little world. She was a very healthy baby with no chronic diseases. She was energetic and vivacious and endearing to everyone she met. She was also an outstanding student who always scored excellent grades in all the tests. Her ambition was to join in the civil service. So we enrolled her in a prestigious college in Cochin to study English language and literature. She liked the course very much and developed her full energy to pursue her studies. The COVID-19 pandemic turned our lives upside down like all others in the world. We were absolutely thrilled when the government introduced the COVID vaccine to prevent it. We fully trusted the government and media. We fully trusted the government and the media, which assured the general public that it was 100% safe to receive the jabs. Following the government's directive, we decided to vaccinate our daughter, believing that the Ministry of Health and above all, the AstraZeneca company, supported by Oxford University, will never mislead us. We took our daughter Nova Sabu to receive the vaccine at a prestigious hospital called Amara Institute of Medical Science in Kochi on July 28, 2022. On July 28, 2022, we purchased it. We purchased it for 750 because we are a consumer. So remember that one. She is a consumer. So we purchased it and made payments. Soon after receiving the jab, Nova began to feel sick. We thought that it was a natural mild reaction to the vaccine as the doctor warned us. Her symptoms persisted and gradually began to become weak by 5th August 2021. On 28th 2021, she taken the vaccine and she become weak by 5th August 2021. Her condition became unbearable. She complained of severe headache and stomach pain. She also suffered from blurry vision. Malayalam mein bolega. Papa, mummy, ette kannu kaanan pattunnilla ennu paranju. Imagine that difficult situation. Papa, mummy, എനിക്ക് കണ്ണ് കാണാൻ പറ്റുന്നില്ല. She also suffered from blurry vision. By the second day, her condition worsened, and we took her to a famous NABH accredited hospital near our residence. The doctors examined her and gave her medicine for headaches. So one of the important facts we are saying is faced at that time, that during those COVID days, whenever we are consulting a doctor, they are not giving a clear-cut picture about the headaches or stomach pain. But remember, that is the cause of the brain hemorrhage. So the following day, her condition became even more critical, and we rushed her to the same hospital at 2 o'clock in the night. The doctors there advised to move her to a medical college hospital. We took her to Pushpayiri Medical College Hospital, that is in our Tiruvalla, Pathanamthitta districts, and admitted to her intensive care unit. The doctors there found that she had several internal hemorrhages, including her brain and stomachs. Her condition was so serious that doctor could not conduct surgeries. She passed away on 18th August 2021. So the jab taken on July 28, 2021, and she passed away on August 18, 2021. A postmortem was conducted. During after her death, I immediately contacted our medias. Fortunately, one Malayalam Manorama, that is the mostly circulated newspaper in Kerala, they gave the news, but afterwards, not a single media contacted us. They said that if we are giving you the news further, our license will be cancelled. That is the news they're given to us. So that is the news they're given to us. A postmortem was conducted at the Government Medical College, Kottayam, in the presence of eminent doctors. The postmortem report indicates several internal hemorrhages resulting from the adverse effect of the vaccine as the cause of her death. We approached the Chief Minister of Kerala, the Health Minister of Kerala, the District Collector of Pathanamthitta, demanding an inquiry. All of them did nothing. Our only help came from State Human Rights Commission, which ordered an inquiry and demanded a report from medical officer. The DMO eventually submitted the report, in which it was acknowledged that the result was the adverse effect of the Covishield vaccine. So this is the postmortem report from the Kottayam Medical College. See, this is the inquiry. This is the Kerala State Human Rights Commission's notice. This is the inquiry report from State Human Rights Commission. This is the inquiry report we got from the Human Rights Commission. So afterwards, almost all the lawyers we approached and refused to take up the case. Eventually, Mr. Unnikrishnan, the eminent lawyer, agreed to take up the case at the Honorable High Court. The case has been going for 3 years now, and currently it is under consideration of the Honorable Supreme Court. കഴിഞ്ഞ നവംബർ 5-ാം തീയതി ഞങ്ങളുടെ വാക്സിൻ മീറ്റിംഗ്സ് എല്ലാം ഹോണറബിൾ സുപ്രീം കോർട്ടിൽ ഹാജരാകാൻ പറഞ്ഞിട്ടുണ്ട്. നിങ്ങളെല്ലാവരും പ്രാർത്ഥിക്കണം. ബിക്കോസ് ഹോണറബിൾ സുപ്രീം കോർട്ട് ഇതുവരെ ആ കേസ് ഞങ്ങൾക്ക് വേണ്ടി വിളിച്ചില്ല. എങ്കിലും ഹോണറബിൾ ഹൈക്കോർട്ടിൽ ഞങ്ങൾക്ക് വിശ്വാസമുണ്ട്. I must admit that the WHO and the vaccine company discriminate the victims according to their nationality. They have collected billions of dollars in cash for the sake of compensation. Apart of the cost of the vaccine, purported to be for this purpose. In Western countries, they offer millions as compensation. Nothing can compensate the loss of our children. Yet we believe that admission of responsibility on the part of the drug company and the concerned authorities will bring some justice to our children who were nipped in the bud due to their greed and incompetence. Furthermore, we hope that this litigation will give some confidence to the common people of country to fight against justice. I am fully aware that my fight is against a colossal company and powerful authorities who can spare no expense against every common people like me. However, I believe that honorable Indian judiciary and the esteemed judges and think that my daughter and rest of our COVID victims and others will like her will receive the justice. So this is the so in this way we are going on. From the last 3 years we are struggling. If you analyze all these pattern, these photos, same symptoms showed up. If I'm saying frankly, my intimate 8 colleagues died below. They are all below 50 years. All are below 50 years. Intimate friends of below 50 years within these years died. Imagine your family, friends, and your family members, their health condition. This is the pathetic situation our country nowadays facing. In the last, yesterday I consulted an eminent person. He told us that if you analyze the whole world after defense, the medical mafia is distributing crores of rupees for the trial run of the medicines. Nowadays, the developing countries has becomes a tool for the trial of these medicines. Thank you.
Bhaskaran sir.
My namaste to all present. Thank you to the organizers for giving me this opportunity to share what I know. I will begin with the clarification that I am not a medical doctor. I am an engineer. I am trained in numbers. So I will talk about numbers on this topic of the efficacy and safety of the COVID vaccines. The official COVID narrative has been running as follows. In late 2019 and in 2020, the world saw a novel and dangerous virus called SARS-CoV-2, to which everyone was susceptible and hospitals were overwhelmed everywhere with patients. In 2020, the world was saved by means of lockdowns and masks until when, due to science operating in warp speed, safe and effective COVID vaccines saved humanity in 2021-2022. So I will present various numbers publicly available to contradict each and every one of the above claims. So I will try and be brief on this. First, I will talk about why, whether this speed of science, warp speed, was necessary at all. Was the emergency genuine? That is the first part. The second one, I will talk about what happened to various statistical aspects, blunders which were committed when we proceeded at the speed of science, and safety was swept under the rug when the world moved at the speed of science. And then I will conclude. So let's look at whether speed of science was necessary at all. So I was following one of the prominent countries, rather the only prominent Western country which did not lock down in March, April 2020 was Sweden, and it was vilified in the media and by scientists for this, that it did not lock down. So I was following Sweden's data, and in July 2020, I plotted this graph from publicly available Swedish mortality data. Each bar here shows the mortality in 3 months. And it is all the way from 2015 to 2020. I plotted this first in July 2020 and later updated it to include whole of 2020. The point is that the so-called once-in-a-century pandemic, you cannot spot it here. It is not even the tallest bar. One of these bars corresponds to April to June 2020, which is when Sweden had its heaviest COVID casualties. And it's not even the tallest bar. The tallest bar is actually winter 2015. So you may say that, okay, Sweden was able to manage because it's a very sparsely populated country and one of the best healthcare facilities in the world. These are true. However, I was also observing what was happening right next to my neighborhood in the slums right outside my IIT campus, and also in official numbers from Dharavi. Dharavi is in many ways the polar opposite of Sweden, one of the poorest places, one of the densest places on earth. And so there, the total mortality, if you look at the official numbers across 2020 and 2021, it is hardly about 350 deaths in a population of around 800,000 to million. The estimates vary. How come in one of the poorest and densest places on earth, the overall COVID mortality and the overall mortality itself was lower than places like New York, places like London, places like even Sweden? How is that even possible? Places like Singapore, Australia, you can go on and on. So the per capita mortality was lower in Dharavi. How can that be explainable? Kerala too, if you look at the numbers, there were about 48,000 COVID deaths reported in 2021. However, if you look at the overall mortality, it's not that this 48,000 added to the expected deaths. The expected death, the overall count of deaths was about the same as what was expected. So here the numbers are similar for 2021 and 2019, which means that what deaths were being reported as COVID-19 deaths were likely people who would have died anyway. And this was, most of them were likely cases of this, unfit for purpose PCR test. Yes, correct. Yeah. Possible. So if you look at this data, Sweden, Dharavi, and Kerala, you really have to ask the question whether there was an emergency at all. So if you also look at data corresponding to UK, our erstwhile political masters, I plotted this recently. Overall mortality across 5 years, 2019 to 2023, you can see a definite jump in 2020 corresponding to COVID. And the interesting thing here is that even in 2023, the number of deaths is almost the same as 2020. So if there was an emergency felt in 2020, why not the same emergency has been felt in 2023? Okay, let's next look at what were the major statistical blunders committed at the speed of science. In early 2021, media was full of stories of how speed of science gave us these wonderful vaccines with efficacy claimed as high as 95%, some claims even 100% efficacy. However, if you look at the scientific publications which gave these numbers, the actual risk reduction or the absolute risk reduction was hardly about 1%. So this I have plotted for Pfizer, Moderna, popularly used in USA and in Europe. And third one is corresponding to Covishield, most used in India. So the risk reduction was hardly 1% because the risk was extremely small to begin with. So they had to spin the absolute risk reduction of 1% as something very high, because if you tell the world that, look, we have this new product, and if you take it, your risk of getting COVID will fall by 1%, nobody's going to take it. So they had to spin this absolute one as a relative risk reduction And even that number is fraudulent because within a few months, that efficacy actually comes down. The third bar here shows that within 6 months, the efficacy actually falls negative for many of the vaccines, specifically Covishield. Negative efficacy means that the chance of getting COVID is higher if you take the vaccine than if you don't take it. Then they switched the claim to saying that it will protect you against hospitalization. But that also reanalysis of Pfizer's own trial data showed that the risk was as high as 1 in 800, with the numbers likely being higher for Covishield. Very stunningly, this is in a published literature. You can go and see even today in New England Journal of Medicine, the Pfizer results, which were used to approve the vaccine for usage across US and Europe. There were actually more deaths in the vaccine group compared to the placebo group. So this is well hidden in one of the appendix, but it is there. Since many of the victims are young people, it is worth noting what the trial data is for Pfizer's trial. Pfizer conducted a specific trial for the young age group, 12 to 25 years. And there, basically, they found that there was no severe COVID in either the vaccine group or the placebo group, which means there was no problem to solve in the first place. However, the severe adverse events were threefold higher in the vaccine group. Same is the case for the even younger age group of 5 to 11. The risk reduction was basically 0 to 0, and the severe adverse events were higher in the vaccine group. So let me give some more numbers as to how safety has been swept under the rug when we moved at the speed of science. Earlier, I presented data from UK, which showed that the total number of deaths showed a spike in 2020, because of which emergency was declared. If you look at the same UK data, but look at only the under 45 age group, there was no significant spike in 2020. So if you look from 2019 to 2020, it's almost the same. However, the spike happened after the vaccine rollout, starting 2021. And the stunning thing here is that the numbers are the highest number of deaths has happened in the previous year, 2023. So whereas 2020 warranted a declaration of emergency, when the working age group has the maximum number of deaths in the last 5 years, there has been no emergency declared. So this sort of goes to show how the entire narrative of emergency surrounding COVID has been very dishonest. The same is the case for USA. In fact, for most other countries, I show this data. President Biden declared that the pandemic is over on 18 September 2022. On that date, I went and looked at the data. The number of deaths in 2022 until that point was actually higher than in 2020. So it's funny how they're able to twist numbers and get away with it. In India, reliable data is very hard to come by. So I looked at insurance claims. All the life insurance providers are required to declare how much death insurance claims they paid every quarter. So I want you to focus on the third set of bars here, which corresponds to the third quarter of the calendar year, which is July to September. And the tallest bar here corresponds to 2021, which is the official claim is due to the second wave of COVID, the 3 months following the second wave. Certainly a lot of people died. That is clear from at least from this data. But the interesting or stunning thing here is that even in 2022, which is the next bar, so the second tallest bar here, this one, is also almost as high. But nobody has noticed. So it is the same pattern which appears again and again, UK, US, Singapore. If you look at all of Europe, Australia, everywhere, the year after the so-called solution vaccination has seen more deaths compared to the year of the so-called once-in-a-century pandemic. Closer to my home, I looked at some of the data corresponding to heart attacks. In India, probably Mumbai has the best data among what we have in India. There was an RTI filed in mid-July 2022, which revealed that the spike in heart attack deaths in the first 6 months of the jab rollout, a spike corresponded to about 12,000 deaths in 6 months. This is even higher than the COVID deaths. So while for COVID they were shutting down everything and acting hoo-ha, there was no reaction at all for the excess number of heart attacks, deaths which were happening. So this slide, of course, correlation is not causation, strictly speaking in scientific sense, since I'm talking only about numbers, but there are lots of medical journal publications which doctors can speak better to, which indicate that there is a definite causal relationship between not only Covishield, but also various other COVID vaccines which have been used around the world, various kinds of adverse events, including heart attacks and cardiac issues. So where are we right now? Last year, the mRNA technology got the Nobel Prize. So in my view, this is a travesty of science. In fact, the quote from the Nobel Prize Committee, the vice chair of the Nobel Prize Committee, he says that the reason for giving the Nobel Prize is that people will not feel hesitant to take the vaccine. So it's not that the vaccine has been given the Nobel Prize because it is successful. In order to make it successful, he wants to give the Nobel Prize. So that's the level of science we are at. It has become obeisance to power and funding money. All of the known civilizational principles have been reversed during COVID response, especially with respect to the vaccine rollout. For a healthy society, the fundamental principle of law and decency is that human beings should be considered innocent unless they are proven guilty beyond doubt. And new drugs, specifically vaccines which are given to healthy people, generally you start out with the assumption that they are unsafe unless you have incontrovertible proof that they are safe. However, with COVID response, it's been the exact opposite. Humans have been considered as sick or unclean unless they are proven clean by means of a PCR test or by means of vaccination later on. That is, with the vaccine mandates, you have to prove yourself clean. However, the vaccine itself has been assumed safe despite so many red signals which have been seen along the way. So I would like to leave you with this question of whether a product can be called a vaccine at all. Can it be called as a safe and effective vaccine when it has not passed its examination? Its examination is the successful trial. The phase 3 trial results are pending for not only the vaccines used in India, but also all the vaccines, all the COVID vaccines which have been used around the world. None of them have completed phase 3 trial results. So I will end with this. And I have some of these numbers in my book, which if you're interested, I can talk to you about later.
Thank you, Bhaskaran sir, for an excellent presentation where with the numbers you showed us without an iota of doubt that it was a myth that was given to us all. And we kind of were told that COVID was terror and vaccines were the solution and all that lies. You kind of decimated all of them with numbers. Thank you so much. I would request now the subsequent testimonials. Just a second. After which we'll. But sorry, we had a very long question from a long time. Just we are running short of time. No. We'll do it. We are having time. We'll be having interaction. Now I request Mr. Anil and Ajita to come and talk about the child.
എല്ലാവർക്കും നമസ്കാരം. എൻ്റെ പേര് അജിത അനിൽകുമാർ. ഞാൻ ദേവി അനിൽകുമാറിന്റെ അമ്മയാണ്. എൻ്റെ മോള് മരിച്ചത് 2022 ജൂലൈ 10-നാണ്. 9-നാണ് അവൾക്ക് ഇഞ്ചക്ഷൻ എടുത്തത്, വാക്സിന്. കോവിവാക്സ് എന്ന് പറഞ്ഞ ഇഞ്ചക്ഷനാണ് എടുത്തത്. 12 വയസ്സായിരുന്നു, 7-ലായിരുന്നു പഠിക്കുന്നത്. സെക്കൻഡ് ഡോസ് ആയിരുന്നു എടുത്തത്. ഓക്കെ.
Yeah, she was 12 years old when vaccinated. We vaccinated her on the 9th of July 2022, and she was studying in 7th standard and 12 years old.
അതിരമ്പുഴ ഹെൽത്ത് സെന്ററിൽ നിന്നാണ് അവൾക്ക് വാക്സിൻ എടുത്തത്. ഒരു 11 മണിയൊക്കെ ആയപ്പോഴത്തേക്കാണ് എടുത്തത്. പിറ്റേ ശനിയാഴ്ച സ്കൂളിലൊക്കെ വെള്ളിയാഴ്ച പോയി നല്ല ആക്റ്റീവായിട്ടുള്ള നടന്നു. ശനിയാഴ്ച പോയി ഇഞ്ചക്ഷൻ എടുത്തു. ഉച്ചയായപ്പോഴത്തേക്ക് പിന്നെ കഴിച്ച് ഭക്ഷണമൊക്കെ കഴിച്ച് രാത്രി കിടക്കുന്നോണം വരെ ഒരു കുഴപ്പമില്ലായിരുന്നു. ഒരു 4-4:30 ആയപ്പോ പനിക്കുന്നു അമ്മയെന്ന് പറഞ്ഞുകൊണ്ട് ചാടി എണീറ്റു. പനിച്ചിട്ട് പാരസെറ്റമോൾ ഒക്കെ കൊടുത്തു. അത് കഴിഞ്ഞ് ഒരു 8:30-9 മണിയൊക്കെ പനി മാറി, ഭയങ്കര ക്ഷീണമൊക്കെ ആയി. പിന്നെ വോമിറ്റ് ചെയ്തു, പിന്നെ ബോഡി പെയിൻ ഒക്കെയാന്ന് പറഞ്ഞു. അത് കഴിഞ്ഞപ്പോ പിന്നെ ക്ഷീണമാന്ന് പറഞ്ഞ് കിടന്ന് കുഞ്ഞ്.
Okay. She was active in the school on Friday. She went, played and well and came. And on Saturday morning, 11 o'clock, I gave her the vaccine. We gave her the vaccine in the nearby PHC. Till evening 4, she was kind of all right. She played and all that stuff. We had tea in the evening. And after that, fever developed. We gave her paracetamol and she went to sleep. And by night, the fever became better, but she started getting stomachache and vomiting started. So then after that, after vomiting, she went to sleep again.
ഉച്ചയൊക്കെ ആയപ്പോഴത്തേക്ക് അന്ന് ഹോസ്പിറ്റലിൽ പോകാന്ന് പറഞ്ഞ് എണീറ്റു ഹോസ്പിറ്റലിൽ പോകാനായിട്ട് തുടങ്ങിയപ്പോഴത്തേക്ക് ഭയങ്കര ക്ഷീണം. അമ്മയെ വേണ്ട, ഇന്ന് സൺഡേ അല്ലേ, അത് കാരണം ഹോസ്പിറ്റലിൽ ഒന്നും കാണത്തില്ല എന്ന് പറഞ്ഞ് കുറച്ചു നേരം കൂടെ കിടന്നു. അന്ന് ആയിക്കോട്ടെ എന്ന് പറഞ്ഞ് ഞങ്ങൾ ഇവിടെ ഇരുന്നു. പിന്നെ പെട്ടെന്ന് ക്ഷീണമാണെന്ന് പറഞ്ഞുകൊണ്ട് കിടന്ന് അച്ഛനെ വിളിച്ചു. കഴിക്കാൻ ക്ഷീണമായതുകൊണ്ട് കരിക്കും വെള്ളം വേണമെന്ന് പറഞ്ഞത് വാങ്ങിച്ചു കൊടുത്തു. ശകലം കഴിച്ചു, പിന്നെ വോമിറ്റ് ചെയ്തു. പിന്നെ കുഞ്ഞ് തളർന്നങ്ങോട്ട് വീഴുമായിരുന്നു കയ്യിലോട്ട്.
Okay. Next day being Sunday, whether the doctors will be available, and she was also saying, let's not go now, doctors won't be there. So she delayed the thing. We also delayed, and she wasn't eating anything. And we bought her coconut water, tender coconut water to drink, and she drank a little and vomited it immediately. And then she was just kind of falling in our hands without any energy.
പിന്നെ ഞങ്ങളുടെ തൊട്ടടുത്താണ് ഹോസ്പിറ്റല്, മെഡിക്കൽ കോളേജ്, കോട്ടയം മെഡിക്കൽ കോളേജ്. കോട്ടയം മെഡിക്കൽ കോളേജിലേക്ക് കൊണ്ടുപോയെന്ന വഴിക്ക് മരണപ്പെട്ടു എന്നാണ് പറയുന്നത് ഡോക്ടർ. അവിടെ ചെന്നപ്പോഴേ ഞങ്ങൾക്ക് കുഞ്ഞ് നഷ്ടപ്പെട്ടിരുന്നു.
Okay, actually we live near Kottayam Medical College somewhere. I mean, the nearby big hospital is Kottayam Medical College. So we took her there, and the doctors declared her arrived dead. So we understand that she was dead on the way. They didn't realize the child was lost when on the way. In fact, they reached the hospital and found that she was no more.
ഞങ്ങളുടെ കുഞ്ഞിന്റെ വേർപാട് ഞങ്ങൾക്ക് ഇപ്പോഴും ഒന്ന് എന്താ ഒന്ന് പറയേണ്ടതെന്ന് എനിക്കറിയത്തില്ല. ഒന്ന് മനസ്സിലേക്ക് ഒന്ന് മരിച്ചു എന്നുള്ളതൊന്ന് റിയലൈസ് ചെയ്യാണ്ട് ഞങ്ങൾക്ക് ഇതുവരെയായിട്ട് പറ്റിയിട്ടില്ല. അതുകൊണ്ട് ഞങ്ങൾക്ക് ഒരു എല്ലാ കേരളത്തിൽ നിന്നല്ല, ഇന്ത്യയിലെ എല്ലാ അമ്മമാരുടെയും മനസ്സിലെ ആ വേദനകളും സങ്കടങ്ങളും എല്ലാം ഉൾക്കൊണ്ട് ഞാൻ പറയുകയാണ്. എല്ലാം വാക്സിൻ എടുത്ത വാക്സിൻ എടുത്ത കുട്ടികളായാലും എല്ലാവരും മരണപ്പെട്ട എല്ലാവർക്കും വേണ്ടി ഞാൻ പറയുവാണ്. ഇതിനൊരു എന്താ പറയാ, ഇതിനൊരു അവസാനം വേണം എന്ന് ഞാൻ പറയുകയാണ്.
Yeah, basically, she says, I don't have words. The pain that I go through is, I cannot put in words. And I'm speaking for all the mothers who have lost their children in this country for vaccine. This pain is indescribable, and we need an end to this. We need justice. We need an end to this. So this is what I've got to say.
Thank you. Thank you very much.
Thank you, Ajit.
Kiran Yadav.
मैं किरण यादव हितेश कड़वे की मम्मी बात कर रही हूँ। मेरा बच्चा 24 ईयर्स का था। बॉम्बे में रहती थी मैं और विरार में। कुछ काम के हिसाब से मैं नासिक गई थी। बच्चा घर पे था, उसने वैक्सीन लिया, विद इन 2 घंटे में वो डेथ हो गया। उस टाइम घर पे कोई था नहीं, उस टाइम सिर्फ वो अकेला था। मेरा एक ही बच्चा था। वो दरवाजा तोड़ के उसको बाहर निकाला गया। उसके दोस्त लोगों को बोला, क्योंकि मैं घर से कम 200 किलोमीटर दूर थी, घर पे वो अकेला ही था। दरवाजा तोड़ के निकाला गया था। डॉक्टर बाजू में डॉक्टर रहते थे, उनको बुलाया, ऐसा ऐसा हुआ है, तो डॉक्टर ने डिक्लेयर कर दिया कि डेथ हो गया ऐसा करके। मेरे पास कुछ शब्द नहीं है अभी, क्योंकि मेरा अकेला बच्चा था। मैं किस किस को क्या क्या बताऊं, मुझे कुछ भी नहीं समझ में आ रहा, मुझे कोई रास्ता भी नहीं है। अभी वो मैडम बोल रहे थे, उनकी भाषा हमको समझ में नहीं आ रही थी, मगर उनकी जो आवाज आ रही थी उससे हम एहसास कर रहे थे कि एक माँ के ऊपर क्या बीत रही होगी। तो मीडिया को एक ही रिक्वेस्ट है, हम उनकी भाषा भी नहीं समझ रहे तो भी हमको समझ में आ गया कि इनको क्या बोलना है, क्योंकि वो एक माँ है। मगर मीडिया से एक रिक्वेस्ट है, कुछ तो भी। हम किसी भगवान के पास नहीं जा रहे, किसी मंत्री के पास नहीं जा रहे, हम सिर्फ एक मीडिया के पास जा रहे, क्योंकि हमको एक न्याय मिले। न्याय के लिए हम कहाँ से, महाराष्ट्र से बॉम्बे, बॉम्बे से लेके दिल्ली, दिल्ली से लेके पूरा हर जगह में जा रहे हैं, एक न्याय के लिए, सिर्फ न्याय के लिए। आज कोई भी हमारे लिए कोई इतना एफर्ट कर रहा है, तो एक रिक्वेस्ट है मीडिया से, आप लोग सिर्फ आवाज उठाओ। हम सबको आपके ऊपर ही आशा है, और कुछ हमारी आवाज कहाँ तक पहुंचानी नहीं पहुंचानी, सिर्फ न्याय देने का काम आपका ही है। हम किसी भगवान के पास भी नहीं जा रहे, इतना कुछ कर रहे हैं, सिर्फ हमको न्याय मिले इसके लिए। क्योंकि आज की तारीख में मैं सिर्फ अकेली हूँ, मुझे कोई बच्चा नहीं है, माँ नहीं है, बाप नहीं है, भाई नहीं है, कोई नहीं है। सिर्फ एक न्याय के लिए हम हर जगह में जा रहे हैं, हर जगह में न्याय के लिए रिक्वेस्ट कर रहे हैं, हर जगह अपने अपने रिक्वेस्ट कर रहे हैं, हर अपना अपना एफर्ट लगा रहे हैं। सिर्फ एक ही रिक्वेस्ट है कि ये जो भी हुआ है इसके आगे भी हो ही रहा है, क्योंकि है ठीक है, हम किसके साथ ये कर रहे हैं, क्योंकि वो बहुत बड़े लोग हैं। बड़े लोग ने हर जगह में वो भी तो एक इंसान ही है ना, इंसान इंसान से लड़ सकता है, मगर हमारा जरिया सिर्फ मीडिया से है। मीडिया की थ्रू से हमको न्याय चाहिए, इतनी रिक्वेस्ट है, हमको न्याय मिले, बस आपकी थ्रू से ही मिल सकता है, यही मैं कहना चाहती हूँ बस।
This is see what happened was Kiranji's son, only son actually, Hitesh Kadve, he got vaccinated at 10:30, around 10:30 in the day. And within half an hour, he had very severe headache. He told his friend, I'm going to go home and sleep. And later, when nobody opened the door, when they broke open the door, this is what they found. He had kind of felt so much pain, he had somehow fallen off. And then the postmortem clearly shows intracranial hemorrhage and really, I mean, the brain has literally, there is a blood clot and explosion in the brain. So this is something what, I mean, we cannot even imagine what he would have gone through and what she is kind of going through now. This is kind of, I don't know, the kind of the sorrow that this has inflicted on people is so immense. And we as a country, we are kind of going ahead with life as if nothing has happened. And at least 50% or 60% of the people are celebrating vaccination as if it's a big success. There cannot be a much bigger, I don't know what to even say, it's so surreal it is. So I won't take any more time, and over to Anjali's uncle, yeah, Manish Pandey, please.
good evening. Yeah, so Anjali was our niece. I'm so sorry. Anjali was our niece. I am her aunt and Manish is her uncle. Anjali was 23 years old. Anjali was hale and hearty. This one? Okay. Okay. Anjali was very healthy. She did her MBA from a reputed college in Bangalore. And after completion of her MBA, she was placed in one of the leading financial institution in Bangalore. Now, it was mandated by the government to get vaccinated, and as well as with the corporates and the organizations to get vaccinations before they can continue their working. Yeah. So 4th of July, she called us. She called every one of us in a call conference, and she said she was super excited that she's going to get her first dose of Covishield vaccine. She showed us what she's going to eat in her breakfast, and then she went to take her vaccine. After taking her dose, she again called us to inform, okay, it was all good, she was all fine. At night, she started complaining about severe headache and mild fever. So as all of us were advised, paracetamol is the only key. So we also advised her, okay, take paracetamol, take some rest. And we asked her to take rest. We did not disturb her. Late morning, we started calling her. She was very close to her grandmother. All of us started calling her, but she was unresponsive. No one was picking up the phone. We said that, okay, might be she's taking more rest. She's not well. We again trying to call her, connect with her, post 1 or 2 hours, and then no response. Then we got worried. We asked her friends to check what has happened. She was staying in a paying guest in Bangalore, and friends went, they knocked the door, they tried opening the door, it was locked from inside. They barged open the door. When they opened the door, they found her unconscious, lying beside her cot. And
Like how Hitesh Kadve was lying down.
yeah, yeah, exactly. So, and then they rushed to the nearby hospital, Ramaya Hospital, MS Ramaya Hospital, and there she was declared after initial analysis that she is brought dead. She was brought dead, yeah. It was hardly 24 hours. We didn't have that much time to react. We didn't know what to do. We all were scattered amongst different places of this country. Yeah, the government mandated the use of this COVID vaccine, and now we feel that it's a forced compulsion that made us, lose our child like that way. And we all rushed to Bangalore the same day, 5th of July. We all rushed to Bangalore. We only expected little cooperation from the doctor's side. We lodged an FIR. We were told that the case will go for forensic, the case will go for autopsy, then forensic. We were told that it will go to Pune. It will go to, yeah, and it will take 4 to 6 weeks. But still now, when we check the case, it says the death reason is unclassified. What does that mean? A person who was hearty and healthy 24 hours before, she died, and the death reason is unclassified. Her father till date is blaming himself that because of him, he allowed that girl to, work outside her own native area. He shouldn't have done this. And he's cursing himself. He has gone through a lot of mental trauma. The entire family, he shuttered down his business, financial loss, mental trauma. Till date, the entire family is, mourning around that. And I mean, we have already lost her. The only thing is that we want to know an answer. What has happened to her? The symptoms were more like thrombosis, TTS, yeah, and that is one of the, now when we go back and check in internet, okay, that's one of the side effects of Covishield vaccine. We were not aware of that. We were made to believe that this is a vaccine, this is going to help us. But the work of vaccine, I mean, I don't know what should we call it, but it has worked in a different way. We all are really scared. We all are really scared. What has happened to that child? Within few hours, that child collapsed. That's the, I mean, as a parent, we at least expect in a country of 145 crore people, where Covishield and COVID vaccine was launched as a big bang campaign. Yeah, the aftermath that we are doing right now, I believe that a pre-analysis in a proper way should have been done so that we are aware, okay, there are side effects. It's up to us whether we need to take that vaccine or we don't want to take that vaccine. We are aware. That awareness was not there. And due to which we are so many parents here, we are listening to everyone, we can relate the story. Until date, we are fighting for a justification. I mean, that's the minimum, bare minimum as a citizen of this country we can expect out of the government, out of police, out of doctors. I don't know whose fault is this, but nobody supported us. Till date, we are just going here and then. That's the only. You want to add something? Yeah. Thank you. Yeah. Thank you so much.
Thank you.
Next, we have Dr. Sujata Mittal. She is a senior gynecologist, and she'll talk about COVID vaccines and women's health.
Namaskar to everyone. Just before starting my speech, I just wanted to tell you that I just posted the pictures that I'm here and speaking on the topic regarding the COVID vaccine and reproductive health, rather the women's health. I've been removed from my groups that were spreading the misinformation regarding the COVID vaccines. So I'll be talking a bit about women's health, but before that, there are certain issues which I would like to point out to the general public, because of course I can understand the dilemma of the public in while they come with their near and dear ones to the doctors, and the behavior of the doctors is not, I would say rather it's very fishy and it's not good, and we are not taught all those things at all, how to deal with emergencies. Rather, it should be I've been telling my children, my elder son is in management of the hospitals, that you should start the services and teach the doctors how to talk to the patients while they are admitted unnecessarily means unforeseen complication due to the surgery or to the medical treatment, and how to behave with the attendants, how to talk with the attendants. So that's another subject. But what I want to start with that, there's no immune response which is entirely free of risk of adverse reactions and remote sequelae. So if you think that you are giving or putting anything in the form of the vaccines in the body, there won't be anything happening to the immune response. It is not going to happen. And in this era where number of the diseases, especially the chronic health conditions like diabetes, hypertension, autoimmune disorders, autism, Parkinsonism, and Alzheimer and whatnot, and the admissions in the ICU, number of the drugs which are being produced, and the resistance of the antibiotic, the number of the health coaches, and the number of the influencers. And we doctors, we are not taught nutrition. तो हमको भी अब हम भी लोगों को आज ये बोलते हैं कि ये मत खाओ वो मत खाओ, and we have come to the एक terminology कि whole plant based food जो है, organic लो, cold pressed oil लो. और आपके सबके इंफॉर्मेशन के लिए आई वांटेड टू टेल यू दैट द वैक्सीन्स दे आर फुल ऑफ द एडिटिव्स, इमल्सिफायर्स, उनमें एंटीजेंस होते हैं विच आर किल्ड और वीकेंड पैथोजेंस. और एचपीवी वैक्सीन में तो चिंपांजी एड्रीनोवायरस जो होता है एज ए वेक्टर यूज किया जाता है. तो बहुत सारे वैक्सीन में एनिमल्स में जो पाए जाने वायरस या बैक्टीरिया होते हैं उनको यूज किया जाता है. वी आर यूजिंग एडजुवेंट्स लाइक एल्यूमिनियम, हर वैक्सीन में ज्यादातर आपको एल्युमिनियम मिलेगा, एल्युमिनियम फॉस्फेट या एल्युमिनियम हाइड्रोक्साइड मिलेगा, वाटर ऑयल इन वाटर मिलेगा, आपको प्रिजर्वेटिव लाइक जो आप खा भी नहीं सकते हो, फॉर्मल्डिहाइड मिलेंगे, बोरिक एसिड मिलेगा, बोरेट मिलेगा, पॉलीसॉर्बेट 80 मिलेगा, और इट माइट कंटेन अ ट्रेस ऑफ एग प्रोटीन्स ऑल्सो, और वो आप इंजेक्ट कर रहे हैं, कुछ में ही आप ओरली दे रहे हैं, अमाइनो एसिड, जिलेटिन वगैरह, ये सब आप लोगों को वैक्सीन के अंदर मिलेगा। तो आज के जमाने में जब हम लोगों को ये कह रहे हैं कि आपको हेल्दी खाना है और आपको एक्सरसाइज करनी है, मेडिटेशन करना है, वैक्सीन के थ्रू वी आर पुशिंग सो मेनी अननेसेसरली इंग्रेडिएंट्स इन आवर बॉडी, एंड आई वोंट से कि ये सारा कुछ ओनर्स डॉक्टर्स के ऊपर जाता है, बिकॉज अभी बहुत सारी बातें हो रही है डॉक्टर्स के लिए, बट मोस्ट ऑफ द डॉक्टर्स आर अंडर प्रेशर इन द कॉर्पोरेट हॉस्पिटल्स। जो हम लोग हैं, हमको भी अपने घर चलाने हैं, मैं ये नहीं कह रही हूँ कि मैं आप लोगों के साथ नहीं खड़ी हूँ, बट सबको अपना काम करना है। अभी आरजी घर में कलकत्ता में वो डॉक्टर की जो मर्डर हुआ, रेप हुआ, सब 1-2 महीना चला, फिर सब अपने अपने काम कर रहे हैं। प्लस फार्मा कंपनीज को 2 मिनट नहीं लगेंगे किसी भी डॉक्टर का लाइसेंस कैंसिल करने में या उनको बर्बाद करने में। अमेरिका में, यूएसए में कई डॉक्टर्स का मर्डर्स भी हो चुके हैं, दैट्स नॉट सो वेरी कॉमन इन इंडिया। तो ओनर्स जो है बहुत कुछ पब्लिक के ऊपर भी जाता है। अब आजकल तो हमारे पास पेशेंट्स आते हैं कि सब कुछ गूगल करके पढ़ के कि क्या डिजीज है, क्या मतलब रेंटेक के लिए बोलते हैं कि डॉक्टर साहब इसको खाने से कोई प्रॉब्लम तो नहीं होगी। तो एक सजेशन मेरा, मतलब बिफोर टॉकिंग अबाउट द वुमेन एंड रिप्रोडक्टिव हेल्थ और वुमेन्स हेल्थ एंड वैक्सीन, मैं आप लोगों से एक रिक्वेस्ट करूंगी कि आप लोग जो है हर चीज को मतलब पढ़े। आप वैक्सीन के बारे में भी सब कुछ गूगल पर एवरीथिंग इज अवेलेबल, चाहे गवर्नमेंट ने मैंडेट किया है नहीं किया है, पर उसका ओनर्स बहुत कुछ, क्योंकि आप कंज्यूमर हैं, तो हमें पढ़कर जाना चाहिए, हमें पता होना चाहिए कि क्या क्या प्रॉब्लम्स हैं। और इन्फॉर्म कंसेंट की बहुत वैल्यू है, जो कि हमारे देश में बिल्कुल भी नहीं है, और इसके लिए मीडिया है, अभी सब लोग, हम सब लोग मिलकर काम कर रहे हैं। अभी जैसे एचपीवी वैक्सीनेशन हो रहा है, रोटरी क्लब जो है उसको बहुत ज्यादा पुश कर रही है, स्कूल्स में कर रही है, इन्फॉर्म कंसेंट्स ले रही है, पर उसमें साइड इफेक्ट्स नहीं बता रही है, बस आपको वैक्सीन लग जाएगा, सेफ्टी है ये। तो पेरेंट्स का ओनर्स भी बहुत ज्यादा है, इस आई वांटेड टू स्ट्रेस। मोरओवर हमें यहाँ पर ये भी देखना है कि गवर्नमेंट जो है हमारी, क्योंकि गवर्नमेंट इज बीइंग पुश बाय सी, पूरा जो मैंने समझा है या पढ़ा है उसमें ये कि पूरा वर्ल्ड जो है, पॉलिटिशियंस, मीडिया, आपका फार्मास्यूटिकल एंड डिफेंस में जो है, यही पूरे वर्ल्ड का जो है मोनोपोली चला रहे हैं, फाइनेंसेस जो है मैनेज कर रहे हैं। तो गवर्नमेंट अगर रूल बना सकती है या एडवर्टाइज कर सकती है कि सर्वाइकल कैंसर वैक्सीन के लिए, कोविड वैक्सीन के लिए, तो ऐसे ही पेंडेमिक्स और एपिडेमिक्स को अवॉइड करने के लिए, जैसे सर्वाइकल कैंसर है उसको अवॉइड करने के लिए, क्योंकि जैसे सर्वाइकल, आई एम टोटली अगेंस्ट एचपीवी वैक्सीन, क्योंकि उसके रिस्क फैक्टर्स हैं। रिस्क फैक्टर मीन्स आप उसको 100% अवॉइड कर सकते हैं। आजकल लड़कियां दे आर बिकमिंग सेक्सुअली प्रॉमिस्क्यूअस, 12 साल की एज से लड़कियां सेक्सुअली एक्टिव हो गई, मल्टीपल पार्टनर्स हैं। पिल्स, ओसीज जो है गवर्नमेंट हॉस्पिटल में ऐसे ही मिल रहे होते हैं, ओवर द काउंटर जाओ आप उठा लो पत्ता, किसी को कोई मतलब नहीं, आंगनवाड़ी वर्कर्स आपको दे देंगे। सो गवर्नमेंट, वी हैव टू, वी द पब्लिक, द मीडिया, we need to motivate the government to make the rules कि OCs आप गर्ल्स अंडर 18 क्यों आप गवर्नमेंट हॉस्पिटल्स में दे रहे हैं, वो आपकी इम्यूनिटी को लो करते हैं। तो इसी तरह से एपिडेमिक्स और पेंडेमिक जैसे कोविड हुआ, उसके अगर गवर्नमेंट एडवर्टाइज कर सकती है कि कोविड वैक्सीन जो है लेनी है आपको, तो व्हाई कांट दे एडवर्टाइज, या इतना शोर क्यों नहीं मचा सकते कि आप कोविड या पेंडेमिक को या सर्वाइकल कैंसर को कैसे प्रिवेंट कर सकते हैं। तो इसके लिए आप हम सबको मिलकर, मीडिया को मिलकर, क्योंकि हमें दबाना तो पड़ेगा ही पॉलिटिशियंस को, फार्मा कंपनीज को। तो एक तो ये पॉइंट मैं आप लोगों को कह रही थी। दूसरा मैं ये कह रही थी कि इन्फॉर्म चॉइसेस जो हैं, कंसेंट्स है, इन्फॉर्म चॉइसेस है, जैसे एल्युमिनियम फॉस्फेट है, तो अगर एफडीए की जो लिमिट, सेफ लिमिट है एल्युमिनियम की, वो है अराउंड 25 माइक्रोग्राम आईवी। पर एक बच्चा, एक आयरिश स्टडी के हिसाब से, एक बच्चा बाय द एज ऑफ 15 to 20 years, that child takes around 125 micrograms of aluminium in the body through vaccines alone. इतना वैक्सीन और इट इज नाउ प्रूवन बियॉन्ड डाउट कि जो एल्यूमिनियम है दैट इज ए न्यूरोटॉक्सिक, और एल्यूमिनियम जो है आपका अल्जाइमर, पार्किंसोनिज्म, बैड बिहेवियर, वॉलेटाइल बिहेवियर, न्यूरो डिजेनरेटिव चेंजेस के लिए रिस्पॉन्सिबल है। तो इन्फॉर्म चॉइसेस हम लोगों को बनानी है, पब्लिक को करनी है, और डेफिनेटली हमारा भी रोल है। ये सब अभी ये जो सब हुआ उसके कारण से मैंने भी बहुत पढ़ा, न्यूट्रिशन के बारे में पढ़ा, इंटीग्रेटिव। अभी बात हो रही थी कि कोविड से जो साइड इफेक्ट्स हैं उनसे अवॉइड करने के लिए, तो दे आर डेफिनेटली सर्टेन थेरेपीज जो है हम लोग यूज करते हैं, हाई डोज IV विटामिन C वगैरह है। आई एम नॉट सेइंग कि 100% है, बट डेफिनेटली बहुत कुछ उससे आप कम कर सकते हैं। मेडिटेशन है, एक्सरसाइजेज है, ये सारी चीजें आपको हेल्प करती हैं। देन द थर्ड फैक्टर विच आई वुड लाइक टू टेक अप इज दैट एक हमारे मेडिकल में बहुत बड़ा पैराडिम शिफ्ट आया है। पहले जब हम पढ़ाई करते थे तो कहते थे कि फर्स्ट डू नो हार्म, कोई हार्म नहीं करना है, और अब उसमें एक इतना बड़ा शिफ्ट आ गया है कि देयर इज अ टर्म कॉल्ड बेनिफिट ओवर द रिस्क। हमको कहा जाता है कि अगर 100 में से या 1000 में से 2 भी मर जाते हैं, पर बाकी के 988 जो है वो बचते हैं, तो इसमें कोई वो नहीं है। तो दैट इज, आई फील दिस इज अ सॉर्ट ऑफ क्रिएटिंग द नैरेटिव जो कि हमारे इंडिया में हिंदुइज्म और सनातन के लिए भी किया गया। और एक इट इज ए कॉल्ड एवर्टन विंडो। एवर्टन विंडो का प्रिंसिपल जो है वो ये है कि जो चीज अनथिंकेबल है वो रेडिकल में कन्वर्ट की जाती है, फिर उसको एक्सेप्टेबल करवाया जाता है, फिर उसको सेंसिबल माना जाता है, फिर उसको पॉपुलर किया जाता है, और फिर उसको पॉलिसी में बदल दिया जाता है। यही एवर्टन विंडो जो है वैक्सीन के लिए ही करी जा रही है कि जो चीज बिल्कुल थिंकेबल नहीं थी कि आपको वैक्सीन मैंडेट, अब हर चीज के लिए, मतलब वायरस को एलिमिनेट करना है तो वैक्सीन है, बैक्टीरिया को एलिमिनेट करना है तो वैक्सीन है, टाइफाइड हुआ है तो उसको वैक्सीन से करना है, सर्वाइकल कैंसर। तो दिस इज व्हाट द pharmaceutical companies are doing now. What I have read कि pharmaceutical companies के पास अब drugs बनाने के लिए बहुत कम रह गई हैं, because they are now at the peak of making the drugs. They don't have so many molecules, तो they are after the vaccines, और vaccines में उनका एजेंडा है कि छोटे से छोटे बच्चे को लेकर 15 तक की एज के सारे तरह के वैक्सीन्स दे दिए जाएं। So when we started our studies in 1988 में, जैसे मैंने अपना MS पूरा किया था, तो उस वक्त हम लोग 7-8 वैक्सीन ही देते थे। BCG देते थे, DPT देते थे, एंड ओरल पोलियो, और उसके बाद थोड़ा हेपेटाइटिस B वगैरह का आया। नाउ एवरेज चाइल्ड इज गेटिंग अराउंड 20 to 25 वैक्सीन है, 43 बाय द एज ऑफ 5 years, और भी बढ़ते जा रहे हैं। अभी तो मैंने शायद पढ़ा कि WHO की रिकमेंडेशन है कि कोविड 6 months के चाइल्ड से शुरू है। इट इज कमिंग इन द कि कोविड वैक्सीन जो है 6 months के बच्चे को आप देना शुरू करें। FDA, yes, FDA. So again, yes, and let me tell you, FDA, CDC, NHS, all they are funded by the Bill Gates, and जो भी pharmaceutical बड़ी कंपनीज हैं वो सारा उनका पैसा इनके पास जा रहा है। तभी अभी कह रहे हैं कि जैसे ट्रम्प ने कैनेडी जूनियर को बनाया तो बहुत सारे कंपनीज के शेयर्स फॉल कर गए, बिकॉज ही हैज रिटन अ वेरी ब्यूटीफुल बुक। अगर आप लोगों को वैक्सीन के लिए पढ़ना है तो उस बुक को जरूर पढ़ना चाहिए, कि रियल फेस ऑफ द एंथनी फॉसी, तो वो आप जरूर पढ़ें। उसमें सारे वैक्सीन के बारे में बहुत डिटेल में दिया गया है। देन ऑफ कोर्स द रिपोर्टिंग सिस्टम जो है हमारी कंट्री का, AFAI का, बहुत ही पुअर है। आप जो कह रहे थे कि 3 रीजन हो सकते हैं, पर मोस्ट कॉमन रीजन जो है वो साइट को फेल कर दिया जाता है। मेरी कई बहुत डॉक्टरों से बात हुई है और वो कहते हैं कि दे आर ट्राइंग टू पुट द कॉजेज। ऐसा नहीं है कि डॉक्टर्स को नहीं सफर कर रहे, इवन आई एम हैविंग लॉट ऑफ प्रॉब्लम्स, ब्रेन फैटीग है, in general fatigue. My husband has a transient TIA and no reason was found. He had hemoptysis. अभी उनको neuropathic problems चल रही हैं, and there's no treatment. मतलब he had been admitted in Paris for 4 to 5 days. Every painkiller, every drug had been tried, nothing happened. और फैटीग इज ए मेजर प्रॉब्लम। तो बहुत सारे डॉक्टर्स कहते हैं कि AF में जो भी एजुकेटेड है उनकी मेन एक कंप्लेंट तो जरूर आती है कि जो गवर्नमेंट का पोर्टल है इट इज नॉट फंक्शनिंग। सो आई डोंट थिंक कि वाटर को इंजेक्शन मिलाया गया होगा, इतना तो टाइम ही नहीं होता कि ड्रग्स को आप रिप्लेस करो vials को वो सारा, but definitely they make the portals inefficient and they don't reply back. So these and definitely डॉक्टर्स जो हम लोग हैं, जब हमको कोई चीज नहीं समझ में आती है तो हम लोग डेफिनेटली कहते हैं कि ये तो बहुत रेयर है, कोई इंसिडेंटल है, मैंने तो कभी इसके बारे में सुना ही नहीं है, या जैसे मुझे लेबल करते हैं कि यू आर एंटी वैक्सर, ठीक है, या तुम साइकोसोमेटिक हो, यू आर अ साइकोसोमेटिक पर्सन, दे विल टेल. अगर रिपीटेडली इफ यू गो टू ए डॉक्टर सेइंग कि मेरी ये प्रॉब्लम हो रही है और उसका कोई आंसर नहीं है और क्या समझ में ही नहीं आ रहा, बिकॉज आई डोंट थिंक कि डॉक्टर्स बहुत ज्यादा, एवरेज डॉक्टर बहुत ज्यादा पढ़ता है, लिटरेचर को फाइंड आउट करता है, तो ये रीजन डॉक्टर्स के पास रहते हैं. बट डेफिनेटली लेट मी टेल यू वन थिंग, इफ यू आर पुटिंग अप सो मेनी emulsifiers, adjuvants, surfactants in the vaccines into the immune system, the immune system is bound to go haywire. It doesn't know how to respond to so much of the chemicals because our air is polluted, our food is polluted, our water is polluted, and we are adding more and more polluted things into the blood or into the gut through the vaccines also. So now coming to the final vaccines and the women's health, हम यहाँ पर हैं, हम देख ही रहे हैं कि I will be focusing a bit about TTS. वैसे होने women में जो है encephalitis, myelitis, सीजर्स है, गुलन-बेरी सिंड्रोम, मायोकार्डाइटिस कम होते हैं, बट TTS इज द मेन. और इसमें लिटरेचर में क्लियर इट इज रिटन दैट द चांसेस ऑफ women और द गर्ल्स हैविंग द TTS is 2 times, it is 2 times commoner in girls as compared to the males. And here also we can see कि जो 12 हैं उनमें से almost 90%, 90-95% लड़कियां ही हैं. It is there the hormonal hormones in the body, because estrogen जो है हम लोग बनाते हैं बॉडी में, women के होते हैं, that causes lot of thromboembolism. Plus pregnancy is a very very high risk for the TTS also. Okay, तो एक तो ये था. Then let me tell you the mortality because of the TTS is almost 90% if you treat a person. And it in spite of best treatment, the mortality is 10 to 15%. And we can just imagine जो कि बिल्कुल डिस्ट्रिक्ट लेवल पर या रिमोट में है, उनकी कैसे मतलब कहाँ पर ट्रीटमेंट हुआ होगा. वी आर सीइंग हियर गर्ल्स को कैसे लेके मतलब जो प्रॉब्लम्स हुई, दे कैन नॉट डायग्नोज एट ऑल, और उनका इमरजेंसी ट्रीटमेंट बहुतों का नहीं हुआ, एंड सम डाइड इन द वे आल्सो. सो TTS इज अ वेरी वेरी मेजर एंड कॉम्प्लिकेटेड प्रॉब्लम. एंड अनदर थिंग इज दैट इसका जो अभी आपने बताया कि स्टडीज हुई है, phase 3 and phase 4 trials for COVID vaccine has not been done, and the report, I don't know clearly, but the reports are not available. One of the activists has found that 700 labor behind the closed Union Carbide factory in Bhopal, they were given, the trial was done on 700 laborers without their consent at the rate of 750 rupees. And no audio visual, huh?
Precisely my point was, in the morning we heard one trial victim saying that he was of the safety cohort and one of the 1,600 people who had a serious adverse event. And so the point is, like, he was a volunteer from a well-to-do who came on his own volition to help. So if the trial volunteers were picked from this kind of underprivileged people who didn't have a voice, and if they suffered adverse events, they wouldn't even know where to report, and maybe they will be quietly removed from the thing, saying, we see 27 people were actually removed from the thing I mean, they disconsented for the second phase, second dose. That's what we see in the AstraZeneca trial. We see that for second dose, 27 people disconsented. Why they disconsented? Maybe they had a problem and they dropped off actually. So just not regarded as a adverse event.
That's 100% true. And basically doctors जो community health centers, अभी तक तो बहुत सारा इंग्लिश में ही चल रहा था. नहीं ठीक है, हाँ ठीक है, आई विल ट्राई. ठीक है, तो आप बिल्कुल सही बता रहे हैं, बट ये सारा कुछ जो गवर्नमेंट के ऑर्डर्स आते हैं उनमें CHC, PHC और डॉक्टर्स का बहुत ही मतलब एवरेज पर्सन के हिम्मत नहीं है कि इतना अगेंस्ट में गवर्नमेंट के जा सके, क्योंकि जैसा कि आपने दिखाया उसमें कि ICMR के डॉक्टर बलवंत के बिल्कुल स्ट्रिक्ट ऑर्डर्स थे, तो अगर कोई अकेला बोलेगा भी तो उसको हटा दिया जाएगा या कुछ ना कुछ कर दिया जाता है। तो नाउ कमिंग टू द सर्टेन जर्नल्स में जिनमें TTS के बारे में आया हुआ है और मेंस्ट्रुअल इरेगुलरिटीज के लिए, तो अभी लेटेस्ट जर्नल है फ्रंटेड जर्नल, जो है बहुत फेमस जर्नल है, उसका वॉल्यूम 4 है, 2024 में नीदरलैंड की स्टडीज आई है बाय डॉक्टर फ्लोरेंस एंड एटॉल, जिसमें उन्होंने मेंशन किया है कि मेंस्ट्रुअल डिसऑर्डर्स आर कॉमनली रिपोर्टेड आफ्टर कोविड वैक्सीन। तो ये एक आ गई है और उन्होंने ऑलमोस्ट 65% women are going to have menstrual disorders after the COVID vaccine, और as per that author हैवी मेंस्ट्रुअल ब्लीडिंग जो है वो एक कॉमन प्रॉब्लम हो जाती है, और अकॉर्डिंग टू दैट डॉक्टर राइट एडिटर ऑफ दिस आर्टिकल, शी हैज सेड कि ये प्रोडक्ट इंफॉर्मेशन मॉडर्ना और फाइजर ने अपने ब्रोशर में डाली हुई है, पर मैंने ब्रोशर चेक किया था, अभी इंडिया वाले ब्रोशर में ये मेंशन नहीं है, माइट बी कि नीदरलैंड के जो ब्रोशर है उसके अंदर। देन सेकंड स्टडी जो है वो पेट्रिया मोटा की है, जिसका PMC नंबर जो है PMC ID 921266 है, उसमें 39 केसेस इन ब्राजील में स्टडी हुए हैं TTS के, जिसमें 61.5% जो है विमेन है, एंड फर्स्ट केस जो था वो प्रेग्नेंट वुमेन में हुआ था। ओवरऑल मॉर्टेलिटी वाज 51%। थर्ड जो है एनल्स ऑफ इंटरनल मेडिसिन में ये 2022 की 18 जनवरी की स्टडी पब्लिश्ड है बाय आइसेक सी। उन्होंने USA के इस पे बीच में कोविड के वैक्सीन के स्टडीज करी है, जिसमें अराउंड 57 केसेस स्टडी हुए, उसमें 69% जो है वो वेमेन थी, एंड ऐसे ही अराउंड 61 स्टडीज हैं, जिसमें 40 क्रॉस सेक्शनल स्टडीज है, 18 जो है वो कोहोर्ट स्टडीज हैं, 3 सेल्फ कंट्रोल्ड स्टडीज है। तो इसमें पाया गया है कि अराउंड 30% जो है, जो 61 स्टडीज है उनमें 30% जो है विमेन को अपने पीरियड्स की, देयर इज अ चेंज इन द मेंस्ट्रुअल साइकिल लेंथ, देयर इज अ चेंज इन द अमाउंट ऑफ द ब्लीडिंग, देयर इज अ चेंज इन द ब्रेक थ्रू ब्लीडिंग, एंड वो प्री मेंस्ट्रुअल टेंशन जो होता है वो विमेन को होता है। तो कोविड वैक्सीन का जो वुमेन रिप्रोडक्टिव हेल्थ है उसके ऊपर भी बहुत ज्यादा इफेक्ट है, और इनसे क्योंकि हमारा जो पूरा का पूरा जो रिप्रोडक्टिव हेल्थ है वो हार्मोन से रिलेटेड है विमेन का। इट इज अबाउट पिट्यूटरी, हाइपोथैलेमस, ओवेरियन एक्सिस, जो कि एक बार आपकी साइकिल गड़बड़ होती है तो उससे ये आपका जो पूरा एक ब्रेन से लेकर ओवरी तक का जो यूट्रस तक का कनेक्शन है वो आपका डिस्टर्ब हो जाता है, और वंस आपका इंटरनल हार्मोनल मिलियो विमेन का जो है वो अगर डिस्ट्रॉय होता है तो आपके कैंसर के चांसेस, आपके इनफर्टिलिटी के चांसेस, आपके प्री मैच्योर मेनोपॉज के चांसेस, आपको डायबिटीज के चांसेस, आपके ओबेसिटी के चांसेस, आपको कार्डियोवैस्कुलर डिजीजेस के चांसेस जो है वुमेन में बढ़ जाते हैं। सो दिस इज अ वेरी वेरी इंपॉर्टेंट कोरिलेशन कि एक कोविड वैक्सीन के मेंस्ट्रुअल साइकिल्स पर बहुत ज्यादा इफेक्ट है। ऑलमोस्ट 50 to 60 women can have the problems, और once your cycles go haywire तो आपको सारी चीजों के स्पेशली कैंसर से लेकर इनफर्टिलिटी, प्रीमेच्योर मेनोपॉज, अगर प्रीमेच्योर मेनोपॉज होता है तो भी आपके कैंसर्स की, ब्रेस्ट कैंसर्स की और ओवेरियन कैंसर की रिस्क बहुत बढ़ जाती है। सिमिलरली तो दिस इज ऑल रिलेटेड टू योर एंड पार्टली रिलेटेड टू योर प्लेटलेट काउंट्स, क्योंकि प्लेटलेट काउंट्स कम हो जाती हैं तो उससे आपके पूरा का पूरा ये जो हार्मोनल फंक्शन है वो डिस्ट्रॉय हो जाता है। देन अनदर इम्पॉर्टेंट थिंग आई जस्ट वांटेड टू से कि ओमश्री के फादर ने बताया कि ऑर्गन डोनेशन में, तो ऑर्गन डोनेशन में स्टडीज आ चुकी हैं कि क्योंकि ये बॉडी की है कि अगर बॉडी में एक बार कोई एंटीजन चला जाता है और उसके अगेंस्ट में एंटीबॉडीज बनती है तो सारे के सारे सेल्स के पास उसकी मेमोरी रहती है। तो अगर आपने ऐसे जो कोविड वैक्सीन के विक्टिम्स हैं जिनको TTS हुआ है, उनका ऑर्गन किसी और दूसरे मतलब रेसिपिएंट को दिया है, तो डेफिनेटली जो ऑर्गन्स गए हैं उनके जो सेल की मेमोरी है उसमें एंटीबॉडीज रहेंगी और वो कभी भी आने वाले टाइम में आपको प्रॉब्लम क्रिएट कर सकती हैं। सो ये तो अभी साइंस बताएगी, पर अभी ऑलरेडी स्टडीज आ चुकी हैं और उन स्टडीज में ये आ चुका है कि जिनको TTS हुआ है बिकॉज ऑफ द कोविड वैक्सीन, उनके जो रेसिपिएंट्स हैं उनको TTS होने के काफी चांसेस हैं। सो दीज आर द हेल्थ implications moreover related to the TTS in the women, but overall there are lot of complications जिसको डॉक्टर्स रेयर और कोइंसिडेंटल, पर जैसे डॉक्टर अमिताभ ने कहा कि हमारे लिए और आपके लिए 1 into 800 हो सकता है, पर होल पॉपुलेशन पर लेते हैं तो द नंबर इज वेरी हाई, एंड दैट्स व्हाट द डॉक्टर्स नीड टू कीप इन द माइंड, जो कि नहीं करते हैं। वो ये कहते हैं कि बाकी लोगों की जान बची है। तो इस हेल्थ के बाद विमेन हेल्थ में जो इसका इम्पैक्ट है वो मैंने आपको बताया, और इसके बारे में एनीथिंग एल्स यू वांट टू आस्क कैन आस्क। हाँ जी।
लेकिन अभी समाज में एक और बहुत बड़ी समस्या आ रही है कि when you look for a group, would you look for an unvaccinated healthy group? तो ये जो जिन्होंने कॉन्शियसली वैक्सीन नहीं लिया है उनके वो भी इस समस्या से अछूते नहीं है। I just want to make it clear कि while my heart cries for the vaccine victim family, जो सोसाइटी के लिए एक्सेप्टेबल नहीं है कि a non-victim should be spending whole day, and asking questions and asking uncomfortable questions. For example, ये BMJ ब्रिटिश मेडिकल 2021 में और डॉक्टर संजय राय ने मुझे दिखाया था, जो मेरे अच्छे मित्र हैं, कि 2 मिलियन से ज्यादा मेंस्ट्रुअल फर्टिलिटी ब्लड वो सारी की सारी इसकी ये महिलाएं इसको प्राइवेसी के दायरे में रखती हैं। इसको सिनेरियो प्लानिंग करके इन्होंने इस बात को सामने नहीं आने दिया।
हाँ जी
मैडम, आप ऑनेस्ट डॉक्टर हैं और आप जैसे लोग समाज में शायद ही गिने चुने लोग हैं। मैं आपसे ईमानदारी से एक सवाल पूछना चाहता हूँ कि आपने खुद वैक्सीन लिया या क्या आपने अपने एज के लोगों को वैक्सीन या बायो वेपन जो एक्चुअली है उसको लेने से रोका? आपकी क्या जानकारी?
मैं फंक्शनल मेडिसिन एक्सपर्ट भी हूँ, मैंने नहीं लेना था, बट मेरे को कोविड होके हटा था। उसके बाद भी माय फैमिली, माय हस्बैंड एंड माय चिल्ड्रन, दे आजकल आपको पता है ना बच्चों के अगेंस्ट, बच्चे कितने आपके पेरेंट्स के अगेंस्ट में हो जाते हैं, तो दे वेंट रियली अगेंस्ट मी एंड आई हैड टू टेक द वैक्सीन आफ्टर कोविड। आई टोल्ड देम
ऑनेस्ट और इंटेलिजेंट डॉक्टर फैमिली के प्रेशर से मैंने अपनी वाइफ का जॉब छोड़ा है, कुछ इनकी कंपलसरी था। आप तो कोविड वायरस की बात कर रही हैं, कोई भी बायोलॉजी लैब दुनिया भर का इंक्लूडिंग जो रिपोर्ट चल रहा है कि नेशनल इंस्टीट्यूट ऑफ बायोलॉजी पुणे का जो रिपोर्ट है उसमें SARS-CoV-2 is only a computer simulation. There is no evidence on the whole of the world that there is a live virus. Say आपने कुछ सैंपल निकाला है, which is a novel coronavirus as it is claimed to be. So the whole proposition of bringing a vaccine or even a bioweapon against imaginary virus is completely invalid. So please starting point आपने जो ओवरटन वीडियो की बात की, तो अभी जो अनथिंकेबल है उसको हमें भी एक्सेप्टेबल, रेडिकल से एक्सेप्टेबल और अपनी पॉलिसी में लाना होगा। वो अगर गलत तो इविल फोर्सेस है, वो अगर उस
नहीं, देखिए मैं एक बात आपके इसके लिए एक बात मैं आपके इसके आई एम नॉट एग्रीइंग विद यू व्हाट यू आर सेइंग। मेरे घर में मेरा एक मतलब मेरी सिस्टर इन लॉ का जो सन इन लॉ है, ही हैज कंडक्टेड द टेस्टिंग मतलब इसके ऊपर कोरोना वायरसेस। तो कोरोना वायरस आइसोलेट हुए हैं, ठीक है। मेरे पास नहीं है, यू कैन नॉट आस्क द एविडेंस फॉर द मी फ्रॉम मी, आई एम नॉट। प्लीज वन जस्ट अ मिनट, आप देखिए, आप मेरे से एविडेंस नहीं मांग सकते। आई एम नॉट द वन हु हैज डन द ट्रायल, ठीक है। मैं आपको बता सकती हूँ, सीरम इंस्टीट्यूट ऑफ इंडिया के जो लैब में पुणे में टेस्टिंग हुई थी, मैं पर्सन का नाम दे सकती हूँ, आप उनसे कांटेक्ट करें। आप मेरे से वैक्सीन का नाम, आप वैक्सीन से रिलेटेड, नहीं मेरा काम उनका नहीं है। सी दिस, आई एम नॉट गोइंग टू फॉल इनटू दैट ट्रैप कि मैं ऑथर्स को, मैं आपको बता रही हूँ कि वैक्सीन के लिए मैंने जो सारा आपको ओवरटन विंडो बताया वो वैक्सीन को एक्सेप्ट करवाने के लिए बताया, ना कि वो है। आई एम नॉट, आई डोंट नो डॉक्टर संजय राय, प्लीज आप ये बात समझिए, सबकी इतनी नॉलेज नहीं होगी जितना। हाँ, सी आई डोंट
We need to stick to fact. Sorry. We need to
to anyone who's a scientific minded. There is no trace whatsoever. Dr. Amita Banerjee, Dr. Deepak Natarajan, nobody has proved Dr. Jacob Ponnel.
Yeah, Chandraji, the format of this discussion is like they kind of know.
Simply walk out if you don't care. But my question is, where is the proof
If your whole evidence.
Sir, kindly, we'll continue. Would like to continue as per our format. Thank you. Sir.
Thank you. Yeah.
Sir, the point.
Your daughter, my daughter, if I with Modi, you don't know. I'm the only activist who's fighting on AIDS, Dr. Randeep Guleria, because he kidnapped one of our activists, San Gopal. I'm the first complainant. But nobody allowed us to file it in the Supreme Court.
Fine. I mean, yeah. Okay. Yeah, ladies and gentlemen, I have the pleasure of possible, sir, possible. But the point now is like we are kind of exploring in a certain format the thing. Yeah. So, good evening, ladies and gentlemen. I have the pleasure of having Dr. Deepak Natarajan here among us to kind of share his eminent views on this subject. So, over to you, sir. Thank you.
Thank you very much. Is this better or no? That's better, right? Okay. All right. I'll just give you a very quick summary on what these vaccines are and how they work. On your left, you have the coronavirus. And this is, of course, a cartoon. And you can see the virus intact. And the most important gene or the most important protein is the spike. Now, all these vaccines are directed against this spike. Okay, so you have the spike which is produced by the coronavirus, and now we have the AstraZeneca vaccine. The so-called beauty of the AstraZeneca vaccine is that the code to make this spike is kept inside a virus. This is a chimpanzee virus. This is an adenovirus, which causes the common cold. And this virus cannot replicate. So if I inject this virus into you, you don't get the cold, but the virus with the code can enter your cell, and after entering your cell, it can enter the nucleus. Once it has entered the nucleus, then it gets into your DNA. Now, this is a very important thing because it is getting into your DNA, and therefore it has the potential of tinkering with your DNA. It can, for instance, activate a cancer-producing gene, or it can also, if it wants, suppress a cancer-suppressing gene. All right, so therefore it can promote cancers. So the important thing is that the AstraZeneca vaccine not only gets into your cell, but actually gets into your nucleus. That is very important. And it integrates with your DNA. So therefore, it can stay there permanently. You can also impart it to your children and to generations ahead. As opposed to the AstraZeneca vaccine, this is the more commonly used vaccine, that is the messenger RNA vaccine. Here again, you have the virus, you have the spikes. Here they have the code in a messenger RNA. Now I'm trying to make these things very simple for you. This is not, I'm trying to make a very technical subject which is quite complex. I'm trying to make it simple. Here the messenger RNA is put inside a lipid envelope or a lipid particle, and this is injected, and this lipid particle then enters your cell, but it does not enter your nucleus. It does not enter the nucleus. Therefore, apparently, it does not interfere with your DNA. However, it does go to the ribosomes. The ribosomes are the factories in your cells which produce the spike protein. The entire requirement of these vaccines is that they make the spikes. Your body recognizes the spikes as a foreign body and makes the necessary antibodies. So therefore, if you are infected in the future, these antibodies act against the virus. Now, this is very, very important because when this was done, when the messenger RNA vaccines were made, there were many people who said, look, hang on, you are saying that this vaccine of yours does not enter the nucleus. What if it does? What if it does? So the CDC assured them that these vaccines deliver instructions to teach your body to build protection against COVID-19, but the material never interacts with your DNA. The CDC assured the world that their messenger RNA vaccine never entered the nucleus, nor did it interfere with your DNA. So this was a big distinction. However, now we know that this was untrue. This was not the truth. This was a very misleading comment, a statement by the CDC. Now we know that their vaccines are contaminated by DNA. Not only are they contaminated by DNA, that means that their vaccines can enter the nucleus and can integrate with the human DNA. All right? But of course, the messenger RNA vaccines do not concern us. I'm just trying to give you a background as to what and how these things have evolved. Now, the most interesting thing about the messenger RNA vaccines is the fact that that envelope which I talked to you about, the envelope or the parcel in which the messenger RNA is kept, right? The message, which is actually the blueprint or the recipe to make the spike protein, that envelope is actually a lipid molecule. That means it's made of fat. The horrific thing is that this fat has never been used before. Never been used before in humans and had never been used before in animals. So this is from the fact sheet of the company that makes these lipids. Okay, the other big thing which has emerged now is that when they made the messenger RNA vaccines in the millions, maybe in the billions, they had two processes. One was that the messenger RNA vaccine was made in a machine. So that was more expensive. That was more time consuming. But because they needed these vaccines very fast at warp speed, they used a bacteria called E. coli to make these vaccines very rapidly. And in the process, this had to happen. Their vaccines got contaminated with DNA. That became a problem. Now the fact emerges that the vaccines which were used by process one, or the first process, the machine process, was used in the trials. Whereas the vaccines which were used in the public, which were mass produced in the millions, they were not used in the trials. Therefore, the vaccines which were employed in all these Americans and Western Europeans and the Japanese and the Singaporeans, that vaccine had never been tested in humans either. Okay? Please ask me the question after I finish. Now, the other very important thing here is that I want you to hang on to what I'm saying, that they have used a lipid nanoparticle, that envelope or the parcel which carried the messenger RNA, that had never been used before in animals or in humans. Please hang on to this, because now I will connect this, collate this with the Covaxin vaccine. Keep this in mind, all right? So this is again the same stuff. Two companies made this for Pfizer and Moderna, and this stuff had never been used. This is the envelope, the lipid nanoparticle. So now we come to our own inactivated vaccine, which is the traditional vaccine. What they do here is they take the pathogen, take the virus, inactivate it. That means they kill it. You can kill it by irradiation, you can kill it by prophylactone. In this laboratory, in the biotech, they used a beta prophylactone to inactivate the virus, to kill the virus. Now when they introduce this virus, so this also now clears that controversy: do viruses exist or do they not exist? To make this vaccine, there had to be a virus which they kill with that chemical. Now this vaccine or the killed virus is injected into the human body, and therefore you have the production of antibodies which will act against a future infection. Now that is the theory behind the inactivated vaccine and the other gene-based vaccines. Okay? So when, before I say anything more, I normally am not known to be a person who minces his words. I'm pretty blunt and pretty direct in what I say. So we come straight to this big headline news in the London Times. The London Times is considered a very prestigious newspaper. And this, of course, says somewhere in 2021, because remember, the vaccines rollout took place in January 2021 in our country. And I think in the United Kingdom also they took place at the same time, whereas in America, I think they took place in December of 2020. So when these vaccines came, the British are as nationalists as us. They're also very patriotic people. So they brought out this headline that the Oxford vaccine is 100% effective against severe COVID in a US trial. This is somewhere in April of 2021. Some date, I can't read the date. But at the same time, the London Times has this bit of news that academics back bizarre claim that jabs may kill. So therefore, as early as the first half of 2021, we had people, we had academics, we had scientists who were claiming that these vaccines can actually kill. You see, you have this bizarre situation. Now we're talking about the Covishield vaccine. We have been talking about the Covishield vaccine before I spoke. All right. The Covishield vaccine is being lauded by the London Times as being 100% effective. But at the same time, there are already scientists in the United Kingdom who are saying that, no, this thing, there is something wrong. There could be a problem with the vaccine and it can actually kill. All right. So this is a very, very interesting photograph. This is at the Wimbledon. Wimbledon is one of the most prestigious sporting event. This is on the 29th of June, 2021. I want you to focus on this lady here. This is Dame Professor Sarah Gilbert. She was responsible for the manufacture, for the original research for the AstraZeneca vaccine, that is Covishield, at the University of Oxford, at Oxford University. Now, on this particular day, she had been invited to the special enclosure in the Wimbledon. She was publicly uploaded as also the NHS for the manufacture and for the creation of the AstraZeneca vaccine. Her face, well, they say, this reflects 1,000 books or 1,000,000 books or whatever. You can see as people applaud her, she looks, one could say, puzzled, bewildered, confused. I mean, almost she's squirming. Why is that? Why is a person who's being applauded publicly at Wimbledon so disturbed? The reason is she knows at this point that the vaccine is failing. The vaccine has failed. She knows that. Okay, that's why this picture is one hell of a picture. So now we come to this year. We come now from 21 to 2024. And in May of 2024, officially, the company AstraZeneca withdraws its vaccine from the market. This is very important. This is from the horse's mouth. So we don't need to speak any further. We don't need any debates or any acrimonious interactions. When the company itself is withdrawing its product from the market, that means it knows that its vaccine is unsafe. And why does it do this? It does this because they presented this data initially in 2021 in September, wherein they showed an efficacy of 64.3%. This was the first paper, right? This was the first paper of 32,000 people. This was a phase 3 trial, which has been published, but the follow-up was not so long. It was for a few months. So far, it's all right. It's all hunky-dory. But when you come to 2023 of September, now they give you a longer follow-up of their vaccine, right? Here they will tell you that the serious events were pretty high. They were scandalously high, all right? So this was the paper which they presented to the European Union. And in this, they clearly show that in the vaccinated group, that is 21,587 participants, the number of serious adverse events which were of special interest, that means the people are having some problems like myocarditis, Guillain-Barré, Bell's palsy, paralysis, motor neuron disease, was as high as 11% with this vaccine. Serious events needing medical attention were as high as 22%. Now here is rock solid data. All right. Now we have data which is acknowledged and presented and published by the parent company itself. It is making itself crystal clear that we have these problems. So now if they say that we are withdrawing the vaccine because of the goodness of our heart or because of our goodwill, that's nonsense. They have withdrawn the vaccine because they know the adverse events are very high, they were through the roof, and they can be liable. They can be fixed not for merely a monetary compensation. They can be fixed for criminal negligence. They can go to jail. That's why they have withdrawn the vaccine. So therefore, again, I reiterate, I repeat this, that there is, in any debate or in any discussion involving the AstraZeneca vaccine, involving Covishield, all you have to say is that, look, the company itself has withdrawn the drug from the market globally. It's not a local thing that it has withdrawn it from Kenya or Tanzania or Singapore. It has withdrawn its vaccine from the entire world. And this is the reason, because they have provided data that these serious adverse events needing special interest are as high as 11%. 11% is very, very high. All right, that is clear. Now we come to what we were talking, that why was Sarah Gilbert so bewildered on the 29th of June 2021 at the Wimbledon? She was bewildered, she was perplexed, she was feeling embarrassed because she knew that the vaccine was misfiring. And we also had data which I was having access to. And I had begun tweeting and making YouTubes on this in 2021 itself. This data was already there. It was not concealed now. This is not data which has been, hidden somewhere. This is in the mainstream medical journal. This is in the biggest medical journal in the world. I mean, if you take medical journals, whether they are mathematics or computer sciences or geography, astronomy, and anthropology, the biggest journal is the New England Journal of Medicine, which has an impact factor of more than 70. We have data being published here as early as April of 2021. This is a time when folks here were talking about their children getting vaccinated. Already we had data that people were developing blood clots in their brain, in their abdomen, and also that they were dying. The mortality ranged even at that point of time from 20% to 70 to 40 to 50%, which is a very high mortality, once they had these clots in their brain. All right, now this is another paper. Now we have a description of 39 people. Again, in the New England Journal of Medicine, we have this third thing with 294 people. This was published in August of 2021. We're still in 2021. So we have rock solid data, which is directly telling us that this very serious problem of blood clots is being caused by this new vaccine, and that people are dying. And in this paper, it is very interesting that the overall mortality was 22% and that there was no sex preponderance. That means both genders were affected equally. Even men were dying. Even men were having these blood clots in their brain and in their lungs and in other parts of their body. Then we have this Indian data from Oja and Mani. This has been published in the Annals of Vascular Surgery. Here they have a total of 20 studies. The average age is in the late 40s. 2/3 of these blood clots were in the venous system. 1/3 of these blood clots were in the arterial system. So let's go for the arterial system because that's my territory. Of these, the most were causing heart attacks, that is myocardial infarction. And next common were strokes, that is clots in the brain. The other kind of clots, where you get paralysis. Okay, and the venous clots were in the brain in the abdomen, in your legs, and in the lungs. So we have Indian data also. And most importantly, most crucially, 93.7, that is 94% of these cases had been vaccinated with the AstraZeneca vaccine, that is the DNA vector vaccine. This is a timeline, I've already told you this. The vaccines were rolled out in January of 2021. By March, people knew that people were developing blood clots in their brain, that people were dying, and that's why the first country to suspend the use of the AstraZeneca vaccine was Austria. And very soon after that, between March and April, Norway, Denmark, and Iceland also suspended the vaccine. And soon after that, Germany, Italy, France, the entire Western Europe suspended the vaccine. Now keep this in mind, the time is very important. From March to May, most European countries had suspended the use of this vaccine, okay? But we kept on with the vaccines. And to quote, with great vigor, I won't name the gentleman concerned, with great vigor, we carried on with aplomb that we can go on with this vaccine. When the rest of the Western world, the industrialized world, has stopped the usage of this vaccine. Now, this is also very important because after that, you see, the data then becomes very little. Let's face it. After that, most of these countries were employing the mRNA vaccine. So we have mountains of data with the messenger RNA vaccines, but not with the DNA vector vaccines. But as I have shown you, there is already enough data that the vaccine is deadly. Okay, so we'll go ahead. This data was, I think, published this year. This is a huge data. 99 people, 99 million people, 99 million people. And what do we find? That AstraZeneca increases blood clots by 3.23%. That is more than 300%. Anything which is increased more than twice, we can strongly suspect causation. That means the product is causing the disease. All right? AstraZeneca increases Guillain-Barré syndrome by 2.49%. All right? That's 250% more with Guillain-Barré. Guillain-Barré is this paralysis which occurs. And most importantly, AstraZeneca increases pericarditis. Now that is my territory. Pericarditis by 6.9 times, which is 690% more. And this data is not on 10,000 or 15,000 now, which is even massive. Now we have 99 million people across the world who have been vaccinated. This one is, of course, for your interest. This is a technical thing that, this much touted vaccine became ineffective after 3 or 4 months. You have to have another repeat, then you have to have another repeat. And this is from the Swedish data, again published in the Lancet, once again a very big journal. This slide is also very, very important because this is the slide I spoke on this paper in the year 2019. I made a YouTube. Luckily, somehow my videos are still there on YouTube. And I quoted this study. I'll give you the essence of the study. This is the earliest study published in a massive journal like the New England Journal of Medicine. It's a pilot study of 20 people who received the AstraZeneca kind of vaccine, that is the DNA vector vaccine, to prevent Ebola. What they find is that 30% of these people develop a fall in the white cells, and almost 30% of them develop a prolongation in their coagulation time in the presence of what is called anti-phospholipid antibodies. Once you have anti-phospholipid antibodies, that has a very strong association with autoimmune diseases. So all these diseases like Guillain-Barré, like multiple sclerosis, or amyotrophic lateral sclerosis, or diabetes type 1, thyroiditis, all these are connected. So this paper is a classic paper, and this is published when? This was published in yes, no, hang on, I'm still in this stuff. I'm still in that. No, this one is completely different. This is the data published in South Africa. which is showing that the efficacy of the AstraZeneca vaccine is a mere 10%. So you're using a deadly vaccine, you're using a vaccine which has no efficacy, you're using a vaccine which lasts only for 2 or 3 months, right? And you're using a vaccine which can cause these serious problems, which I have discussed. Now, off the topic, we go away from AstraZeneca vaccine, we come on to myocarditis, which is my territory. I am a cardiologist, so therefore my specialty is cardiology. Okay, so this has been published recently, just about 2 months back, and this is again massive data. This is in lakhs of people in Japan who received the mRNA vaccine, not the AstraZeneca vaccine. But what it is showing is that the chances of developing myocarditis are increased by 15 times, which is huge. That means the chances of developing myocarditis and pericarditis is increased by 1,500% in this study, which involves lakhs of participants who have received the vaccine. This is another important study. This is an autopsy study. And if somebody asks you, look, where is the proof? Where is the causation? You're just stabbing in the dark. You're being ephemeral. You're being abstract. We have now autopsy studies. We have autopsy studies. This one is on. This is again very important for you, Mr. Venugopalan, because here we have 28 autopsy studies. People who have died. Of these 28, 26 died because of a cardiac problem. 2 died because of multi-system inflammatory syndrome. All right. So a small percentage of people have died because of a multi-system inflammatory syndrome, which means all the organs are affected. You have fever, these organs are affected, and then you die if you're not treated adequately or if you're not lucky enough. Okay. Now, in this autopsy, what they found out was, now this is again very, very important. Somebody might ask you, how do you prove that this person has died because of the vaccine? You prove it by showing them these brown things. These are the sites. Okay, so now you have proof. Okay, this is, well, I don't know whether it's circumstantial evidence in jurisprudence or this is again a rock solid evidence. All right, you have a dead body, you check the organ, you check the heart, and you find that in the heart you have the spike proteins. That's it. That means these spike proteins have come from the vaccine. All right. And then, of course, you have these blue dots, which are lymphocytes, which means there is inflammation going on. Okay. Now, the train is simple. You get infected. Sorry, you get vaccinated. You get vaccinated, and you develop inflammation in the heart, which we technically call myocarditis. All right. Now, this becomes a marker for what is called a ventricular tachycardia or ventricular fibrillation. Okay? This is a marker. When you have a ventricular tachycardia or ventricular fibrillation, right, you collapse. So when you see these chaps who have, collapsed on the cricket field or in a football game, or collapsed in their house, or collapsed in office, or collapsed in the television studio and have not recovered, this is the reason they had myocarditis. It could be remote. It may not be, just 2-3 weeks back. It could be even 6 months back. God forbid, even 1 year back. If that scar tissue remains, that will be the trigger for a arrhythmia. That can be a trigger for ventricular tachycardia and ventricular fibrillation. Now, this is a study which I like very much, which I have quoted in my own paper. This is by Christian Bormier. He has data on 15 people. 11 were given the messenger RNA vaccine. 4 were given the DNA vector vaccine. DNA vector vaccine is the AstraZeneca vaccine. 4 were given these things. All had a biopsy done. All had myocarditis. That means they had chest pain, they had shortness of breath, they had palpitations. In their blood, troponins were raised. When they did the echo, there was some wall motion abnormality. And when they did the biopsy, once again, they saw these brown spots. These were the spike proteins. Okay? So in the biopsy specimen, once again, we have, this is called the, final diagnosis. When I was a little boy, there was a book called The Final Diagnosis. It was fiction. Now, I don't know, nobody's heard about it now, but this is it. And this one has received the messenger RNA vaccine, this one has received the messenger RNA vaccine, and this one has received the Vaxzevria. Somehow they changed the name from Covishield to Vaxzevria. I don't know who made them do it, but we have now evidence that Vaxzevria also produces myocarditis. All right. Now this was a paper which I published. It was a case report published in some Case Reports International. This drew very little traction. It was largely ignored. It was largely ignored by the Western people because the reason is very simple. Look, whether you like it or not, we are Indians, we are the browns, they are the whites, and now they're becoming even more white with the new president-elect. That's a different story. But the fact is, this is a middle-aged woman who came to me with chest pain, all right? An educated middle-aged woman who came to me with chest pain and some palpitations and some shortness of breath. There was nothing wrong with her. The ECG was normal. The echo was normal. I did an exercise test, which you people may have heard as a treadmill test. Normally, I'm not there when the treadmill test is done. The technicians do it or the junior doctors do it. For her, I stood there. I don't know why I was there. It was just my luck and her luck that I was there. And what I saw was these two ectopic beats. So there were two ventricular ectopic beats here. So this was a signal that something is amiss. Something is not very right with this lady. So then I took up an angiogram. The arteries were clean. There was nothing wrong with the arteries. So we have a middle-aged lady who's come in with chest pain. On the surface, the basal ECG is normal. When we make her do a treadmill, we find there is a small hint of an arrhythmia. We do the echo and we do the angiogram and we find that the arteries are normal. So I was a bit perplexed. So because we had done the angiogram in the morning, we had to keep her overnight. I mean, normally I discharge them after 4 or 5 hours, but this lady, we kept her overnight. And I hooked her onto a Holter. Holter is that gadget which records your rhythm for 24 hours. It could be even 72 hours, but it is recording your rhythm. And in the night, around 2 o'clock in the night, she again complained of chest pain. So the junior doctor rang me up. Look, she's having chest pain. I said, look, don't worry. The arteries are normal. Everything is fine. Give her a painkiller, give her a, whatever, and she'll settle down. Don't worry. If she doesn't settle down, call me up again and I'll see. Okay? But when the next morning I examined the Holter, when I examined the Holter, lo and behold, look, I can't speak in Hindi, I'm sorry. Lo and behold, when I saw this thing, the Holter, I found that she had a ventricular arrhythmia. She had a slow ventricular tachycardia. That slashed, that was the diagnosis. That sealed it. I knew there was something wrong. We did a cardiac MRI on her, and we found that patch. We found that myocarditis patch. She had no history, actually, earlier of any fever or whatever. But this was a case, a woman, chest pain, arrhythmia, Holter showing ventricular tachycardia, and the MRI is showing a patch. So that's it. Now, but there were other reports also, like this report, concomitant myocarditis and painless thyroiditis after AstraZeneca coronavirus disease 2000 vaccination, a case report. So once again, you have MRI pictures showing these white spots, which are suggestive of myocarditis. And then you have this again, another autopsy report from the Germans. This is by Morse. This is again, and this again is showing again the same thing. It is showing the spikes, and it is showing lymphocytes, showing the cells which cause inflammation. All right. Now, this was the study which I was talking to you about. I mean, the one that was published way back. This was published way back in 2017. So the study wherein, for the first time, the AstraZeneca kind of vaccine was used in humans in a pilot study in Africa. Again, this was funded by the NIH and NIAID, our friend Tony Fauci. Tony, whatever. So Fauci funded this study. His organization funded the study, and they found that 30% had aberrations in their white cells, and also in they had the presence of antibodies in these people. Right. Now the question is, no, nobody died. This is a pilot trial. You won't be aware of this because nobody knows about this. So now the question is, people were having blood clots, people were dying, right? The whole world knew about this. Nations had suspended these vaccines, right? Why is it that we carried on? Why is it that we carried on with these vaccines? What was wrong with us? Why weren't we aware? Why were our intelligentsia or the medical fraternity? I don't know. I cannot explain that. I can explain. Maybe I can explain, but I won't go into the details right now. But the fact is that you were not supposed to be told about these things, though they were being published, though there were news reports about these things. One big reason was, tragically, sadly, was the fact that you had this caucus formed, the Trusted News Initiative. The Trusted News Initiative was orchestrated by the BBC with the Washington Post, the Financial Times, Wall Street Journal, and we had 3 gladiators from India. The Hindu, yes, how can Hindu ever be wrong? So the Hindu was neck deep in this, deeply entrenched in this caucus, right? NDTV was deeply entrenched in this caucus. Okay, NDTV, the Hindu, the Indian Express, and of course our friends in Pakistan, Dawn. So what I'm trying to tell you is that the purpose of this caucus, the Trusted News Initiative, was to make sure that under no circumstance do you speak about the origin of the virus, you speak about the fact that the vaccine will not prevent infection, you will not speak about the fact that the vaccine will not prevent transmission, right? So these were the most respected newspapers in the country. Now, I mean, this is not an anecdote, this is history. This is happening before our eyes. I used to write for The Wire, on and off. I used to write about various subjects. I wrote an article in 2019 on air pollution in Delhi, right? It's there, it's still there. I wrote about noise pollution. I wrote about sports, about athletics. And I also wrote about COVID, about lockdown. I was a very fierce, opponent of lockdowns. All right? This guy, Karan Thabar, interviewed me in March 2020. In March 2020, that's 5 years ago, I had said that lockdowns are useless. It's a gimmick. Nothing's going to happen. Okay? But for these 5 years, this is a fact. You can check it. You know, these guys, I mean, this particular journal for which I was writing, which of course has no electricity now, that is The Wire. The Wire kept bringing in these honchos demanding vaccination. They kept, doubling down on vaccination. They kept getting these experts from America, from here, from there, always advocating for vaccines. For 5 years, these journalists, right, who claim to be the gladiators for the oppressed, for the downtrodden, who are the checkboard for the government, did not give a single or the tiniest platform for a contrarian view against the vaccines. Okay, so this probably was a huge design. There was something behind this at a global level, at a local level. Okay, and this is the situation. This was the situation. Of course, this is not very important here, because definitely after 2021, once the vaccines were rolled out, all these countries suddenly are seeing excess deaths. Okay, that's more or less the truth. And in India again, normally we had an incidence of say about 5 to 6 per thousand deaths. Suddenly it has jumped to 9 per thousand. All right, that's the Statista data. The CIA data again, 9.56 per thousand, which means there is almost a 30% increase in excess deaths. These all cause crude deaths, of course. But the fact is that there have been excess deaths after 2021, which means the same, right? It's a euphemism which I'm using now. Now, of course, this is a very recent study which has been published, I think, again, a few weeks back. And this is there's a place in Washington State. It's called King County, and it has only 2 million people. 2 million people would be a smaller population than Noida. And 98% of these people have been vaccinated. But what you find here is that you have excess deaths, which have jumped from 11 per year to 147, what again is a huge increase in deaths. But then again, they were being used, they were being given the messenger RNA vaccine. So, it doesn't affect us. But this is a very important study. This was published for one day in the Lancet and then redacted. It was removed because of pressure. It has been published 2 days back on the 17th of June, on the 17th of November. This is, I don't have to see it because I know it by heart. This is autopsies of 240 people who have died, definitely because of vaccination. This is a study of 240 people, autopsies, directly because of vaccination. 35% have had sudden deaths. 1/3 died suddenly. I mean, probably the mechanism is the arrhythmias. 12.5% died because of pulmonary embolism, that is, a blood clot in the lungs. 12% died because of myocardial infarction, that is the traditional death. And 7% died because of vaccine clots. 7% died because of myocarditis. And crucially, 5% died of multi-inflammatory syndrome. That is very important. And 3.8% have died because of brain hemorrhage. Now, what is the most important? What is the bottom line? What is the take-home message? We have 240 autopsies. This data has been published finally 2 days ago. What it is telling us is that of these people, 41% received the mRNA vaccine. 37% received the killed vaccine. And 13 plus 1, 14% received the DNA vector vaccine. So we have autopsy confirmation proof. Once again, solid evidence, the final diagnosis that not only were the messenger RNA vaccines killing people, but also the inactivated vaccine, such as Covaxin. Here, of course, they have taken the Chinese vaccines, but but the stuff is the same. And 14% of these deaths were because of the DNA vector vaccine. Why were they less? Why were they less? Because, as I've told you, they were not being used. They stopped using them in March, April of 2021. That means 4.5 years back, nobody was using the AstraZeneca vaccines. So that's the reason. So this study is very, very important in the context of what I'm saying. This is not important. This is about, blood clots with the messenger RNA vaccines. So it doesn't concern us. Now we come, I'll just take another 5-6 minutes. I'm happy that you're bearing this talk. You're listening to me so patiently. So I wrote this Substack 1.5 years back. This was on the Covaxin. That is the inactivated vaccine, which probably was used in 15 to 20% of the Indian population. And I've already explained to you the mechanism of the inactivated vaccine, that the vaccine is killed, it's put inside your body, then the body makes antibodies against it and prevent a future infection. So now this one has to read these papers very carefully, because in medicine, 99% of doctors just read the abstract or read nothing. You have to, read the finer print. You have to read between the lines. So the phase 1 trial, which was published in January of 2021 in the Lancet, okay, says that it gave this vaccine to 300 people, and to 75 it gave a placebo. All right. Of these 300 people who got the vaccine, 1 person was hospitalized. So that is a serious thing. Right? If a person is hospitalized for 1 week, they give the duration. For 7 days, this gentleman or female or male, I don't know, they don't tell us. It's not in the results. It's not, but it is in the abstract that this person was hospitalized for pneumonia. But in the results, they tell us that the patient did not require oxygen and the patient was stable. But you already have a signal that out of 300 people, 1 person is falling sick. And the follow-up is just for whatever, 4 weeks or 6 weeks or whatever, right? 1 person out of 300 gives you an incidence of 0.3%. That's how much? That's 3,000 per million. So you have 3,000 per million, serious adverse effects, which is pretty high by any standards. Okay. Then the other thing is that was published in January. But in April of 2021, they tell us about their animal study, which was done on some rats and rabbits, a few rats and a few rabbits. Okay, here the authors make it a point in their conclusion that their kill vaccine, the long-term protective efficacy of these vaccine candidates is unknown. The long-term effects is unknown, and we don't know whether it can tackle other COVID strains, right? That is also very important. And the most important thing is we do not know the mechanism of our vaccine, the adjuvant put in our vaccine, okay? And this has been published 3 months after the phase 1 trial. So the human trial has been published in January. You can see the haste, you can see the hurry in these people to publish their data, and you can see the haste and the hurry of a journal which is, I think, 200 years old, The Lancet, publishing that data. So somebody was putting in enormous pressure on The Lancet to publish such a study. You know, normally they would have rejected the study. Okay. Then, of course, because when I published my paper, I had to do the research. I mean, how many other reports are there of myocarditis caused by this killed vaccine? So then I found this incurious. This again is of a man from South Asia. They mentioned South Asia. South Asia could be from India, has to be from India. And he went to America and had myocarditis, classic symptoms. He was hospitalized, he became very sick. And they took a biopsy and they did find that he had myocarditis. This is confirmed that the killed vaccines were causing the vaccine. Now, the point which I raised in my Substack, and which is very important, that is why I said that, you know, keep this in your mind when I spoke about the mRNA vaccine. The most important thing about the mRNA vaccine is that the messenger, the RNA, was kept in a lipid LNP, that lipid nanoparticle. All right, it was kept in a lipid nanoparticle. The particle was made of fat, okay, which had never been used before and which was not advised to be used either in humans or in animals. I have shown you the fact sheet from the parent company earlier. So again, right? So that thing was never used in human beings. Now we come to our Covaxin. Covaxin used an adjuvant which had never been used before. So Covaxin, which was injected in lakhs of people, had an adjuvant. What is an adjuvant? You see, in a killed vaccine, the response is not so good. It is not so robust. So therefore, you add something which can create a better antibody production. So they used a new thing called alhydroxyquim, which was a mixture of aluminum plus this new molecule. And this had to act on the toll-like receptor agonist. The promise was that it would, you know, kickstart a better immune response. But you must keep in mind that this had never, ever been used before. All right, so these people used this. And of course, that study, initial study, was funded once again by our friend Fauci, by the NIH. So we used a vaccine which used an adjuvant which had never been used before in lakhs of people, and which we know can kill people, can cause myocarditis, and various other problems. All right, and of course, the Times of India, that was the NIH, you know, proudly announcing the development of that adjuvant, and this was sometime in June or July of 2021, and this is the Times of India echoing that, you know, very loudly, that, you know, the Fauci-led NIAID-funded Covaxin efficacy booster adjuvant, the US NIH. Of course, at that time, of course, Fauci was a rock star, and till recently he's been a rock star in the field of medicine. Now, of course, this is the inactivated vaccine, the phase 3 trial. Now we come to another very big gimmick in the field of vaccinology. So we have the phase 3 trial, which has been published with the inactivated vaccine. What they say is that, you know, the side effects were the same whether it was used in the treated group or in the control group. But what they don't tell you is that the control group also did not have a placebo. It also had the aluminum adjuvant in it. So if you give both groups the same toxic substance, how do you distinguish between the adverse effects? You cannot tell whether one is causing more or less adverse effects. It'll boil down to the same. I think that's it. Can you bear with me for another 2 minutes or 1 minute, or time is up? Your Lordship. Sorry? Okay, just 1 minute, because this finally I'm gonna give you some reassurance, all right? You know, I don't want you to. This is not a doom and gloom lecture, okay? This is a brilliant graph. This, you have to focus on this graph. This graph is fantastic. This is from Denmark, scientists from Denmark who checked these batches of the vaccines, the mRNA vaccines, right? They checked these mRNA vaccines which were being distributed in Europe, and of course in Denmark itself. And what they found out was that there were 3 kinds of batches. You have the blue batches, the green batches, and the yellow batches. They find that the blue batches cause a lot of adverse effects, massive adverse effects. The green batches cause a moderate amount of adverse effects, but the yellow batches cause no effect, no adverse effects, which means that the yellow batches were placebos. And these were tested at the Paul Ehrlich Institute, right, which is the most prestigious regulating agency in Germany. And for Europe, the PEI, that is the Paul Ehrlich Institute, was testing for the integrity of these vaccines for all of Europe. So the reassuring take-home message is that if in Europe 30% of the vaccines were dummy, if they were placebos, there is a very strong chance that even in our own country, there is a possibility, I cannot validate it, I cannot confirm this, that maybe 30%, maybe 25%, maybe 40% of the vaccines which were rolled out in our country, both the AstraZeneca and Covaxin, were dummies. They were just saline. I think I'll stop there, right? Okay, I'll stop there. Thank you very much.
Thank you very much, sir, for that very informative and knowledge-filled presentation. In fact, most of the slides you showed had excellent data and proof for our cases also. And I forgot to, I didn't do justice to introducing Dr. Deepak Natarajan properly. Dr. Deepak Natarajan is a renowned cardiologist, and he also has been the surgeon for Nelson Mandela, actually. Which many of you, he may not need an introduction, but it's my duty to do that. So thank you, sir, for coming here and enlightening us. Thank you. So now I request Prashant sir to come and give his keynote address. And Prashant sir needs no introduction, and we are honored to have him here to speak on a very important subject. Thank you. Yes, sir.
So good evening, friends. We meet here on a very important issue. I can speak in Hindi, so if people want me to speak in Hindi, I can. अच्छा, तो आज हम लोग एक बहुत ही इम्पोर्टेंट मुद्दे पर मिल रहे हैं कि ये कोविड वैक्सीन्स से क्या हुआ। डॉक्टर नटराजन ने आपको अभी बहुत डिटेल में बताया कि कितनी सारी साइंटिफिक स्टडीज पब्लिश हुई हैं कि इन वैक्सीन्स के काफ़ी बहुत सीरियस एडवर्स इफेक्ट्स हुए और इनकी एफिकेसी यानी कि उसका फ़ायदा बहुत कम था, हार्डली कुछ था, और नुकसान बहुत ज़्यादा थे। हम लोग सुप्रीम कोर्ट गए थे कुछ साल पहले 3 मुद्दों को लेकर। 3 हमारी प्रेयर्स थी। पहली प्रेयर तो ये थी कि ये जो जितनी भी वैक्सीन्स अलाउ करी गई हैं, हिंदुस्तान में तो 2 ही थी, एक ये एस्ट्राजेनेका वाली थी और एक ये कोवैक्सीन थी। तो इनका जितना भी ट्रायल डेटा है ये सार्वजनिक किया जाए, ये रिलीज किया जाए। दूसरी प्रेयर ये थी कि जो वैक्सीन मैंडेट्स इशू करे जा रहे हैं कि अगर आप वैक्सीन नहीं लेंगे तो आपको ट्रैवल नहीं करने दिया जाएगा, आपको राशन नहीं दिया जाएगा वगैरह, इसको इनवैलिड डिक्लेयर करें। और तीसरा ये कि एडवर्स इफेक्ट्स जो होते हैं वैक्सीन्स के, उसके रिपोर्टिंग का सिस्टम ठीक किया जाए, क्योंकि तब तक रूल ये था कि जो जना वैक्सीन आपको दे रहा है वही रिपोर्ट कर सकता है एडवर्स इफेक्ट, यानी कि जिस पेशेंट को एडवर्स इफेक्ट हुआ है वो नहीं रिपोर्ट कर सकता, उसका डॉक्टर जो है वो भी नहीं रिपोर्ट कर सकता, सिर्फ जिसने वैक्सीन लगाई है वही रिपोर्ट कर सकता है, ये सिस्टम था। तो सुप्रीम कोर्ट ने हम लोगों को आधा ही रिलीफ दिया, आधा नहीं दिया। जो हमारी पहली प्रेयर थी कि भाई सारा ट्रायल डेटा रिलीज किया जाए, वो उन्होंने नहीं माना और ट्रायल डेटा नहीं रिलीज किया। अब तो जैसे डॉक्टर नटराजन ने बताया, धीरे धीरे करके बहुत सारी चीजें बाहर आ गई हैं लेकिन अभी तक सारा ट्रायल डेटा सार्वजनिक नहीं किया गया। दूसरी बात, जो हमारा दूसरा प्रेयर था कि भाई वैक्सीन मैंडेट्स जो हैं ये इलीगल हैं, ये सुप्रीम कोर्ट ने मान लिया और बोल दिया। उसका आधार दूसरा दिया, आधार ये दिया कि भाई ये वैक्सीन की एफिकेसी उतनी नहीं है और वैक्सीन लगाने के बाद भी इन्फेक्शन हो सकता है, और इसलिए जो जना ले रहा है वैक्सीन वो खुद तय कर सकता है कि उसको कितना जोखिम उठाना है, इसमें कितना जोखिम है और वो उठाने के लिए तैयार है कि नहीं है, इसलिए ये उसका निजी फैसला है। इसलिए इस तरह के मैंडेट आप नहीं कर सकते, क्योंकि वो पब्लिक हेल्थ के लिए कोई एडिशनल हैजर्ड नहीं है। अगर आप वैक्सीनेटेड हैं या नहीं हैं, उससे दूसरे को ट्रांसमिशन में कोई फर्क नहीं पड़ता, बिकॉज जो आदमी वैक्सीनेटेड है वो उतना ही ट्रांसमिट करता है जितना अनवैक्सीनेटेड जना। आपको लेने से उसका क्या फायदा होगा या नहीं होगा, ये आप खुद तय कर सकते हैं। अगर आप इसके खिलाफ हैं, आप नहीं लेना चाहते तो मत लीजिए, और उसके लिए आपको दंडित नहीं किया जा सकता, इतना तो सुप्रीम कोर्ट ने बोल दिया। तीसरी जो हमारी प्रेयर थी उसमें ये बोला कि हाँ, ये जो वैक्सीन रिपोर्टिंग सिस्टम है ये गलत है, ठीक नहीं है, इसको ठीक किया जाए जिससे कि लोग रिपोर्ट कर सकें। अब देखिए, जैसे डॉक्टर नटराजन ने आपको बताया कि अब तो इतना डेटा आ गया, और अगर हिंदुस्तान या कोई भी देश सीरियस हो ये पता करने के लिए कि वैक्सीन से कितना फायदा हुआ, कितना नुकसान हुआ, उसका बहुत आसान तरीका है। आपके पास वैक्सीनेटेड का पूरा डेटाबेस है कि किन लोगों ने वैक्सीन लिया है, अनवैक्सीनेटेड का भी डेटाबेस है किन लोगों ने नहीं लिया है। ज्यादातर लोगों ने ले लिया, मान लीजिए 80% लोगों ने ले लिया, 20% लोगों ने नहीं लिया। अब आप आसानी से कंपेयर कर सकते हैं कि उसी एज ग्रुप के, उसी एरिया के कितने लोगों ने लिया, कितने लोगों ने नहीं लिया, और उनका आप देख लीजिए कि उसके बाद कितने लोगों को क्या क्या हुआ, किसको हार्ट अटैक हो गया, किसी को थ्रोम्बोसिस हो गई, ब्लड क्लॉट हो गया, जो जो हो गया, और जिन्होंने नहीं लिया उनको क्या हुआ। तो इवन ये जो एक्सेस डेथ्स का डेटा है, बहुत आसानी से पता लगाया जा सकता है कि एक्सेस डेथ्स वैक्सीन की वजह से हो रहे हैं या किसी और वजह से हैं, क्योंकि आप वैक्सीनेटेड वर्सेस अनवैक्सीनेटेड में देख सकते हैं कि कितने परसेंट लोग वैक्सीनेटेड मर रहे हैं, कितने परसेंट लोग अनवैक्सीनेटेड मर रहे हैं। लेकिन दुर्भाग्य की बात यह है कि हिंदुस्तान की सरकार ने या यहाँ की अथॉरिटीज ने कोई कोशिश नहीं करी ये पता लगाने की कि भाई वैक्सीन से कुछ फायदा हुआ है कि नुकसान हुआ है। सारा स्टैटिस्टिकल डेटा आसानी से एग्जामिन किया जा सकता था, एक्सेस डेथ्स का भी, और आपको क्या क्या प्रॉब्लम्स हुई, कितने परसेंट लोगों को वैक्सीनेटेड कोहॉर्ट में प्रॉब्लम हुई, कितने परसेंट लोगों को अनवैक्सीनेटेड कोहॉर्ट में प्रॉब्लम हुई, उससे आप आसानी से पता लगा सकते थे। लेकिन ये डेटा एग्जामिन नहीं किया गया, सार्वजनिक भी नहीं किया गया। कुछ इंडिविजुअल स्टडीज बाहर आई हैं दूसरे देशों में, कई देशों में तो ये लाजमी होता है कि ये सारा डेटा रखा जाए और सार्वजनिक किया जाए। वहां पर लोगों ने उसकी एनालिसिस करके पता लगा लिया कि वैक्सीनेटेड वर्सेस अनवैक्सीनेटेड में अनवैक्सीनेटेड को में कम एक्सेस डेथ्स हो रही हैं, वैक्सीनेटेड में ज्यादा एक्सेस डेथ्स हो रही हैं। वैक्सीनेटेड वाले लोगों को ज्यादा कार्डियक प्रॉब्लम्स हो रही हैं, अनवैक्सीनेटेड लोगों को कम हो रही हैं। तो इसलिए बिल्कुल क्लियर हो गया कि एडवर्स इफेक्ट्स भी इसकी वजह से हो रहे हैं, लाइफ एक्सपेक्टेंसी भी इसकी वजह से कम हो रही है, लेकिन हिंदुस्तान में अभी तक लोगों को नहीं बताया जा रहा। कई लोग ये मानते हैं, मैं भी मानता हूं कि ये कोविड जो है एक वाटरशेड इवेंट है हमारे पूरे दुनिया में। एक ऐसा इवेंट है कि अगर उसके पहले क्या हुआ, उसके बाद क्या हुआ, बहुत फर्क हो गया। लेकिन वाटरशेड इवेंट इसलिए नहीं है कि कोविड की वजह से इतने सारे लोग मर गए। वाटरशेड इवेंट इसलिए है कि कोविड, ये तो है एक तरह से कि कोविड में बहुत सारे लोग मर गए। मेरा तो खैर ये मानना है कि अगर सरकार कोविड के बारे में इतना पैनिक नहीं क्रिएट करती, सरकारें पूरी दुनिया की, और ये बताती जो कि सही बात थी कि कोविड बस एक सीरियस फ्लू की तरह है, और आपको अगर आपको कोविड होता है तो फिर आप ये आइवरमेक्टिन ले लीजिए, हाइड्रोक्सीक्लोरोक्विन ले लीजिए, विटामिन सी ले लीजिए, विटामिन डी ले लीजिए, वगैरह वगैरह, तब फिर और इतना पैनिक नहीं क्रिएट किया होता तो जितने लोग मरे हैं उससे आधे से भी कम मरते। आधे लोग तो इसलिए मर गए क्योंकि आपने इतना उनमें फियर क्रिएट कर दिया उनके माइंड में कि उनकी वैसे ही हर 15-15 मिनट में अपना ऑक्सीजन मेजर करने लगे, और जैसे ही एक रीडिंग थोड़ी कम आ जाती थी तुरंत हॉस्पिटल भागते थे, और हॉस्पिटल जो लोग गए उनका तो और भी बुरा हाल हुआ। तो वाटरशेड इवेंट इसलिए है कि इतना ज्यादा पैनिक क्रिएट किया सरकार ने, लॉकडाउन कर दिया, मास्क लगा दिए, स्कूल्स बंद कर दिए, किसी की कोई जरूरत नहीं थी ये सब करने की। लेकिन दूसरी बात, ये वैक्सीन्स ले आए, और ऐसे अनटेस्टेड खतरनाक वैक्सीन्स ले आए जिन्होंने इतने सारे लोगों को मौत के घाट उतार दिया, इतने सारे लोगों के लिए तरह तरह की डिजीजेस वगैरह क्रिएट कर दी, और इसका इफेक्ट जो है सालों साल तक चलेगा, सालों साल तक चलेगा। और तीसरा वाटरशेड इवेंट इसलिए है कि इतना प्रोपेगेंडा किया गया इन सब चीजों के बारे में, जैसे इन्होंने बोला है ट्रस्टेड न्यूज इनिशिएटिव, सारे मेन स्ट्रीम मीडिया। मैंने एक आर्टिकल लिखा, व्हाई आई एम अ वैक्सीन स्केप्टिक, और अभी तक कभी ऐसा नहीं हुआ है कि हिंदू को मैंने कोई आर्टिकल भेजा हो और उन्होंने मना कर दिया हो कि हम नहीं पब्लिश कर सकते। हिंदू ने मना कर दिया, कहते हैं कि हम वैक्सीन की स्केप्टिसिज्म नहीं प्रमोट कर सकते। अभी आपको डॉक्टर नटराजन ने बताया कि वो उन सबको पैसा मिला, हिंदू को भी पैसा मिला, इंडियन एक्सप्रेस को भी पैसा मिला, एनडीटीवी को भी पैसा मिला, ये सारे बड़े बड़े जो न्यूज नेटवर्क्स थे, हमारे दोस्तों को भी, वायर वगैरह को भी इसके लिए पैसा मिल गया, जिनको हम बहुत अच्छे न्यूज मीडिया मानते हैं, उन लोगों को भी पैसा मिल गया कि भाई आप लोगों को हम पैसा दे रहे हैं, आप ये सारी वैक्सीन कंपनीज पैसा दे रही हैं कि आप लोग वैक्सीन को प्रमोट करिए, आप लोग ये प्रमोट करिए कि वैक्सीन सेफ हैं, वगैरह वगैरह। तो किसी ने, सबने, वायर ने भी छापने से मना कर दिया। मतलब तो सोच भी नहीं सकते कि वायर हमारा कोई आर्टिकल छापने से मना कर देगा, और उसमें तो हमने सारे, मतलब सारा डॉक्यूमेंटेड, जैसे डॉक्टर एंथनी फाउची, सॉरी, जो रॉबर्ट केनेडी की जो किताब है द रियल एंथनी फाउची, उसमें 3000 वो हैं रेफरेंसेस हैं, 3000 रेफरेंसेस हैं, और सारे रेफरेंसेस हैं टू ईदर पीयर रिव्यूड मेडिकल जर्नल्स और टू गवर्नमेंट डेटा। यानी कि हर चीज उन्होंने जो भी बोला है सब्सटैंशिएट किया है कि देखिए गवर्नमेंट डेटा से ये बात निकल रही है, या पीयर रिव्यूड मेडिकल जर्नल से ये बात निकल रही है। उसी तरह से मैंने अपने आर्टिकल में सारे रेफरेंसेस दिए थे, लेकिन इन लोगों ने अपने छापने से मना कर दिया। तो इस वजह से इतनी मिस इन्फॉर्मेशन फैलाई गई और करेक्ट इन्फॉर्मेशन रोकी गई, सेंसर करी गई। जब मैंने एक मास्क के ऊपर एक आर्टिकल ट्वीट किया, मेरे ट्विटर पर 2 मिलियन 20 लाख फॉलोअर्स थे, मैंने एक आर्टिकल ट्वीट किया, मेटा स्टडी थी मास्क के ऊपर, जिसमें 60 स्टडीज की एनालिसिस करके उन्होंने बताया था कि मास्क से फायदा कम होता है, नुकसान ज्यादा होता है। मैंने वो अपने कोई एक बहुत ऑब्सक्योर न्यूज़पेपर था पंजाब टुडे, उन्होंने बोल दिया कि अच्छा हम छाप देंगे। हमने ट्विटर पर वो आर्टिकल जो है ट्वीट कर दिया और ट्विटर ने मेरा अकाउंट सस्पेंड कर दिया। वो वाला जो आर्टिकल था व्हाई आई एम अ वैक्सीन स्केप्टिक, वो फाइनली कोई एक पंजाब टुडे टाइप का ऑब्सक्योर न्यूज़पेपर था, उसने छापा, बाकी सब मेन स्ट्रीम वालों ने मना कर दिया। तो ऐसा माहौल बना दिया गया, ऐसी सिचुएशन क्रिएट कर दी गई कि सारे लोगों को एक तरह का प्रोपेगेंडा ही फीड किया जा रहा था। उसका रिजल्ट ये हुआ कि मेरे अच्छे अच्छे दोस्त, जब मैं कोई ट्वीट करता था इन सब चीजों के बारे में, तो वो मेरे ऊपर बरस पड़ते थे कि भाई, अरे भाई तुम लोगों को मरवा दोगे, तुम ये करवा दोगे, तुम वो करवा दोगे, जबकि उन लोगों ने तो सारा प्रोपेगेंडा पढ़ा था। और हम लोग डॉक्टर नटराजन जैसे लोगों की, या डॉक्टर जेकब पुलियल, या जैसे और रॉबर्ट केनेडी और डॉक्टर पीटर मकोलॉग, इन लोगों के लेख पढ़ रहे थे। डॉक्टर जॉन कैम्पबेल जो इस पर बहुत बढ़िया पॉडकास्ट करते रहे इतने साल से, हर रोज करते हैं कोविड के ऊपर, उन सब का सुन रहे थे। वो सारा मतलब पूरा एकदम मेथोडिकली साइंटिफिक पेपर्स को डायसेक्ट करके बता रहे थे। तो इसलिए मैं कहता हूं कि इतना बड़ा ये इवेंट था जिसकी वजह से अब लोगों का मेडिकल साइंस पर से फेथ उठ गया। लोगों को ये लगने लगा है कि भाई अब पता नहीं सारी चीजें जो बताई जा रही हैं, मेडिकल स्कूल में जो पढ़ाई जा रही हैं, जो और चीजें जो पब्लिश हो रही हैं, इन साइंटिफिक जर्नल से भी फेथ उठ गया कि पता नहीं ये लोग क्या क्या प्रोपेगेंडा पब्लिश कर रहे हैं, असली चीज पब्लिश करने से रोक दिया जाता है इन लोगों को। और एक बात ट्रंप के आने से जो एक बात अच्छी हुई है, वो रॉबर्ट केनेडी का अपॉइंटमेंट एज हेल्थ सेक्रेटरी। और अगर ये उनको करने दिया गया जो वो करना चाहते हैं, देखिए ट्रंप ने बहुत सारे खतरनाक लोगों को भी अपने अपॉइंटमेंट्स कर दिए हैं, जो कि इराक वॉर में बहुत वॉर मॉन्गरिंग वगैरह की बात बोल रहे हैं, लेकिन कम से कम ये हेल्थ सेक्रेटरी का अपॉइंटमेंट बहुत अच्छा किया है। और अब मुझे लगता है अगर ये एक साल भी चल गए तो बहुत कुछ इसमें निकलेगा जो आज तक भी नहीं निकला है। और एंथनी फाउची को तो बिल्कुल टांग दिया जाएगा। उन्होंने जितना नुकसान किया है, एंथनी फाउची ने जितने लोगों को मरवाया है, बिकॉज एंथनी फाउची बिल्कुल इसके फाउंटेन हेड थे। उन्होंने ही ये वायरस बनवाया, उसकी फंडिंग करी, उन्होंने ही ये वैक्सीन्स बनवाए, उसकी भी फंडिंग करी और उसके पैसे भी उनको मिले, और उन्होंने ही सारी दुनिया के जितने रेगुलेटर्स थे उनको एक तरह से कंट्रोल किया। बिल गेट्स भी ऑफ कोर्स उसमें थे, वो जो WHO वगैरह को कंट्रोल करते हैं। हाँ हाँ, टेड्रोस तो WHO के थे। तो इन्होंने पूरा एक ऐसा जाल बना लिया, अब वो सारा जाल खुलेगा। तो मुझे बहुत खुशी है कि अच्छा, मैं लास्ट चीज ये जो सुप्रीम कोर्ट ने जो बोला कि भाई इसको ठीक करो, ये सारा एडवर्स इफेक्ट्स जो वैक्सीन्स के हैं उसको रिपोर्ट करने का सिस्टम ठीक करो, वो आज तक ठीक नहीं किया गया। आज तक भी ये हालत है कि कोई जना ठीक से रिपोर्ट कर ही नहीं सकता, और अगर रिपोर्ट करता भी है तो कहीं पर उसका कोई सार्वजनिक नहीं किया जाता डिटेल्स की किसने क्या रिपोर्ट किया। तो बहुत दुर्भाग्य की बात है कि हिंदुस्तान ने आज तक सारे जो मेडिकल स्टडीज थे उसको सार्वजनिक नहीं किया। हिंदुस्तान ने आज तक सरकार ने आज तक कोई स्टेटिस्टिक्स इसकी सार्वजनिक नहीं करी कि वैक्सीनेटेड वर्सेस अनवैक्सीनेटेड तरह तरह के इफेक्ट्स कितने परसेंट यहाँ हुए, कितने परसेंट वहां हुए, एक्सेस डेथ्स कितनी परसेंट यहाँ हुई, कितनी परसेंट यहाँ हुई। ये तो बिल्कुल एलिमेंट्री चीज है कोई देश को करने के लिए, लेकिन दुर्भाग्य की बात है कि ये अभी तक नहीं किया गया। तो मुझे बहुत खुशी है कि आप लोग आज यहाँ जमा हुए और इस चीज के बारे में चर्चा करी, और ऐसे महत्वपूर्ण लोगों को बुलाया जैसे डॉक्टर नटराजन, जिन्होंने इस पर बहुत ही शोध किया है, बहुत एनालिसिस करी है, बहुत स्टडी करी है. थैंक यू वेरी मच.
We have Colin sir speak and after. Thank you so much, Prashant sir. It was for that excellent speech. And as far as to go for some other event, he's taking lead. Now I request Colin sir to come and share his views with us. Colin sir, by the way, I need to say that as vaccine victims, we are very indebted to Colin sir because the case where Rachna ji and I are fighting in Supreme Court, we filed in October 21. And Colin sir is the one who graciously took it up to fight for us. And under his able guidance, we have come up to the stage of hearing on the 26th November. And I hope with all the awareness created and the support of all of you, we'll get a good hearing and a good judgment. Over to you, Colin sir.
So as Venugopal told you, we are doing 2 petitions. Use this. As Venugopal just told you, we are doing 2 petitions in the Supreme Court. To hold it closer. I'll do a bit of both here. There are 2 petitions in the Supreme Court by parents of young women who died very proximate to the taking of the vaccine. So I was not so educated in this vaccine conspiracy and so on. And I came to learn about the whole dark kind of conspiracy that existed around vaccines. तो फर्स्ट उदाहरण ये था, जो यंग लड़की थी, उन्होंने वैक्सीन लिया, वैक्सीन के कुछ दिन बाद काफी मतलब प्रॉक्सिमेट थे, तो बहुत जबरदस्त हेडेक हो गया. डॉक्टर के पास गया, डॉक्टर साहब ने कहा कि तुम पेन किलर ले लो, और तेज हो गया. Headache became even more severe, and the doctors keep prescribing painkillers and anti-allergy tablets and so on, which is an indicator that the medical community in India also, until recently, I think now the community is waking up. Too many doctors are dying. The medical community also had no idea that a kind of a clot in the brain or a clot in the heart or a clot in the stomach. You will forgive me, I mean, after listening to Dr. Natarajan, I feel a little hesitant to comment on these things because I know actually quite little and I've been learning as I go along in the case. So sad that you didn't know what to do with these young women, hale and hearty women who suddenly, and it's only, and they go to the best of hospitals as well. One went to Apollo and so on, and they don't know what to do with a vaccine-related rapidly developing scenario of death. And then at some late stage, some MRI is done, and then it's too late. And then मौतें होने के बाद भी कोई सच बोलने के लिए तैयार नहीं है, ऑटोप्सी ठीक से करने के लिए तैयार नहीं है, बताने के लिए कारण क्या है ये तैयार नहीं है. So even after death, nobody is willing to say, let's do an autopsy in a particular way. Let's find out what's happening. And let's at least tell the parents the truth as to why their children died. So for us, it's been for me personally, it's been quite a learning experience, which makes me actually quite angry, quite bitter, and quite resentful of this. And then you see on TV every day, all the rock stars of the medical profession, head of big institutions. And I know in our petition we documented, कुछ डॉक्टर ने कहा कि 100% safe है, और एक बदमाश डॉक्टर ने कहा कि ये 110% सेफ है। समय आना चाहिए कि एक दिन जब उसको सबको कोर्ट में लिया जाएगा और सारे लोगों के खिलाफ एक ऐसा केस करे ताकि उसका काफी नुकसान हो जाएगा। लेकिन बहुत मुश्किल का संघर्ष था, वेरी डिफिकल्ट स्ट्रगल। And one reason why it was very difficult, judiciary was not on our side. I heard, how it was said about the media. It was quite an eye-opener for me as well, because some of my friends are in those particular channels mentioned. And I knew that the media was not taking articles, because when we did the petition, हमने अखबारों के एडिटर के पास गए कि इस पिटिशन के बारे में कम से कम आप कवर करो. Whatever we are writing in the petition, at least you cover, but they were not willing to cover. But for me, the biggest setback कि जुडिशरी जजेस को पिटिशन को लेना वो तैयार नहीं थे. They were totally committed to the government narrative. और मेरे ख्याल से पिछले एक साल से for 1 year we are struggling. We have come up, I don't want to mention names, we have come up against different judges and different benches. And it's been a very, deterring experience to see that your Supreme Court, which is otherwise supposed to be so progressive on the vaccine, they were coming. इनका कहना ये था और बार बार जज साहब ने बोला कोर्ट में कि अगर हम ये पिटिशन को लेगा तो लोग वैक्सीन के खिलाफ होगा और वैक्सीन लेना बंद करेगा. That's a good thing, I thought. If after being told of what happens, they stop taking the vaccine and create vaccine hesitancy, I thought that was a pretty good thing, a pretty good reason to do the petition and come. But it was very difficult. Now we are coming very close to the final days of the case. I feel confident about the case. And in the case, I'll just briefly say, we moved in a very simple way. When I saw some of the presentations today, I think we have to go back this evening itself and collect all the information of this meeting, because quite a bit of this is not in our petition. Quite a bit is. Awaken India movement and the parents and, those who have suffered have done a heroic job, have done a very good job. But I think I saw some things here which we need to put in, particularly the latest studies to convince, which we do. And Venugopal, you have to do that right away. We have very few days, You've organized this meeting and we have very few days. And I'll take 2 minutes more, if you don't mind. I just want to tell you what we did was we compared the deaths in the UK where the same vaccine was used, and we know how many shots were given to how many people and so on. And if it's the same vaccine, broadly, I know the living standard is better, nutrition is better. This is the argument that we made. So if I'm wrong, if any of you think we were wrong in doing that, please tell us. And we compared it and we said, all right, how can we have so many declared deaths in the UK for the same vaccine, and you come to India, have such a minuscule amount of deaths declared, something like 10% of what it ought to be. Then, of course, we looked at the protocol, monitoring protocol. Prashant mentioned about the case that he did, but in that case, the judge has said, and we are stumbling against this casual observation, कि इंडिया में जो मॉनिटरिंग सिस्टम था, चेकअप सिस्टम जो था, मौतें होने के बाद वो काफी अच्छा रहा. He gave them a clean sheet. And I'm facing a little bit of headwinds here because I have to say that, that observation was made on a petition which didn't have details about active surveillance and passive surveillance. Passive surveillance मतलब ये है कि सरकार कुछ नहीं करेगा. तुम अगर एफर्ट करोगे, तुम फोन करोगे, तुम बार बार फोन करोगे और बार बार बताएंगे तो वो मुश्किल से वो रजिस्टर में लिखेगा, वो पैसिव सर्वेलेंस है। एक्टिव सर्वेलेंस मतलब अपने आप सरकार अपने आप जाना चाहिए चेकिंग करने के लिए, और हमारा देश में आराम से कर सकता है क्योंकि हमारे देश में आशा सिस्टम है। आशा सिस्टम हर गांव में होता है, आंगनवाड़ी सिस्टम हर गांव में होता है। तो सरकार के पावर है, मिलियंस ऑफ सोशल वर्कर्स इन द सिस्टम, इन द हेल्थ सिस्टम, मिलियंस। सो हर गांव में जहां 1 month, 2 months, 3 months, simple, no deed. But they never did that deliberately. No, even passive surveillance and so on. And then we did, I know, we collected some thousands of newspaper reports. क्योंकि हमारा प्रोटोकॉल में लिखा था कि look at your newspaper reports, document that and investigate everyone. So they don't do that. So these people have been killers. Those who ran the system were killers. The vaccine manufacturers, I have no doubt, were killers. I have no doubt that they knew it. And my sister operates in different circles from me. I work with a lot of working class people and so on, and human rights. My sister works in a little bit more rarefied atmosphere. She was telling me, I met these guys at a party, and they're all saying, we won't go anywhere near this vaccine. जो अमीर लोग हैं आपस में पार्टी में बोलते हैं, क्योंकि सभी को मालूम है वैक्सीन मैन्युफैक्चरर कौन है, सब दोस्त लोग हैं वगैरह, सब लोग कह रहे हैं कि हम वैक्सीन लेने वाला नहीं है, ये खतरनाक वैक्सीन है, हम लेने वाले। So it's like an open secret for the rich, and it's like a tragedy for the working class people. So that's all I want to say. I want to thank you all for everything that you did. Give me a second only. Yeah? And the only thing now is, where will the Supreme Court do? Will it support the parents? We don't want them to, we want them just to give a fair hearing to the parents and look at the data carefully. But I want to thank Awaken India movement and the parents and all the victims. Supreme Court कुछ भी करे, हम अगर बोलते रहेंगे angrily, politely नहीं, not politely. ऐसा very respectful बातें मत करना किसी से. No respectful talk. We have lost our children. We are full of anger. हमें गुस्सा है और हमें सरकार के खिलाफ, मीडिया के खिलाफ, वैक्सीन मैन्युफैक्चरर के खिलाफ हमें जोर से बोलना है. Only then will there be some change in the attitude of the people in power in this country. That's all. Thank you. Okay. Take a question or two.
जितने भी हॉस्पिटल्स थे जिन्होंने ये पूरा मास्क प्रोडक्ट किए थे, ये हॉस्पिटल्स जितने भी डॉक्टरों ने अपना ईमान बेच के इंसान को मार के इतने मर्डर किए, हमारे छोटे छोटे बच्चों को मार दिया, तो इन सब के खिलाफ आप लोग क्या एक्शन लेने वाले हैं?
मैडम, सबसे पहले ये कोर्ट में जो केस है ना
जी,
इनको जीतने दो पहले, फर्स्ट स्टेप. उसके बाद उन लोगों को गला पर पकड़ना पड़ेगा, गला पर पकड़ना पड़ेगा.
जी सर.
लेकिन समय अब नहीं है. एक बार ये सुप्रीम कोर्ट केस में थोड़ा सा जीत हो जाएगा, मतलब रास्ता खुल जाएगा, ताकि सच्चाई सभी के सामने आ जाएगा, तब इनको गला से पकड़ना. और बहुत सारी चीजें कर सकता है. मैं आपको फिलहाल नहीं बताऊंगा, लेकिन कानून में है और कानून के बाहर का भी रास्ता है.
सर एक और सवाल है सर, जैसे अभी जो पिछले बार जो हुआ वो हो चुका, लेकिन अभी रिसेंटली सभी स्कूलों में जैसे अपार आईडी के फॉर्म जगह जगह बच्चों के घर पे भेजे जा रहे हैं, और तुरंत अपार आईडी के कंसेंट देने के बाद तुरंत जो है मेडिकल टेस्टिंग की भी जो फॉर्म दे दिया गया है बच्चों को, पूरी लिस्ट है टेस्टिंग की स्कूलों में. तो वो जो हो चुका, जितने बच्चे मरने थे वो तो मर चुके, उनको हम कुछ नहीं कर सकते, लेकिन अभी जो हम बच्चों को बचा सकते हैं उसके लिए आप लोग क्या करने वाले हैं?
ये कौन सा वैक्सीन के लिए?
हाँ जी, सर ये HPV वैक्सीन का प्रचार किया जा रहा है बच्चों के टेस्टिंग के लिए।
सर्विकल कैंसर
टेस्टिंग की सर पूरी लिस्ट दी गई है कि स्कूलों में मेडिकल टीम आएगी और पूरी टेस्टिंग की जाएगी जिसमें ऑल ओवर बॉडी का पूरा टेस्टिंग, वो कुछ भी सैंपल ले सकते हैं हमारे बच्चों के लिए।
No, I know, because we did this case.
सर
मैडम एक मिनट मैं बताऊंगा आपको। ये केस हमने सुप्रीम कोर्ट तक किया और ये मैटर आया पार्लियामेंट्री कमेटी के सामने, और जनरली हमारा पार्लियामेंट्री कमेटी के रिपोर्ट्स बहुत ही घटिया सा रिपोर्ट्स होता है, लेकिन ये रिपोर्ट जो सर्विकल कैंसर का रिपोर्ट था, व्हाट वाज द नेम ऑफ दैट वैक्सीन? द HPV वैक्सीन। नो करेक्ट यस करेक्ट मैडम। इस रिपोर्ट आप देखोगे ना, व्हाट अ लवली, आई मस्ट टेल यू, एनीवन, आई फॉरगेट द नंबर ऑफ दैट रिपोर्ट, लेकिन द HPV वैक्सीन राज्यसभा स्टैंडिंग कमेटी ऑन वैक्सीन्स, वो रिपोर्ट आप देखोगे, पूरा जो कचरा है सिस्टम के अंदर उसमें इस पूरी तरह से लिखा A to Z।
तो सर हम लोग जो बच्चों को बचाने के लिए क्या करने वाले हैं?
मैडम हमें जाना पड़ेगा सुप्रीम कोर्ट में।
जी
पहले इसको थोड़ा करने दो, क्योंकि नवंबर में हो जाएगा, दिसंबर में हो जाएगा, लेकिन इसमें एक कैंपेन होना चाहिए पूरा देश में कि हम नहीं जाएंगे। हम सब देखिए मैडम, ये हमारा हक है, ले न ले हमारा हक है। तुम कुछ भी कहे मैं नहीं जाऊं, मैं अपनी बच्चों को नहीं जाऊं।
बट सर पिछले बार की तरह ही इस बार भी पेरेंट्स को मैंडेट बोला जा रहा है।
नहीं
फॉर्म पे लिखा है वॉलंटरी है, बट बच्चों पेरेंट्स को फोर्स किया जा रहा है कि मैंडेट है, और वो बोल रहे हैं पिछली बार की तरह कि ऊपर से ऑर्डर है। मैम फोर्स किया जा रहा है,
एक मिनट
फोर्स किया जा रहा है, वो उनको बोलना जा रहा है, डॉक्टर टीचर्स जो है वो बोल रहे हैं हमें ऊपर से प्रेशर है, मैंडेट है।
मैडम आपने जो कहा सच है, आपने जो कहा सब सच है
जी,
लेकिन पूरा मन का जो विचारधारा है उसमें परिवर्तन लाना, उससे झगड़ा करने से होगा, उसमें कैंपेन करने से होगा, उसमें हर एरिया में कैंपेन करने से होगा, है ना?
बट सर आप लीगल एक्शन इसमें कुछ करने वाले हैं?
लीगल एक्शन एक संभव है
जी,
क्योंकि ये वैक्सीन में, अपना ये कोविड वैक्सीन में सुप्रीम कोर्ट ने कहा कि किसी को फोर्स नहीं कर सकता।
सर मैं
तो वो जो है ऑर्डर है, ये HPV में भी इसका होगा।
तो मैं इसीलिए यही मैं कह रही हूँ कि हम लोग ग्राउंड पर अवेयरनेस कर रहे हैं, रोज कर रहे हैं, रास्ते चलते चलते पेरेंट्स को, बच्चों को पकड़ के हम लोग अवेयरनेस कर रहे हैं, बट उनका वही कहना है कि जैसे पिछली बार बोला गया था कि मैंडेट है, स्कूल वाले उसी तरह से अभी भी प्रेशराइज कर रहे हैं, मैंडेट है।
अरे ऐसा है, कोई भी मैंडेट दे सकता है, मैं जवाब दे दूंगा, सरल जवाब। प्राइम मिनिस्टर बता सकते हैं कि मैं ये करना चाहूंगा। प्राइम मिनिस्टर सबसे हाईएस्ट रैंक, मैंडेट अल्टीमेटली संविधान के हिसाब से डिसाइड किया जाएगा, ये संवैधानिक है या गैर संवैधानिक है, इज इट कॉन्स्टिट्यूशनल, इज इट नॉट कॉन्स्टिट्यूशनल। और कॉन्स्टिट्यूशन में लिखा है कि जबरदस्ती नहीं कर सकता, मैं नहीं ले लूंगा वैक्सीन, दैट इज द एंड ऑफ द स्टोरी, कोई फोर्स नहीं कर सकता।
I'll now open the stage for you guys. You can take a chair, ma'am.
Thank you.
We'll take the questions from there. Sir, up here. So we'll take the questions one by one, all right, and then हल्ला नहीं करेंगे, and then we have limited time, all right. तो just अपना question रखिए, आपको आंसर मिल जाएगा, and then repeat मत करिए उसके बाद चीजें। सबको मिलेगा मौका, सबको मिलेगा। कौन सर आप? You can keep this chair as well.
Depends on the question.
All right, one by one.
ये उर्दू में एक प्रोवर्ब है, तिल को ताड़ बनाना। आप लोग जो है जितने लोगों ने यानी दुनिया में कितने बिलियन लोगों ने जो है वैक्सीन लिया होगा, उसमें जो डेथ रेट है वो 0 पॉइंट समथिंग होगा। लेकिन आप जो है वैक्सीन के हवाले से जिस तरीके जो है तो वो भ्रम फैला रहे हैं, फियर फैला रहे हैं कि उसके एडवर्स इफेक्ट है, जैसा बीमारी के बारे में फियर फैलाया गया, वही टैक्टिक्स आप भी इस्तेमाल कर रहे हैं। व्हाट डू यू वांट टू से अबाउट दिस?
Can I answer in English?
Any line.
Sir, can I? See, firstly, the vaccine deaths currently, what we are saying is they are currently undercounted and underreported. We don't really have the proper counts. That's what we saw today in the graphs by Dr. Bhaskaran Raman. We saw that the excess deaths that happened in 2021 and also in the death graph of so-called COVID deaths in 2021, we see a clear spike after the vaccination, basically. So after vaccine, deaths have increased is what our contention is. Vaccine deaths are there and they are in big number, and it is easy to identify them. As Prashant sir said, if only they declare the vaccination status, and I challenge the government to declare a database of all the deaths that happened after vaccination started with their death date and vaccination date. Let us look at the date. Let us see how many deaths happened within weeks, within days, within weeks, and within months of vaccination, and what age group. We will very clearly see a very clear correlation with vaccination is what we are saying. And as far as we are concerned, you are saying we are creating a scare about vaccination. There is no vaccination going on now. I mean, COVID was created as a scare to drive vaccination. Now, what is that we are driving? What is our motive or to get anything? The only motive we have is two things: the justice for those who died, and to bring systemic changes in such a way that this cannot happen again. What cannot happen again? We don't want people's bodily autonomy to be violated. If they are bringing in an intervention, they should give full disclosure. They should give, hey, this is under emergency usage authorization. We have not completed trial. We don't know anything totally about it. It's up to you to take it or not. Give informed consent. Give chance to the people to take. And then that is number one, informed consent. And don't coerce. Don't say if you don't take vaccine, you cannot board a train, you cannot board a plane. That is coercion. So we are saying bring in systems to stop this 100% forever in future, and examine and give justice to all the people died. And we are not creating any scare. What scare are we creating? Thank you.
Next question.
Hi, good evening to all of you. Myself, Monica Rathor. I have this question that today I have this opportunity that all the eminent speakers are here from the legal fraternity, from the health fraternity. I want to ask for the legal fraternity that justice delayed is justice denied. Aren't you tired of seeing it in our country that, first of all, हमारे साथ अन्याय किया जाता है, फिर हमें कटघरे में खड़ा किया जाता है, और फिर जस्टिस के नाम पे हमारी आधी जिंदगी निकल जाती है. और ये हम आज से नहीं बहुत सालों से देख रहे हैं. And one thing I would also like to say that when I talk about you all here, you are like the pillars of our democracy. And because of that, under you, we are in your shelter. If you as a pillar is not ready, see today whatever we are doing, I'm very happy that we are talking about this today. But why didn't we speak about it at the beginning? Each one of you knew it very well, because I come from a software background. I know that any software in this world can be hacked. And I cannot get influenced by anyone. It is just like that we need to, I just wanted to ask that. Are we going forward with the resolution that we're going to make the change? Or are we going to take this tolerance again and again and come to these forums and discuss the problem? Can we for once discuss the solution? can we just for once stand? I don't want 1,000 people to come and stand for my people, for my country people, for everybody who has lost, right? I want, if one of you could come strongly, the ripple effects, everybody will come. So let's just stand. I don't want narratives coming, because I have seen whether it is healthcare, it's education, it's legal, it's judiciary. Whatever you are as the pillars doing, we are getting suffered. Please stop. Please help us from this suffering. Please help my people from this suffering. And yeah, that's my request. Thank you. That's all I wanted to say. If you have something to say on this, I would really appreciate. But I am a person, I have been told that, there is one thing in our lives which is being told. There is one thing which we experience, and then there is the truth. So I am the person, whatever is written, we are developing, we are this and that. No, there is a lot of hue and cry, whether you call it at the hospitals, education, wherever we go. As a country, as a nation, you are the pillar. I want to see you really strong, standing for it, and under your shelter, we need protection and right guidance going forward. Thank you so much.
Yeah, it's more of her opinion. Actually, I mean, I understand the sentiments. My point would be, what I have learned from this COVID saga is, don't try to stand in anybody's shelter. Like, look at your own facts. Like, don't trust anybody. Do your own research. That's number one takeaway I would give to everybody. At the same time, for the unlettered of this country, who are actually in general better IQ than the so-called studied, but still for their protection, we need better systems. That's necessary. Yes.
No, let me, is this working?
Yes,
Can you hear me?
Yes. जी
कमर्शियलिज्म का इज्म क्या है?
वो मैं समझाता हूँ आपको, एक मिनट।
मैं बताती हूँ आपको, आपको बताएंगे। कमर्शियलिज्म का इज्म ये है कि डर का रायता फैलाओ और फिर दहशत की ओगली में ले जाओ। हॉस्पिटल को इन्होंने दहशत की ओगली बना दिया और डर का रायता पूरे जन गण मन में सबके अंदर फैला दिया। तो उसके कारण लोग जो है डर के मारे, डर की वजह से, दहशत की वजह से बहुत सारे लोग मर गए।
सही बात।
मैम, आपको क्वेश्चन क्या है? क्वेश्चन है आपको?
हमें ये कि कमर्शियलिज्म का इज्म क्या है? तो इस तरीके से इन्होंने मतलब डर का
The next question.
Yeah.
No, let me answer. Please.
Haji, go for it.
Please, let me answer. I'll answer both the gentleman and the lady, because both have very valid points. Now the first thing is that now I'll speak in English, then I'll translate this into Hindi also. Let me first speak in English because I am more comfortable with that. Look, this pandemic began in 2020, 5 years back. In March of 2020, I had, this is still on YouTube, I had an interview with Karan Thapar. Thapar interviewed me, and I said point blank that the lockdowns are a farce. And I gave evidence that the lockdowns will not work. There is no science behind it, right? By May, I realized there was utter panic in this country. In my own hospital, the doctors were not prepared to touch a patient. They would not even come as close as 15 feet, from a patient. So that's when I realized that I had to make the videos myself. And we were under lockdown, remember. Everybody was under house arrest. Nobody was moving on the streets. But I was making videos after videos after videos. All of them were on YouTube. All right? All of them are still on YouTube. I kept telling people that don't be scared of the virus. Don't be scared of the lockdown. There is something called natural immunity. There is something called herd immunity. Keep the schools going, keep the schools open. But this is India. Nobody listened. Nobody watched. If you go even today, if you see my videos, barely 100 or 200 people would have watched them. Right now, I did my best. I've been doing this since 2020. I can't go beyond this. In 2020, I had spoken point blank. I had spoken clearly, without mincing my words, that the vaccines have a potential of creating havoc. All right. So what was the result? I was banned. I was removed from YouTube for 1 full year. I went on Twitter. I was removed from Twitter. And if I was removed from Twitter and if I was removed from YouTube, definitely there was a sabotage. Yes. Definitely the sabotage was done by the people in the media because they know these guys. All right. Why was I sabotaged? In the first instance, because I was telling people that why do you fear the virus when there is a cure? The cure is a very cheap one. That is ivermectin. There's a tablet of ivermectin. And I had cured hundreds of patients with COVID. People, across every age spectrum. People in their 20s, people in their 70s, people in their 80s. So there was a cure. The cure was freely available. It was cheap, right? So why do you fear the virus? I was telling them that. But this was not liked by the powers that be. This was not liked by them. So therefore, they sabotaged it. They suspended me. They suspended me from YouTube. They suspended me from Twitter. And they made sure that whatever I wrote was never published. That's why I said The Wire is a huge culprit. You see, it kept backing these vaccine pushers again and again and again. But I had been speaking against this. I kept telling people, even today, I'm telling you point blank, that they have lied from the beginning. They lied about the origin of the virus. They lied about the masks. They lied about the 6 feet distance. They lied about the lockdowns. They lied about the fact that the vaccines will work. The vaccines do not prevent infection. The vaccines do not prevent transmission. The vaccines do not prevent death. I've been saying this again and again for the last 5 years. And I'm not imagining it. I am a senior cardiologist, born and brought up in this city. But nobody watches, nobody listens. Even now, if I tweet, how many of you have liked my tweets? That's important. Not one of you has ever liked my tweet. Not one of you has ever reposted a tweet of mine. So you are, gloriously ignorant. So let's get these fundamentals clear. Okay, this is very, very important. And as to the fact that we are fear mongering, of course not. We are not fear mongering. The first video I made was, "ये बहुत डरो मत, घबराओ मत. हम इंसान लोग हैं, हमारे पास दिमाग है, हमारे पास होशियारी है, समझदारी है. हम इसको टैकल कर लेंगे. वायरस है तो क्या हुआ? इसको टैकल कर लेंगे. इतनी चीजें हम टैकल करते आए, हजारों साल से टैकल करते आए, इसको भी टैकल कर लेंगे." मगर आप देख ही रहे, मौतें बढ़ रही हैं. एक्सेस मोर्टेलिटी क्या होती है? हम लोग बात कर रहे हैं एक्सेस मोर्टेलिटी की. लेट मी डिफाइन व्हाट इज एक्सेस मोर्टेलिटी. एक चीज होती है मोर्टेलिटी, कितने लोग मर रहे हैं. एक होता है एक्सेस मोर्टेलिटी. एक्सेस मोर्टेलिटी ऐसा होता है कि 2015 से 2019 को लेके चलिएगा, 5 साल हुए, उसमें देखिएगा कितने लोग मर रहे हैं. वो आपका बेस लाइन हो गया. तो 2020 से लेके चलिएगा कितने लोग मर रहे हैं, वो बढ़ता है. उसको एक्सेस मोर्टेलिटी कहते हैं. Right? You take the average of 5 years, 2015 to 2019, you get the average death rate. That is your basal death rate. Then you see the death rates from 21, 22, 23, and you find that there are more deaths. That is excess deaths. That is 30%. America में आ गया that between 25 and 45 years, excess death has been about 45%. From 45 to 65, the excess death is about 30%. That's a huge number. Huge number. This is data. This is from the insurance company. This is by a book in David Dowd. तो हम लोग जो बातें कर रहे हैं, बड़ी गहरी बातें करते हैं. मैं शुरू से मैं यही कोशिश करता हूं कि उसको मैं आपको साधारण लफ्जों में आपको समझाऊं. मगर जो चीज है बीत चुकी है. मैंने वो आपको स्लाइड भी दिखाई थी. इस बात को आप गौर से सुनिएगा कि 30 से 35% जो वैक्सीन इस्तेमाल हुई थी वो नकली थी, वो पानी था. वो यूरोप में हुआ था, हमारे यहाँ भी हुआ होगा. तो अगर आपको वैक्सीन लगी और आपको कोई दर्द नहीं हुआ, कोई बुखार नहीं आया, तो वो डमी थी. अब मेरे पास कोई प्रूफ तो है नहीं, बट हमारे पास डेटा है जो छप चुका है. आगे कैसे देखेंगे? जैसे वक्त गुजरता जा रहा है, आपके रिस्क कम होते जा रहे हैं. You see, as the time goes on, your risk of developing this stuff, these problems, acute problems, like a heart attack or a stroke or a clot, they are diminishing. They've already diminished. What has happened has happened. So ये लोग जो आए बेचारे, इनकी औलाद गुजरी है, मरी है. तो फिर तो वो हमें उसको बड़े मतलब कैसे उसका गौर करना ही होगा हमें. We have to reflect on this. It's not a joke. है ना? एक बच्चा है जो मैं कितनी बारी मैंने कहा अपने वीडियो, अभी देखिए कभी भी लगे हुए वहां पर, कितनी बारी मैंने बोला कि बच्चों को बीमारी लगती ही नहीं है. जर्मनी में 2 साल में एक बच्चा मरा नहीं कोविड से. इंग्लैंड में 2 साल में शायद 6 या 7 बच्चे मरे जो वैसे ही बहुत बीमार थे. तो बच्चों को ये बीमारी पकड़ती नहीं है. क्यों नहीं पकड़ती वो बाद में बताऊंगा आपको मैं. मगर बच्चों को ये बीमारी पकड़ती नहीं है, तो इनको वैक्सीन क्यों लगा रहे हो आप खामखा? क्योंकि आपकी नीयत ठीक नहीं है. You had an ulterior motive. That is why you insisted on injecting children with this vaccine, knowing very well that the children were not to be harmed with this virus. Correct. That children don't die, they don't get infected. And it's a tragedy. We knew then, and I should keep telling this, that girls are even more protected against this virus. I kept telling that. Here I'm listening, watching all these girls dying. So they were never to, should have never died. are doing it. In America, these guys are vaccinating 6-month-old babies with the mRNA vaccine. You see? मगर जब मैं बोलता हूँ लिखता हूँ इस पर कोई बात नहीं करता. कौन सा वेक इंडिया मूवमेंट है? तो सोरा मूवमेंट है. मैं बोल रहा हूँ, अब मैं दिल की बात कह रहा हूँ. मैं कितने से 5 साल, यार, it's half a decade. For half a decade, I'm saying these things, you know, and I must be the eldest person on this platform here. Yes. Yeah, I may be looking slightly younger, but I'm elder to all these people here. When I'm telling you that, you know, all these points I've made, I've raised these points, how are you making affidavits in the court without data?
We have,
you know,
whatever we get hold
I mean,
of, we
look,
have,
I just told you, you start your argument with this, you begin your argument by saying, look, when the entire West has banned this vaccine, why did you permit this vaccine to be distributed in this country?
Right. So actually, that's what we wanted to ask on.
And the data is there. The data has already been published. This is not concealed data. This is not concealed data. This is open data. This is overt data. It was free of cost. All this data was being published. You don't have to be a member of that journal or subscribe to that journal. This was free of cost.
Question your question has spoken is not because I'm doubting your intention. Because of you people today, because of your data, because of your discussions, we are able to speak this much. Otherwise, who would you think that who would give us this data? Nobody is there. But sir, the point is, I always feel that we miss the main point, which is that we need to fight with the censorship, not with your or my intention, with the censorship. Because yes, we have things to talk, right? But we get censored everywhere. Because right now,
The only platform is X. Let me be frank with you. Let's be practical.
Now he's raising.
No, right now I'm very active on X. Thanks to Mr. Musk. You know, I have been reinstated last year. So therefore, the best thing that you can do is also, because you must understand that the Times of India will not give you honest viewpoints. Indian Express will not give you the truth, right? The Wire will definitely not give you the truth. So go on X, go on Rumble, go on Odyssey, go on these platforms, particularly on X, and you know, punch in COVID-19 sudden deaths, myocarditis, and you'll get the information and spread it. If you find somebody, if you find that somebody is talking of these things, then you disseminate it. Nobody disseminates. I don't understand. Where is the Awaken India movement? We are not going to be awake.
is that instead of following the national news, let's follow people like them who are really standing for
आपने आपने बोला कि फेयर फैला रहे हैं. अभी कोविड का हुआ, एचपीवी वैक्सीन, सर्वाइकल कैंसर वैक्सीन के नहीं, आपके लिए नहीं कह रहे, आपके पीछे जो भी क्वेश्चन आया है, तो आप उसके लिए, जैसे डॉक्टर साहब ने बोला, आप लोगों में से कितने लोगों ने पढ़ा है? मैंने भी लास्ट ईयर की से नो टू एचपीवी वैक्सीन करके मैंने पूरी वीडियो जनरल पब्लिक के लिए बनाई है. 3000 लोगों ने देखी है सिर्फ. आप लोग ना तो पढ़ते हैं और फिर उसके बाद ब्लेम लगाते हैं कि भाई ऐसे. एवरेज पर्सन जो है ना इंडिया का, जो रिमोट विलेजेस में भी है, अगर आप देखेंगे तो उनको मैंने देखा है इंस्टाग्राम चलाना आता है. मतलब अनपढ़ लोगों को भी, उनके बच्चों को जो काम करते हैं, उनके बच्चों को इंस्टाग्राम और फेसबुक चलाना आता है. उसमें वो वीडियोस डालते हैं, अपनी रील्स डालते हैं, सब करते हैं. बट दे आर नॉट स्टडिंग. कुछ भी जो आ रहा है, जो प्रॉब्लम्स आ रही है, उसके बारे में कोई नहीं पढ़ता है. तो जैसे आपने बोला सर्वाइकल के, अभी आपने बोला फियर कर रहे हैं, तो सर्वाइकल कैंसर के बारे में क्या पढ़ा आपने? वैक्सीन के बारे में क्या पढ़ा? और बहुत सारा डाटा जो है, हर, अब डॉक्टर साहब ने भी दिखाया, उसमें एक जैसे डेथ, एक को हॉस्पिटल में एडमिट किया, सबके आगे एक लाइन लिखी रहती है, सीम्स नॉट टू बी रिलेटेड टू द वैक्सीन.
Correct. That's the first line.
फर्स्ट लाइन. आप एचपीवी वैक्सीन के बारे में देखेंगे, सुसाइडल टेंडेंसीज, कार एक्सीडेंट्स, इंडिया में भी गुजरात और आंध्र प्रदेश में जो डेथ हुई 7 में, उसमें सुसाइड मतलब ड्रोनिंग से हुई. 1-2 लड़कियों ने सुसाइड किया, एक को स्नेक, मतलब उनको बोला कि स्नेक ने काट लिया. एक्सीडेंटल डेथ्स हुई हैं उनकी. तो यू हैव टू रीड. मतलब अगर आप पढ़े लिखे हैं और चीजें प्रॉब्लम में हैं, तो आप अगर पढ़ेंगे नहीं, पूरे डेप्थ में नहीं जाएंगे, तो आपको प्रॉब्लम्स आएंगी. क्योंकि देखिए, मैंने बताया ना, इंडिया तो मैक्सिमम, ये जो कंट्री है ना, इसमें पॉपुलेशन आप जानते हैं हमारी कितनी है, और बहुत लूप होल्स हैं. 750 रुपए देकर यूनियन कार्बाइड फैक्ट्री के वर्कर के ऊपर एक्सपेरिमेंट किया विदाउट कंसेंट. तो इंटीरियर्स में ये सारा एचपीवी का ट्रायल जो बंद हुआ, वो आउटक्राई हुआ, वो सारा ट्राइबल गर्ल्स के ऊपर हॉस्टल में वार्डन की कंसेंट लेकर हुआ. कुछ नहीं बताया गया, क्योंकि पैसे का गेम है. बहुत सारा कंपनीज जो है बहुत बहुत सारे डॉक्टर्स दे हैव बिकम रिच आफ्टर गिविंग द HPV वैक्सीनेशन. तो यू हैव टू रीड, यू हैव टू सी योरसेल्फ फॉर सर्टेन थिंग्स. ये नहीं है कि ये जो भी चीज ड्रग आई वो बहुत अच्छी है. हम लोग कैंसर में भी ट्रीट करते हैं, इम्यूनोथेरेपी पेशेंट्स करते रहते हैं कि हमें ये चाहिए, बट दे विल नॉट चेंज देयर लाइफस्टाइल, दे विल नॉट ईट हेल्दी. तो ये आप लोगों को भी देखना है कि लाइफस्टाइल क्या चीज है, क्या लेटेस्ट आ रहा है, इसके प्रॉस एंड कॉन्स है क्या. कुछ ना कुछ तो कहीं ना कहीं जरूर मिल जाता है आपको, आप डालेंगे तो मिलता है.
तो इसका मतलब ये है कि मुझे जिंदगी सेक्रीफाइस करनी पड़ेगी. Ma'am, it is you. So when we walk up to a lawyer, when we walk up to a police, when we walk up to a doctor, we are assuring ourselves that we are not the master in this subject, but they are. They will guide us. Good. अब आपने मैम एक चीज बोली, I have experienced this myself. कि मुझे कॉलेज में 3 months तक कॉलेज में एंट्री नहीं दिया मैम, और मुझे बोला गया जब तक नहीं होगा. मैं प्रिंसिपल ऑल्सो अबाउट इट. So मुझे डॉक्टर से, I went to my family doctor and I said, sir, that you and I know it very well that vaccine is not safe. Can you do me a favor and write me on a paper that this girl due to her health condition cannot take this vaccine? He said, I will not write that. You take vaccine, you die. I can take this call, but I will not write that. Why? Because if I do it, I'll lose my job. So for him, I was a family, he was a family doctor. I was not important. What was important is his job. And because for saving his job, I can also say one thing, ma'am, for a physician, for a doctor, or for any profession, in that throughout their life, how much do they earn from the government? They might have 5 CR, 10 CR, 20 CR in their bank account as a whatever. But do you know that how many lives they are spoiling? How many families by their decisions?
मैडम ये आप
Ma'am, we have to stick to our schedule. If you have a question, you can ask.
This is not
Yes,
the
sir.
question.
Let's move on.
Correct.
So data the government provide करती है ना?
No, I do have data, sir, actually. Currently, the AEFI system, the government is the body that collects data. Private doesn't collect. Private, in fact, AI, Awaken India movement has done a fantastic job of collecting data from all the published materials, like in the media, the social media and other thing. And there are about 19,000 deaths from news articles with proof and everything, link and proof and paste everything. They have an Excel and they've shared it also in the press release. The link is also there. And they, after the Corbevax was released for the 15-year-old onwards, like at that time, the Covaxin plus Corbevax, that combination, 100 plus children died. So that also with children's death detail, Awaken India movement has published as a thread. So much only private people can do. It is the government which is supposed to do the next. And what is the government doing? Government today has published, as far as COVID vaccine is concerned, we have close to 3,000 published AIFA cases, only 3,000. And last year in 2023 itself, they declared they have about 25,000 AIFA records in the system in 2023. We don't know how many are there now, as of now. And there is no provision to record AIFI by common public in the system. I can demonstrate that right now. If I can connect my laptop, it doesn't work. The COVID portal doesn't work. I will demonstrate now. I'll excuse myself and demonstrate while others talk. So the point is, if you ask me how many people have adverse reactions, as per the government published AIFI data, there are 3,000, of which 1,110 are deaths. Imagine that, 1,100 deaths out of vaccination are there in AIFI system. So how many are adjudicated? I don't even know. So much is there. And as we saw in the data published by discussed by Dr. Raman and Dr. Deepak Natarajan, 1 in 800, we think about 1 in 800 as what kind of number we are talking about in a country like India. We'll get lakhs and crores of adverse events. And if you look at people, all you need to do is just go to Google and search for neurological adverse events after COVID vaccination. I will demonstrate that also before this press conference ends. I'll excuse myself. I'll show you both. And I'll show you what a big list you get for each of them. And many of us are suffering that we don't even connect it to vaccine. We just say, okay, we get it and we move on. Actually, we are getting it after 2 months or 3 months after vaccination. We think, okay, it is something happened to me, and we go to doctor, start spending money. I'll show these two things right now.
मेटफॉर्मिन में एक्स्ट्रा साइड कोई मेडिसिन आनी शुरू हो गई है जिसके कारण हमारे को लूज मोशन भी होती है। तो ये जो एक्स्ट्रा साइड है इसकी तो साइड इफेक्ट मैंने उसमें देखे हैं, मेरी डॉक्टर ने मुझे बताया कि ये दवाई मत खाओ। मेटफॉर्मिन मैं डेली लेती हूँ 500 मेरे 500 की, मतलब सुबह शाम। और शुगर है क्योंकि मेरी शुगर भी कभी ऊपर हो जाती है कभी नीचे, लेकिन जब मैं वो दवाई लेती हूँ और ये दवाई में ये ग्लिसरा साइड रेड कलर का लिखा होता है, इतना बरीकता मैं देख नहीं पाई थी। मेरी डॉक्टर ने आकर के बताया मैंने कि इसमें 4 साइड इफेक्ट है लूज मोशन में, क्योंकि मेरे को 4-5 दिन तक होते फिर मेरे होम्योपैथिक दवाई ली, उसके बाद मैं कहीं जा पाई 4-5 दिन तक नहीं जाती, उसके बाद मैंने दवाई खानी बंद कर दी। तो गवर्नमेंट से 3 ही दवाई थी। आपका सवाल क्या है? मेरा
सवाल क्या है? देखिए आप कह रही है आप कोई दवाई खा रही हैं जिससे आपको लूज मोशन हो गए। अच्छा, अब जो अहम बात है, ये जो सेशन जो हो रहा है ये तो वैक्सीन के बारे में हो रहा है और आप दवाई की बातें कर रही हैं। अच्छा ना, नहीं ये वो
मैम वी हैव लिमिटेड टाइम, तो लेट्स टेक क्वेश्चंस। प्लीज कीप योर क्वेश्चंस कंसाइज सर, छोटा क्वेश्चन पूछो प्लीज।
उसका जवाब मैं दे सकता हूँ आपको, जवाब दिया उसका। आप जो है वो ग्लिसराइड हटा दीजिएगा, मेटफॉर्मिन खाइएगा। मुझे आप जो दवाई ले रही हैं उसमें कॉम्बिनेशन है।
मैम आप 1-on-1 क्वेश्चन पूछ लीजिएगा लेटर।
नहीं जरूरी नहीं, आप वो भी दवाई ले सकती हैं, आप मिलती है दवाई।
My question to my questions to doctor. So it's more of a personal question. So I want to thank Venugopalan ji for coming me here and explaining my case here. Soon after this question, I need to leave to the airport. My personal question is, because of the first dose of vaccination, I experienced thrombosis, and after 8 months, based on the doctor advice, I've taken the second dose of Covishield vaccine. I developed homocysteine. It was started varying, and at the same time, I also had the heterozygous mutation of the vaccine. So, doctor has advised me to go for the Ecosprin all the time, in the sense throughout my life. Should I go with the Ecosprin? Because as you know, Ecosprin, generally the hematologist suggests that in US and other countries, generally after 50, it is advised to go for the Ecosprin to safeguard your heart. I think same culture is also coming here, I don't know. So he said, this is for your lifetime, you have to take. Continue with Ecosprin. Any wounds, it will take longer heal time. So what is your advice on?
You don't have to follow me, but I would not advise Ecosprin for your entire life. Number one. Number two, if your homocysteine is raised, you have a vitamin deficiency, that is B6, B12. You check on that and sort it out with that. Homocysteine has got not much of a connection with your blood clot. All right, get that very clear. And just because you're obviously overweight, I mean, you're not doing any exercises. You got to sort yourself out. How old are you now?
I'm 50 now.
50.
Yeah.
That's great, but you are definitely overweight. So you need to, knock off your weight. That's very important.
Okay.
And don't worry too much about homocysteine. Because the trick is that homocysteine can be raised and you can bring it down by a vitamin, but that doesn't really help, So
it has become so much that every 3 months, 4 months, I have to go and visit him to see.
Why visit him? No, you don't have to visit him. You don't have to visit.
Homocysteine is an inflammatory marker also. Okay, so you have to don't mind in public. See, you have to manage your lifestyle also and see which type of the vaccine you got. Spike protein, if it is a spike protein, you need to measure that also. So, and regarding the Ecosprin, Dr. can tell you better. But homocysteine is...
These chaps have a protocol there to knock off the spike protein. They use nattokinase, bromelain, and curcumin. So we have a lot of curcumin. We use what's it called, haldi, right? So you step up your haldi in your diet. That will be anti-inflammatory. That will help. Okay.
Next question.
मेरी ये लिखी हुई किताब है और ISBN नंबर मिला हुआ है मेरा, जरा प्लीज।
Can I ask a question?
Yes, please.
Yeah. So like doctor,
टूटते विश्वासों के खंडक मैं बहुत फ्लावर में लिखती हूँ इसलिए क्योंकि मुझे लगता है कि जहाँ गलती हो
हाँ जी. So जैसे डॉक्टर नटराजन ने बताया कि काफी टाइम से वो इस पे बोलते रहे हैं कि दिस इज प्योरली इट इज अ फार्स की जो जो चीजें जो रिस्ट्रिक्शंस लगाई गई थी या कोविड के टाइम पे 6 फीट की दूरी और बाकी सारी चीजों के बारे में, तो मैं काफी टाइम से उसको सुनता रहा. वैक्सीन के बारे में एक परसेप्शन बनता गया कि एटलीस्ट कोविड की वैक्सीन जो है दैट इज नॉट सेफ एंड दिस इज प्योरली अ कमर्शलाइजेशन या बहुत सारे जो भी उसके पीछे के स्टोरीज है. तो अभी अवेकन इंडिया मूवमेंट के साथ जब से वी हैव जॉइंड अवेकन इंडिया मूवमेंट, तो उन्होंने हमें अप्रोच किया फॉर द एचपीवी वैक्सीन. तो लाइक कॉलिन सर सेड कि राज्यसभा की रिपोर्ट है, वी वेंट थ्रू ऑल दीज रिपोर्ट्स एंड वी सेंड द लीगल नोटिसेस टू द अदर स्टेट गवर्नमेंट्स की एचपीवी जो रोटरी क्लब के साथ वो मिलके कर रहे हैं, तो दैट शुड बी स्टॉप. तो हमने उसके ऊपर लीगल नोटिसेस सेंड करे. बट मेरा क्वेश्चन फिलहाल ये है कि आज जितना ज्यादा हम इस चीजों के बारे में स्टडी कर रहे हैं, लाइक एज अ पर्सनल आई एम अ लॉयर, बट जैसे जैसे मैं इन रिपोर्ट्स के बारे में पढ़ रहा हूँ और चीजें पता चल रही है, तो पर्टिकुलरली जो बच्चों को वेरी से बाय बर्थ जो वैक्सीन दी जाती थी हमारे टाइम पे, इफ आई रिकॉल, तो बहुत कम वैक्सीन होती थी एंड एज ऑन डेट बहुत ज्यादा हो रही है. तो व्हाट इज योर से ऑन दैट कि अब जो वैक्सीन है तो वो कितनी सेफ है या उसका क्या रिक्वायरमेंट है, तो उसके ऊपर आई वांट टू आस्क, दैट इज माय क्वेश्चन.
You've asked a massive question. That's a massive subject about the vaccine schedules in this country. This is not the time to answer those questions.
Like
That is another rabbit
we are
hole.
discussing the safety of a vaccine.
No. We are discussing the mortality because of COVID vaccines, by and large, and how to tackle them, how to
but there are reports ki
True. Therefore,
so
that is one rabbit hole which you will have to go in and talk, or we have another forum. I'm prepared to speak on that in another forum because that's a 1 hour lecture, at least, if not a 10 hours lecture. We're going to talk about every vaccine. There's a Hep B vaccine, Hep A vaccine, you have DPT vaccine, the problems with them. You have influenza, you have H influenza vaccine. So we can't carry on talking about all of that. People will get bored and it would serve no purpose. There's a lot of problem. The best thing you can do is go right now on Twitter, go right now on YouTube, watch RFK to talk about all these vaccines. Okay?
This is the list of ingredients present in different vaccines. You can read about them.
We should speak only on vaccine, COVID vaccine.
Right, COVID or HPV?
Because the subject is COVID vaccine only. There are a lot of other vaccines and other medicines. This is not a platform for that.
See, Awaken India Movement publishes a lot of content about the HPV vaccine, and it's on Twitter and on our website as well, awakenindiamovement.com. You can go there and check it out. Next question. Okay.
I just will take 1 minute to explain this.
Yes, please.
1 minute, just 1 minute. I'll just show you this. See, this CoWIN, this is the portal where we are supposed to register the adverse events. And see here, they've given us a provision called report side effect. See, report side effect. Okay, when you go and click that, this is what you get. So the people of this country, they can't register a side effect. And then you say where is data for adverse effects? You will not get data because they have not made a provision to register. So you can try it yourself. See, the reason for that is also pretty simple and stupid. What they have done is they have put a free certificate here in this particular place, which expires every 90 days. And when somebody in that company, when somebody in that place, they renew the certificate, it works. Otherwise, it doesn't work. And even now, like, see, for example, this certificate expired on 3rd November. Okay, 3rd November 2023, and we are on 19th now. All these days, nobody would have been able to register if we had a problem. Okay, so this is the kind of adverse event reporting that's available in the country today in response to a Supreme Court judgment that came in May 2022, where they said you have to make a provision for people to register. Before that, even this was not there. Only doctors had the provision. And I understand today the doctors also could not register properly because half the time it was not working. So obviously you would not have data. What was the second question? I said I'll demonstrate. I forgot. Neurological. I'll show that. See, I'll demonstrate that now. Just a second. Yeah.
So I also have to leave.
Oh, I'm sorry. See, okay. Yeah. Any more questions?
Any more questions? I think that's it. Thank you, esteemed judges, for coming here.
Thank you very
For
much.
the entire panel,
Thank you very
doctors, lawyers. And thank you for everyone who turned up today, and then our press members who came here to cover the event. We are really thankful, and we hope that you make this story reach every corner of the world. Thank you. I appreciate it.